Just one moment. I'm not seeing our Zoom on our program, on our live stream, on our Granicus live stream. Thanks, everyone. Well, we ensured that our Granicus viewers also saw the Zoom group, and now they can. So, Chair Hopkins, we're ready to begin when you are.
Thank you very much. Please note that Spanish translation is available in Zoom. To select translation services, please click the globe icon on the Zoom screen and select Spanish. If during any public comments, a commenter is speaking in Spanish, our English-speaking participants may go to the globe and select English to listen to the translation of the comment. I will now ask that Julie please go ahead and share this message in Spanish. Thank you so much, Julie. Always appreciate it. And thank you to your translation team for providing our translation services throughout this year. So thank you. So with that, we are going to go ahead and begin with the Pledge of Allegiance. And I am hoping that Assistant CAO Christina Rivera can go ahead and lead us in the pledge this morning.
I pledge allegiance to the flag of the United States of America and to under God, indivisible, with liberty and justice for all.
Thank you so much, Assistant CAO Rivera. And with that, I will go ahead and begin with a roll call because we do have one board member who is participating remotely this morning. Marcy, would you go ahead and lead us in a roll call, please?
Certainly. And I can attest to the fact that Supervisor Gore is here in Zoom, and we're still not seeing the Zoom view on our Granicus live stream. So we'll move ahead and I'll go check on that in a moment. Supervisor Gorin, absent. Supervisor Rabbit.
Here.
Supervisor Corsi.
Here.
Supervisor Gore.
Here.
Great.
Here.
Chair Hopkins.
Present.
Assistant County Administrator Christina Rivera.
Here.
And County Counsel Bob Pittman.
Here.
Thank you very much, Marcy. And Supervisor Gorin did let me know that she's running just a few minutes late today, and she said to go ahead and get started. And I believe that she will join us in time for the regular calendar. So with that, we can go ahead and move on to the approval of the agenda. And Marcy, I would ask you to lead us in a roll call vote on the approval of the agenda, please.
Supervisor Rabbit,
Aye.
Supervisor Corsi,
Yes.
Supervisor Gore,
Yes.
Chair Hopkins.
Yes. And with that, we will go ahead and move on to the consent calendar. I did not have any requests today for removing anything from the consent calendar. So I will go ahead and see if we have any members of the public who are in person here in the chambers today seeking to comment on the consent calendar. Over to Marcy to see if anyone from Zoom would like to go ahead and make comment.
Thank you. For any of members of our public who are in the Zoom meeting, if you would like to make a comment on any of the consent calendar items before the board today, please raise your hand in the Zoom app or press *9 on your phone keypad. And there are no hands raised.
Thank you, Marcy. So with that, I will go ahead and ask for a roll call vote on the approval of the consent calendar.
Supervisor Rabbit,
Aye.
Supervisor Corsi,
Yes.
Supervisor Gore,
Yes.
Chair Hopkins.
Yes. And actually, we were just joined by Supervisor Gorin. So if we could, if Supervisor Gorin, if you would like to vote on the consent calendar, you are just in the nick of time. Aye. I hear an aye from Supervisor Gorin. So that is unanimous with all 5 board members voting in favor of items 1 through 8. With that, Marcy, I want to check in on how we're doing with Granicus live stream and the Zoom. Would you like to take a pause so that we can ensure that folks are able to view, since we'll be receiving presentations from Zoom? Do you want to make sure that's working before we start off with the COVID update?
Thank you, Chair Hopkins. From what I can see now, it looks like we can view the full Zoom in Granicus, so we should be able to continue.
Perfect. Thank you so much, Marcy. And thanks so much to you and your team for troubleshooting any of our technical difficulties. So with that, we will go ahead and move on to our regular calendar, starting with item 9, the COVID-19 emergency response update. And I will hand it over to Tina Rivera, our interim director of health services, Dr. Mace, our health officer, Dr. Shende, our public health disease control specialist, Kate Pack, our health programs manager, and Paul Gullickson, our communications manager.
Good morning, Chair Hopkins and Board of Supervisors. We're happy to present our COVID-19 emergency response strategy update today. And with that, I'll turn it over to Dr. Sundari Mace, who will begin our presentation.
Great, thank you so much, the board, supervisors, Tina Rivera, and everybody else for participating. Today, we have an update on the COVID-19 response. Let me just share my screen and pull up my slides. Okay, can everybody see these okay? All right, fantastic. Okay, so as of today, you can see that our county-wide trends show that we have increasing numbers of new cases per 100,000 residents per day, and our testing positivity also continues to rise. So as you can see, as of yesterday, we had 9.8 new cases per 100,000 residents per day. Our overall test positivity is 4.6%, and our test positivity in the lowest Healthy Places Index quartile is 6.9%. All of this is about 3 times, a little bit more than 3 times for the new case rate, where we were about 2 months ago, or maybe 10 weeks ago, when right before the blueprint was that we left following the blueprint. Our COVID-19 hospitalizations remain above 40 per day, and we were at 10 or under a few months ago. And we've had 14 deaths from COVID since June, and you can see that it's all depicted in these graphs. Our hospitalizations are up, test positivity, new cases. Our vaccination status is still really good compared to the rest of the state. However, you can see our new cases per day per 100,000 residents by vaccination status is quite different for people who are unvaccinated versus those that are fully vaccinated. Sorry for the noise. Just a second. Okay, so our unvaccinated population, 1 second. So our unvaccinated population, you can see that the case rate is 17.5 new cases per 100,000 per day. And amongst our fully vaccinated population, that case rate is actually quite a bit less, 4.2 new cases per 100,000 per day. And this disparity is more clear over time. So as we go into this increase in cases, those who are unvaccinated are actually much more likely to become, as you can see from this graph. And as we saw, the age of our cases in the past 60 days continues to occur in the younger population, with those 20 to 29 making up 18.5% of our cases in the last 60 days. And we don't have as many cases in the older population, and this really is due to vaccination status. So 72% of our cases are happening amongst individuals who are 49 and younger, and the majority are happening in that 20 to 39 year age range. And that's where we, as you'll see shortly, that's where we have not vaccinated the same numbers. We are conducting now more tests per day than we were last month. We are now doing 233 tests per day per 100,000 residents. We had gotten under 200 about 3-4 weeks ago. The state median is slightly less than what we're testing. The state median is at 223 tests per 100,000 residents per day. So we're still doing pretty well, being above the state average, but our test positivity is increasing overall, and it's the highest amongst Latinx and Black residents, 9.3% and 10.6% respectively. And again, we're seeing the greatest test positivity individuals that are younger, 25 to 34, and those that are 55 to 64 years of age. And again, we still see the disproportionate rate of cases per 100,000 among Latinx that have residents who have the highest rate. And you can see that Pacific Islanders, American Indian, Alaska Native, Black, African American, Asian, and multiracial are also higher than our white non-Hispanic population. And the case trends are also, these are case numbers per 100,000. And you can see that the populations that are very low, even though they don't have as many cases, the case rates are much higher in our Black African American population, American Indian, Alaska Native population, and then multiracial, Latinx, and so on and so forth. But again, case rate depends on underlying population size. So we are seeing increased cases in those that have a lower population size. And the Delta variant is playing a big part of this increase in cases and rates and numbers, as we're seeing throughout the country and throughout the state. It's highly transmissible and now accounts for 83% of cases in the United States. And the Delta variant has been identified in 135 Sonoma County case samples as of July 23rd. And we are expanding our local surveillance to be able to, hopefully in the next few weeks, do genotyping or find out what the variants are in every single case that we can do that for. And that'll give us a better idea of what percentage of our cases actually are Delta versus other variants. Delta does spread quickly, especially through the unvaccinated and partially vaccinated populations, but also in vulnerable populations, the elderly, as well as those with underlying medical conditions, even if fully vaccinated. And the research indicates that this variant may increase the risk of hospitalization. And we've seen an increase in hospitalizations, as I just mentioned. The COVID positive hospitalizations are averaging about 42 hospitalizations per day in the past 2 weeks. And since June 1st, 83% of those hospitalized with COVID-19 and 100% of COVID positive ICU patients are unvaccinated. All of our fully vaccinated hospitalized patients, that's the other 17%, had other significant underlying conditions. So again, we're seeing this big disparity between unvaccinated and vaccinated individuals, not only in case rate, but also in hospitalization and how sick they are in terms of going to the ICU as well as in death. We did have the Sam Jones shelter outbreak that we discussed in the last presentation. And as of July 26th, of 153 of the shelter residents, 110 tested positive for COVID-19. And as you can see here, the 54% of those 153 shelter residents were fully vaccinated. 64 of the 110 that tested positive were fully vaccinated. But I want to remind everybody, of course, that this is an older group of people with underlying medical problems and homelessness as a big risk factor. So we are seeing cases in fully vaccinated individuals who have those kinds of underlying risk factors. 9 of our shelter residents were hospitalized, 6 have been discharged, and 3 remain hospitalized at this time. Now, the presentation of Dr. Shende, our vaccine chief, to tell us about where we are with vaccine administration. Thank you.
Thank you, Dr. Mace. Good morning. So we reached another milestone over the weekend in that we reached 70% of our Sonoma County population being fully vaccinated. If we all can remember as far back as 6 months ago, at that time it was said that 70% would be what is required to achieve herd immunity. Of course, we know that things have changed, as Dr. Mace was discussing. The variants have changed those goalposts to some extent, and we plan to continue vaccinating to get to a higher level of herd immunity. And some say that's about 80 to 85%. So we will keep going. So at this point, 78% of our population who are eligible for the vaccine have received at least 1 dose of the vaccine so far. We also reached another milestone last week in that we broke the 300,000 barrier. So 300,000 residents have been fully vaccinated. Next slide, please. So in terms of our age breakdown, we can see that in the youngest population, who only became eligible in the middle of June, we now are more than 50% who are at least partially vaccinated, 43% fully vaccinated. And we will continue reaching this population, particularly because school will be starting soon. So we are planning to make many opportunities available for vaccinating this group, as well as their families, by working on clinics at the school sites. The 16 to 24-year-old population, 65% have been at least partially vaccinated, and the 25 to 34-year-olds, 67%. So again, these 3 age groups, those who are under the age of 35, they both comprise the majority of our cases these days, and they have less of a vaccination rate. So it goes hand in hand. So we will continue to make vaccination available for these age groups. Next slide, please. So in terms of our racial and ethnic breakdown, our Latinx population, 55.4% of that population has been fully vaccinated at this point, with almost 9% partially. So it does bring us to about 64% who are at least partially, but less than 60% are fully vaccinated. And as we know, it's full vaccination status that seems to confer protection against COVID and particularly against the variants. We will continue to make vaccinations available for all populations, but the Roseland Clinic will continue to operate in its current location. It will be moving over to be operated by Cheryl Fox Home Nursing as of next week. And we are ensuring that all of the best practices that have been employed so far by Santa Rosa Community Health will continue during this transition with, of course, translation services, of course, by cultural, bilingual, and welcoming staff. So in terms of our other populations, we can see that the white population, about 67, almost 68% are fully vaccinated, and Asians and Black populations are in the range of 70%. Next slide, please. So in terms of our HPI, or equity measures, at this point, 25% of vaccine doses have been administered to those in the lowest HPI quartile. And 66% of those are at least partially vaccinated. when we look at those in quartile 4 to see how much of a disparity there is, that gap has narrowed to 9%, which is progress. And again, a lot of work continues to be needed in this realm. But we continue to try and address these disparities as best as we can and continue to offer vaccination. And again, the role of our local CBOs, our community-based organizations, and our community health workers and promotores have been very instrumental in reaching these populations and combating misinformation and encouraging people to have their questions answered. And that might be our last slide. Yes.
And prior to turning it over, we'd like to share some information on the Emergency Rental Assistance Program during our COVID response. Since the inception of the program, beginning back in April 19th through July 15th, we've had tenant applications that were submitted and processed in excess of 1,900. We've seen landlord applications that were submitted and processed, 823 of those, for a total of 2,468 applications processed and submitted. So dispersed for emergency rental assistance as well as utility assistance has been over $5.3 million. Next slide. And with respect to some demographic information regarding the ethnicity out of the applications processed and the funds dispersed, we see with respect to the ethnic population, our non-Hispanic and Latino population makes up about 51.4% of those applications processed and funds dispersed, whereas 36.2% is with respect to our Hispanic or Latino population. 12.4% of the population, of course, declined to answer with respect to race. We're seeing that approximately half of the population is white, with 4.3% of our population being Black or African American. 19.4% of the population lands in the multiracial or those declining to answer. And then with respect to location, we're seeing that Santa Rosa makes up about 48% of these applicants, or where the funds are being dispersed, whereas 11% is in the West County area. We see that Petaluma and the Pengrove area are 9.7%, Sonoma Valley 6.8%, and then we have 2 to 3% of the applications and the funds dispersed are in the Cloverdale, Healdsburg, Windsor, and the Cotati areas. Next slide. And with respect to some of the new emergency rental assistance guidance, since May of 2021, there has been an increase in the application processing by about 24.4%. So because of these new guidelines and the loosening of some of the restrictions with respect to AB 91, there has been an increase in application processing and also some additional training with respect to the community-based organizations. We do see that rental assistance need is not as high as projected, because what we're seeing and the feedback that we're hearing in the community is it's the debt accumulation with respect to the renters in our community where we see the need. The evidentiary requirements or the documents that are necessary, there's been considerable reduction of those because self-attestations are required now. So individuals are able to self-attest. There is no longer a requirement for a linkage between the tenant and the landlord. So the tenant can apply for this assistance or the landlord can apply for this assistance. And whereas there was a requirement for there to be an absolute linkage at the beginning or the outset of the program, that requirement has been done away with. Also, AB 832, which has come out, allows for a payment of 100% of rental arrears and assistance. This is retroactive to those who previously received assistance. So individuals who received 80% or landlords who received 80% are now able to go back and receive that additional 20%. There's now a total of 18 months of assistance that's allowable, where there was previously 15 months of assistance. There is now 18 months of assistance that's allowable for renters and landlords. Previous tenants who were renting a residence and who left that residence and the landlord was left with that debt, that particular debt is now an eligible expense that a landlord can receive assistance for. Relocation expenses are also now eligible for tenants to apply for assistance as well. So in other words, if a tenant is being relocated to another residence, those relocation expenses, any hotel expenses, if they've had to stay in a hotel in order to move, all of those expenses they can apply for assistance for. And then any debt accumulation, we did confirm with the state firmly yesterday that this is not an eligible expense for the program. And with that, I'll turn it back over to you, Chair Hopkins, for any feedback, questions, and discussion. Thank you.
Thank you so much. I will bring it back to the board to see if my colleague Supervisor Corsi.
Thank you all for the update. Very concerning numbers and Delta. I have a couple of questions on the emergency rental assistance program. I'm glad to see the numbers are growing, but at $5 million, we still have better than $25 million available, if I'm remembering the total correctly. Just couple things. Other than the relocation reimbursements, all these payments go to landlords. Is that correct?
The payments can now be paid directly to tenants. That is also a new emergency rental assistance update.
Okay, thank you for that. I'm sorry, Ms. Rivera, could you repeat what you said about your check-in with Sacramento on the debt accumulation question?
Yes, we had asked, could individuals who had accumulated debt, for instance, they paid their rent, but for instance, they borrowed money from banks or payday loan places or family members, could this be an eligible expense for these funds? And so we were confirmed with the state that this was not an eligible expense for these dollars.
Okay. I've been hearing from community members wondering if we can better advertise this program, for lack of a better term. Is this money available, say, if we wanted to communicate directly by mail with every renter in the county?
Yes, we, as a matter of fact, I've been in discussions with Alegria, the Office of Equity, so how we can better advertise and communicate. Been in discussions with our Latinx health work group, how we can get the word out to our undocumented community, how we can better leverage our relationship with HUDA to really get the word out. We had some of the cities putting flyers in their bills to renters. We're working with our PIO team to really disseminate better communication. So we are really working closely and in close concert about how we can do better communication. So that has truly been a barrier. We did a community forum with landlord organizations in concert with Marin County to really get the word out to some of our landlord organizations. So we are in contact with them to see if we can do some more tenant and landlord engagements to see about getting the word out. because this really needs to be saturated, not only about the program itself, but about the new guidelines, because there's a lot of miscommunication about the new guidelines, miscommunication about self-attestation, many still feeling like they have to have all this documentation in order to fill out an application. So it's really important that we really do our due diligence to really saturate our community with communication to ensure that folks are aware, and not only of the new guidelines, but that the program is here and all of these dollars are available for assistance.
Yeah, good. I would encourage any and all of that.
Mhm.
Are payments, are renters eligible for payment of future rent? You know, I think that if debt accumulation is not available, what about future rent payments?
Yes, the period of arrears is, of course, the pandemic period, but then after I believe it's 3 to now 6 months into the future beyond that arrears period that is now eligible. So therein, initially it was 3 months beyond the arrears period, but now the state has tacked on an additional 3 months beyond that. So therein you get the full 18 months of assistance that is now available to individuals. So we're trying to strategize about how we can lay this out so that it's easy for individuals to apply. Also, with respect to no linkages between the tenant and the landlord, this will also make it easy for where we have households where there are multiple individuals within the household. Initially, there was just one application that was only eligible for, but you had multiple individuals living in a household where each of those individuals who were considered a household were responsible for a portion of that rent. So without that linkage, that has also helped to allow each of those particular households, if you will, the ability to apply individually for their portion of what they owe for that rent. So that will also help as well.
Okay, a lot of changes and really important changes. I think we should be emphasizing getting
Yes.
that message out in
I
any way
agree.
possible. Thank you.
Mhm.
Great question, Supervisor Corsi. Supervisor Rabbit?
Yeah, no, thank you very much. And thank you for the presentation to Dr. Shende or Dr. Mace. Can you talk about the younger age groups, the pace of vaccination? Has it slowed to the same trickle that we're getting with the older groups, or do we still have hope that we are getting enough of younger folks in and getting shots in arms so that we can reach into the 80s here shortly? I appreciate very much all the efforts. I think we've done well, but we seem to be just inching along here of late, not making great strides week over week. Could you just talk about that real quickly?
Yes, thank you for asking. We continue to show some progress. It's slow, but it's steady progress in these age groups. Will we be able to get to the more than 85%, 80 to 85% in the elderly? I hope so. But over the last week and a half, we have actually seen an uptick in vaccination rates in these age groups. So I remain hopeful. Again, we are trying to make the vaccination available for people as easily as possible. Walk-ins, weekends, evenings. In addition, I should have mentioned that we do have a promotion with the fair, which starts tomorrow. People can come to the Jockey Club to receive a vaccination, and for that, they will also receive free admission to the fair, as well as one free ride for the fair. And that can be used on any day that the fair is open. So if one gets vaccinated tomorrow, for example, one can still come to the fair next week. The opportunity will be available every day except for when the fair is closed, which is next Monday and Tuesday. We continue to have sites open. Fixed sites that will continue to stay open are the Rohnert Park OptumServe site and the Roseland site. And we are looking into having one more fixed site if possible. Our curative van does cease operations this Friday. But as I mentioned before, we are working on setting up clinics at the school sites in coordination with the schools to be there for orientation and when school begins, and families and anyone who has not been vaccinated so far is welcome to come for those events. So we will continue to make opportunities available. We are also looking at many different community events going on where young people might gather to make vaccination available at that time. So we will continue to be patient and continue to move forward, and hopefully we can achieve those high rates that we have been successful at achieving in the elderly population.
Thank you so much. Thank you for the work. I appreciate it. Thanks.
Great question, Supervisor Abbott. Supervisor Gorin?
I think we are in this inflection point, and I'm really concerned about what we're seeing locally and across the nation and the world with the resurgence of COVID, especially among the unvaccinated. I want to thank you for all of your creativity and innovation on how we reach those folks who are vaccine hesitant or resistant or for whatever reason. And we have a lot of them in Sonoma County. I'm also tracking the state of California mandates, perhaps the universities in requiring vaccination of their employees and for admittance to universities. You probably track that best of all. What are we seeing regarding the requirement for employees and especially healthcare workers to receive vaccinations?
Well, we, as you know, that we have a new state order that I'm sure that you had a chance to review that stresses not mandating vaccines for healthcare workers, but to do away with the attestation and to require much more stringent measures for those who are unvaccinated in those kinds of settings. Healthcare workers, but also in other congregate settings, including corrections, homeless shelters. This is for staff that who are unvaccinated then not only need to mask, which is already a requirement, but up to 2 times a week in some settings. And so the state, actually, that's one of the most rigorous orders that's been adopted so far by, in the US, actually by state. However, there is also talk of some of our healthcare facilities, that would be some of the bigger MCEs, moving towards potential for mandatory vaccination for healthcare workers. And I'm not sure if that's going to be tied to full FDA approval of the vaccines, or whether it may go ahead even without full approval. I know that San Francisco is planning as of September 15th to require vaccination in groups such as healthcare workers. So there are some different models out there. I don't know if Dr. Shende or Paul, if you want to add something.
Yeah, just to clarify, the health order that went into effect yesterday, that Governor Newsom announced, does impact some 250,000 state government employees, including some healthcare workers in the public and private sectors. And they are going to be required to be vaccinated, or as Dr. Mace noted, they will be required to be tested, in some cases up to twice a week. And this is following a trend that we're seeing of more aggressive measures to encourage, if not require, vaccinations in many areas, as you mentioned, Supervisor Gorin. A number of universities, Stanford, UC campuses, CSU is all requiring vaccinations. Some Bay Area counties are moving in that direction. The Office of Veterans Affairs are now requiring all their federal employees to be vaccinated or be subject to frequent testing. So there is a shift going on right now, as you saw by actions in the state yesterday and in the state of New York, to really take a more stronger measures to encourage, if not require, vaccination.
Thanks for that clarification, Paul. also to add on, there are some private businesses as well that are moving in that direction or already have. I believe Delta Airlines was one of the first, in fact, to move in that direction. So so it's variable at this time, but there's definitely a shift that we're seeing.
Thank you. I've never felt personally comfortable just with the suggestion, the guidance that vaccinated individuals can go unmasked and those without vaccine should wear a mask, because truly that's the honor system. You never know who you're standing next to at the grocery store. I don't know how, if Sonoma County were to mandate all of our county employees to be vaccinated or be tested weekly, I'm not sure how we might enforce that or really provide the resources to do that. But I think it's important for this board to consider some policy options on how we can safeguard our employees, our folks at the counter desks, more than just wearing masks. What can we do to be the leader moving forward with more of a stick approach rather than a carrot approach? I appreciate the tickets to the fair, but I don't think that's the incentive that's going to get people vaccinated. Sorry, not that I don't love the fair. Thank you. I just think it's time for us to think about this. Thank you.
Great questions, Supervisor Gorin, and thoughts. Supervisor Gore, do you have any questions?
I think it's all been asked. I want to thank everybody for their work, and I don't want to hold us back with being the one online guy. So I'll let us move forward and appreciate the work.
Thank you, Supervisor Gore. And Assistant CAO Rivera actually shared with me the copy of the order. And Paul, I just want to make sure that we have the dates right. According to this, it says the order won't take effect until August 9th, 2021, and that then facilities must be in full compliance with the order by August 23rd, 2021. Can we confirm that timeline? Oh, you're on mute.
Sorry, that is correct. Implementation will not be until August 23rd. That's correct.
Great. Perfect. Thank you for that. And I do have a few questions. I really appreciated Supervisor Corsi's line of questioning regarding sort of the debt accumulation challenge. It sounds like we got an answer back. And in my personal opinion, that answer is completely unacceptable. I mean, we had people who put themselves into personal debt because do that, right, to their landlords, or perhaps they knew that their landlords were relying on those funds and that, they were at risk of potentially losing the rental altogether had they not paid. And so I'm wondering what can be done in terms of legislative advocacy, because when we don't like the answer, sometimes the answer is then for us to push back and say, hey, this isn't working for Sonoma County. How can we coordinate with, the California State Association of Counties, RCRC, other organizations to advocate for potential improvements to this program? So is that an option, and is that something that we could work on?
Absolutely. Your advocacy previously with regard to SB 91, along with other county advocacy, was instrumental in loosening the restrictions. So I think, just continued advocacy around this. There's been millions of dollars poured into this program. And in order for this program to truly be effective, this is an issue. I believe throughout the state of California, we're seeing debt accumulation as one of the issues. And this speaks to housing insecurity. So as much advocacy as your board can do around this, coupled with other counties coming together, I think is truly going to be effective and impact how this moves through the legislation, or taking it back to the floor to make additional changes that I think will impact families and ensuring that they're stable in their housing.
Thank you so much, Director Rivera. So I would ask, my colleague, Supervisor Gore, if that's something that maybe he might want to take back to CSAC and see if we have any opportunities there. And then I would also, and I don't want to put her on the spot, but our wonderful legislative affairs analyst, Marissa Montenegro, if that's something we could reach out to our lobbyists in Sacramento about as well. Supervisor Gore, any thoughts?
100%. I'll follow up with Marissa and Tina and make sure that this has been working really good with, if it's good with you all, with Marissa appropriately providing updates to the board.
Great, thank you. I just want to make sure that's something that my colleagues support. I got that sense from Supervisor Corsi, looking around and seeing some nods. Yes, that we'd like to try to address that debt accumulation. The other question that I would like,
and let me
oh, go
just
ahead,
say,
Supervisor
I
Gorin.
absolutely echo what Supervisor Corsi and what our health department is finding. That has been really challenging in the spring. So many residents there have taken out debts or borrowed from relatives to stay in a house, very important, but yet no way to pay back that debt. So if we can manage that, that'll be great.
Thank you, Supervisor Gorin. Another follow-up on that program is with respect to landlord access to the program, because I'm continuing to hear that if you are a landlord and your tenant does not wish to cooperate, that you don't have access to the program. Is that true?
That was true, but that has changed. That's one of the new guidelines. So now the landlord, there is no longer a requirement for a link between the landlord and the tenant. So the landlord can move forward with an application for assistance.
Okay, great. Because we definitely need to get that word out, because I'm still sort of hearing that concern and that frustration, and then had received an email saying that's still the case. So it's great to know that that's changed, and I feel like the more that we can share that message, the better.
Yes.
Do we have any data right now on evictions? And I ask because I'm honestly hearing concern about this from both sides. I'm hearing, obviously from tenants who fear that there is this increase in evictions and, concern over the stability of the rental market. And then I'm also actually hearing from landlords who, sometimes have, perhaps potentially a threat to their sort of safety and welfare with respect to a tenant and can't figure out how to evict that person. And so I'm wondering sort of what the general state of affairs is and kind of where the reality is, because you always hear the sort of two different sides of this issue.
I don't have that currently, but can get that information, can connect with legal aid to get that information and get that back to you.
Thank you very much. I appreciate that. Next, sort of transitioning over to test positivity. I was wondering how we are addressing geographically specific concerns. In Sunday, we had a pop-up testing site in Guerneville that had an 11.5% positivity rate. We repeated that testing yesterday, obviously with a new set of folks, and it was at 9.3%. So we're looking at, right around double digits in Guerneville, which is very concerning, obviously, given the fact that, we have a high concentration of restaurants and bars and gatherings and tourists coming in and out of the area. I will commend the businesses as well as Lazy Bear, who is absolutely stepping up and taking lots of precautions with respect to their event that really provides a huge amount of revenue. And we have, I think, a majority now of the bars actually requiring vaccination proof prior to entry. So I'm really, proud of folks for stepping up and trying to do right by their employees and by their customers. But I'm still concerned about the spread in that particular community. So how can we respond to these kinds of localized surges? What is the best strategy? And how can we support folks to make sure that we keep that under control and that we don't become either vectors amongst ourselves or vectors, outwards, right? Especially when you have tourists coming from out of county, out of state, they come in, we don't want that to be the thing that they take home with them from Sonoma County.
Yeah, thanks for that question. I think first and foremost, continuing the messaging. We are going to have a press briefing tomorrow and a community briefing where we're going to discuss again the importance of all of the mitigation measures. That would include, of course, first and foremost, getting vaccinated. But then if you're unvaccinated, even if you're fully vaccinated, to take precaution in gatherings. When you have a case rate, a percentage positivity of close to 10%, that is widespread community transmission. And it means that those who are even fully vaccinated need to take precaution. That's why we have a high recommendation at this point for indoor masking of everybody in all public settings. And I'm really happy to hear that the businesses are stepping up and wanting to ensure those mitigation measures are in place. The other thing we've done in this particular setting is give a lot of the antigen test kits so that people anybody who needs to be tested can be tested. We are providing outreach and education, and as you mentioned, pop-up for vaccination, as well as more opportunities for testing. So it's a kind of focused approach of, sort of using that multi-pronged approach to get the word out, outreach and education, provide testing, ensure that, to the extent possible that masking is occurring. And then we can talk further about, I think as Supervisor Gorin had mentioned, do we need some more potential strategies? We can discuss that, and I think we plan to do so with the board here shortly. Paul or Dr. Shende or Tina, anybody else want to add?
I would just second everything you said, and I think the key messaging these days is people are weary and they don't want to hear that masks are still needed. But the reality is, and we've said it all along, that we may be done with COVID, but COVID isn't done with us. And we really need to, I think people are beginning to understand the severity of the Delta variant. Our cases are on the rise. And I think there's growing acceptance to the need to take measures and certainly wearing a mask, whether you're vaccinated or not, in public places is the smallest of steps we can take, but a very important one. So we're going to continue to message this in all our outreach, including in our media briefing that we'll be having tomorrow.
If I may just add to that, in addition to masking, again, if people are unvaccinated, we strongly encourage them to get vaccinated. There continues to be a sense that young people, healthy people, may not need the vaccine. The truth is that we have seen young people hospitalized with this Delta variant, which is something that had not happened before with the original strains. So that's one thing to keep in mind. In addition, we know that every case in Sonoma County or elsewhere can lead to somebody else who may be more susceptible, more vulnerable, becoming ill and contracting COVID and ending up with severe consequences. So it is a different situation now than it has been before. There's more risk to everybody, even if you're young and healthy. And as well, there's more risk to those who are more vulnerable throughout our community. So as Dr. Mace mentioned, we are working on providing pop-up vaccination sites, but there continue to be plenty of opportunities throughout Sonoma County. So we encourage everyone to get protected.
Thank you very much for that. And following up on that, Dr. Shende, you just mentioned the impact to younger people. I'm wondering if we have a sense of the time horizon for children under the age of 12 to be eligible for the vaccine, and also what kinds of impacts we are seeing from the Delta variant on younger children who right now cannot get vaccinated.
Yes, thank you for that question. The time frame as to when the vaccine will be released for the next age group, which is 5 to 11, remains a little elusive. It sounds like early to mid-winter is when it might be available. Exact dates are unclear, but it's looking more like roughly the time frame of November. And in terms of what the effect is on children, thankfully, we have not seen hospitalizations of children in Sonoma County. We definitely have seen an increase in the infections in children. And what's interesting, and as a pediatrician, it has been very interesting to me to see that last year when young children were positive for COVID, they were for the most part asymptomatic, and they were found because of contact tracing for a family member, a household member. Now what we're finding is more often than not, they tend to be symptomatic with fevers, with fatigue, with cough, with congestion, definitely more so than what we had seen before, and more than what we generally see with the common viruses that circulate this time of year. But again, thankfully, we're not seeing any of the severe consequences. Other countries, unfortunately, have seen more effects in children. So again, it's important to be vigilant, important to be careful, continue to mask. But it looks like that vaccine will not be available until November to December.
Thank you very much for that update, Dr. Shende. The last thing I just want to share is following up on Supervisor Gorin's remarks around how do we get folks to, finally go ahead and get that vaccine. I think there might be an opportunity to partner with our businesses rather than imposing mandatory requirements. I think that once you start to see that tide turn right out in Guerneville, where a majority of the bars now require vaccination in order to enter, right? What if all of our restaurants in Sonoma County stepped up and did that, right? Or all of the bars? And then, hey, you know what? If folks don't want to, they don't have a vaccine, maybe you have a pop-up event even outside of a bar. Obviously, they can't go into the bar right after they get their vaccine, but, to sort of actually catch folks where they're going and, where are young people headed, hanging out at a club, right? I feel like there might be an opportunity to network with our business community and say, hey, we're not at the point of requiring, these kinds of mandatory measures, but if you want to take it upon yourselves, here's a toolkit, right? For what some of the best practices we think would be, and maybe to try to collaborate with some of our industry. Because again, I've been just really, honestly, very proud and inspired by the businesses who stepped up and they said, we want to keep our staff safe. We want to keep our customers safe. And this is the best way that we know how. And I think if that tide starts to turn, it's possible that more folks would, in order to be able to enjoy the amenities of Sonoma County, right, start to undertake those steps. So any other thoughts from my colleagues before we go into public comment on this item?
If I may add one point on
did.
that, Supervisor Hopkins, I'm sorry. We have reached out to businesses. We did recently send out a flyer to them to encourage if they would like to have education, outreach efforts on their site, as well as a pop-up vaccine clinic, that the county is very willing to partner with that. And we have received a few requests to do so. But I do encourage any businesses in Sonoma County that are interested to please do be in touch with us. The flyer does have information on how to access that our services. The email address is lavacunacura, LAVACUNACURA at sonoma-county.org. And we will be happy to facilitate those efforts for both outreach, education, as well as testing, as well as vaccination pop-ups. And if there are other suggestions, we are certainly open to it because we agree this is the population that we are trying to address.
Thank you, Dr. Shende. Supervisor Gore.
Yeah, thank you, Chair Hopkins. One thing is that there's reports coming out that that the vaccines are going, especially Pfizer, I think mentioned, is going to move from emergency use authorization over to full authorization. And we've talked about in the past is that obviously creates a different mechanism by which people can look at vaccines, whether it's required for schools or other things. So I don't know, Dr. Shende, if you can speak to that at all, the timing of it. And I know we only talked about it in the essence of schools and other things, but what does that denote in the world of vaccines?
Yeah, great question. In terms of the timing, it still is unclear. As of 2-3 weeks ago, I heard that it was imminent, but now it still seems to be that it's still some ways off. But by the fall is the general consensus that this might happen. That does certainly change matters in terms of the potential for making it more mandatory. But interestingly, it also, I think, will sway some people who have been holding off on getting vaccinated until it is fully approved. So that it could be a beneficial thing. It might make people feel that this is, it may encourage them to further feel that it's a safe vaccine, and that once it's fully approved, that they would be willing to take the vaccine. But I don't know if Paul or Dr. Mace, if you have any other comments to add about that in terms of timing.
I think you're exactly right. I think that this would be a very valuable tool. It would be a very useful tool to combat one of the biggest myths about the vaccine, that it was created in a hurry and is too experimental, when in fact the science behind this vaccine has been around a long time. But I think it would having full authorization would go far in terms of messaging and dealing directly with vaccine hesitancy, which is big right now.
I have one follow-up, which is as we encounter not just this, but we look forward. One of the things that before COVID, it was there was a lot of movement and even some demonstrations, marches on the state capitol by what I would call, the anti-vaxxer movement, and we had anecdotal discussions about low rates, West County, North County, and some certain areas on measles, mumps. We had reports of outbreaks and other things going on. One thing that I would like, I don't know if the board's interested, but I can either do it personally with you all, but also maybe in a future presentation on COVID, is where we're at with other vaccines in Sonoma County, how we track them, how that all lines up, what's required for schools, what isn't. Because I think as much as we deal with COVID, one of the important things that we can continue to do is normalize people to what they already do. And this not being so different from what we already do with our kids. So I don't know if there's any thoughts from the board or from the health officers on that, but that's something I'd love to see some information on.
Yeah, thanks so much for that. I think it's a fantastic suggestion, and I think it really underlines the fact that this was an issue preceding COVID. And I know for a fact, I looked at the data on influenza vaccination along with our EPI team. And Kate, correct me if I'm wrong, but I believe we went back a few years, and in the recent years, Sonoma County has had very low vaccination rates for influenza. Maybe as low as 30 to 40% of the population getting the flu shot, compared to potentially even 60, 70, 80% in some of the other Bay Area counties. So I do agree with you. We should look at it across the board for vaccinations. I don't know, Kate, if you had anything else to add to that.
Well, we do track childhood vaccinations and that data, so we can update it for the most recent year, and that could be something that we could bring back to look at, and also to see something that we've been concerned about is just how the pandemic may have influenced access to staying current on your vaccines, and how that may have changed in 2020 as compared to previous years. So I think it is an important topic to look at.
Thank you. I appreciate that. I would really love to see that information. Appreciate it. I don't know about the rest of the board, but I'll let it go there. Thanks.
Thank you, Supervisor Gore. And I would appreciate that information as well. I also have certainly, just sort of through my own personal networks and observations on social media, noticed actually some parents making the shift to permanent homeschooling their children. And vaccine hesitancy seems to actually be a driving factor in that decision, as some of the schools have sort of stepped up, and there's been tightening down on the state level regarding those vaccine exemptions. And so I'd be just curious to see if we have any data regarding homeschooling decisions as well. So, because I think there's some overlap in that population. Any other final thoughts from my colleagues? And Assistant CEO Rivera reminded me that, of course, we also have a fantastic network through environmental health with respect to accessing our restaurants. And so, there might be an opportunity to get the message out and to, see if any of them, right, are willing to be partners in terms of vaccination requirements, whether it's for their visitors or, ultimately for their staff once that, federal approval process is complete. So with that, I would go ahead and see if we have any members of the public who are present in the chambers. And we do have one who would like to address us on the topic of COVID-19. So they are welcome to come and join us. Sounds like it's hot.
Good morning, everybody.
Welcome. Thank you so much for being here today.
Well, thanks for having us. I understood it was going to be a little different than this, but that's okay waiting out there. You might want to there's the woman that's not in the picture. Her voice is very garbled outside. I don't think I see her here now, but she was earlier, and you couldn't understand her at all. Whatever her sound feed was real bad.
Okay, and if you wouldn't mind stepping a little closer to the microphone, because we want to make sure that your voice is also heard well by over Zoom.
Yeah.
There we go. Thanks.
Okay, I just want to bring up a few things. I listened to what you had to say about all this. I'm freshly back from a 19-state trip where I attended a bunch of things so I could get information from other states as well. We are the only state that is this over the top about this. I am not negating what COVID could do to people, especially people with COVID comorbidities. The people I know that are hospitalized currently have all been double vaccinated. They do not have comorbidities, and they are currently here or at UCSF having been transferred. I don't know anybody who has not been vaccinated who has been hospitalized personally. You may know people that have been. I do not. I'm going to go through a few things that I think are kind of problematic for me. One is the discernment factor of this board and the people on it. I am listening to doctors from all over the place, specialists, bona fide specialists, epidemiology, virology, all of that. And they are giving a much different story than what you are saying. So it's important for everybody to take in all information, use their antennas, and do discernment. Not to be stuck in a feed from maybe a medical alliance, a teachers union, a governor, anybody like that who might have some sort of policy for self-promotion be tainting how we're perceiving that information. There's free will, free choice in all of it, and everybody's interpretation can be different, but we do need to all stick to the facts, not any artificially inflated facts that are repeated 5 times, and then people think, oh, that's the truth.
And thank you very much. Your 2 minutes is
There's
up.
nobody
So
else out there, so I'm going to take another
thank you
minute.
very much. We do have members of the public who are also participating via Zoom. We're going to go ahead and cut off the microphone now. And so thank you very much.
She now has serious complications.
Ma'am, I'm going to go ahead and ask you to exit the meeting. Thank you very much. Have a wonderful day. Take care. And with that, not seeing any other, or you're not here. Okay, great. I just want to make sure. I'm like, just in case you want to share anything, we're here. So thank you. Not seeing any members of the public who wish to comment in the chambers. I would go ahead and see if we have any members of the public who would wish to speak via Zoom.
Thank you, Chair Hopkins. For any members of the public who are in the Zoom meeting, if you would like to comment, please raise your hand in the Zoom app or press *9 on your phone keypad to raise your hand if you're a phone attendee. And I do see a few hands raised, and I was informed we're doing 2 minutes. Thank you so much. All right, and just one moment. Okay, for our first individual, please unmute and state your name.
Are you talking to me? This is Kathy Allard.
Yes, Kathy, please go ahead.
Thank you. I've been listening to the group as well, and I'm very disappointed there isn't an opportunity for in-person meetings as many other counties are holding. And so I'm wondering if the BOS and Linda, if you could address why that's not the case. Seems to be there are safe precautions to take to include the public in a more active and collaborative discussion. Many of us have been exceptionally upset by the lack of being heard in this county, the lack of being counted, and the lack of having our emails answered. So many of us, as you would imagine, are upset by not getting reliable, trusted information and science that is backed by many of your decisions that you're making to basically continue to restrict people. Let me give you some examples. The current mortality rate, in case any of you aren't aware of it, if you can think of it now, is 0.02% in this county from COVID since 2021. That mainly represents the elderly and those with comorbid conditions. If we protect the elderly and we basically protect those with comorbid situations, there should be no need to restrict the rest of us. And so this is what many virologists and epidemiologists outside your small group are health policy to continue to focus on this when the mortality rate is very low. I understand that there's some seriousness involved, but I think focusing on those most at risk is going to be your best bet. And I honestly to God don't understand why you're not doing that and why many of you quite honestly seem to be misinformed yourself as to a lot of the science involved. Do you know that our local hospitals are not even testing for COVID, for vaccinated people if they have COVID? I just learned that yesterday. This is horrendous, and I hope you can address this. Thank you.
The next commenter, can you please unmute and state your name?
Good morning. This is Jana Blunt. I work for the Recorder's Office, and I'm the president of the SEIU 10 to 1's Sonoma County chapter. I just wanted to respond to the person who was speaking to you in public, or really respond to the sentiment behind those words. I just wanted you to know, as the Board of Soups, with, your chambers are empty. There's nobody else sitting in there other than staff. Many of us have been dealing with people face to face for 14 months. We've been back in our office since the 4th of July of last year. And these are the arguments that we're having with people. These are the people who are approaching us, accosting us, yelling at us, even though we're not necessarily the ones who are making these rules. People are arguing about having to wear masks. I understand that things are very polarized and people are very upset on either side, but I really want to point out my appreciation for Susan Gore and for saying, how do we protect our employees? You are the largest employer in this county. We are vectors of the disease if we're not being kept safe ourselves, and we serve the community. We go into their homes, we help the elderly, we help children, we help the sick. So if you're not keeping us safe, if you don't feel safe having folks in your own chambers sitting in front of you and breathing your air, understand that many of us have been doing this with no stop since the very beginning of the pandemic. So if it's safe for us and it's not safe for you, maybe there's some sort of disconnect there. Thanks very much.
And I'll look briefly to see if we have any additional hands raised for comment. Thank you. One moment. Jenny, please unmute and state your full name.
Hi, everyone. Thank you so much. My name is Dr. Jennifer Fish. I am a local family physician. I actually wasn't going to speak. I've just been watching the meeting in appreciation for the COVID update and for basically how collaborative the Board of Supervisors has been through this process. And I have felt that I've been able to very much join these meetings and share my piece. But I do have to say that as a physician in this county, the COVID situation is serious. I am filled myself with a sense of urgency as all of the meetings kind of slowed down and everything was looking good. And it is serious. Our hospitals are filling up, the ICUs are filling up. 98% of the folks in the hospital are unvaccinated. Vaccination is real, it really works. We're not hoodwinking anyone. We are putting ourselves at real risk to take care of the community. And the previous speaker's absolutely right. We need to protect the people that are most vulnerable. And I would include in that workers of color, essential workers that have been on the front line serving our community this whole time without sufficient protections by employers, often without being able to get paid sick leave, without being able to get stimulus checks and all of that. Our farm workers who are out there on the grounds doing it. And I do think we need to focus on worker protections. I just want to encourage everybody that's listening to keep wearing masks. My hope is that as a county, we increase testing, because we're not testing, we're not seeing the real picture of how extensive this surge is with the Delta variant. I'm concerned about that. I encourage everyone to wear masks, to only gather outdoors with masks, to wear a mask indoors. And I'm hoping at some point we do have another indoor mask mandate just for the protection of healthcare workers, our community, our vulnerable populations. And I just want to thank all of you for your time today and for listening and for listening to science. I appreciate that. Thank you.
All right, our next commenter, can you please unmute and state your name?
Hi, my name's Yvette, and can you hear me? Yes, I guess you can.
Yes, we can.
Okay, thank you. I'm really disappointed in the Board of Supervisors, doctors. You people seem to be so sciences. I have been investigating in over 3,000 hours, and virologists and so many people. I just don't even know where to start, and I only have a few minutes. First of all, masks are dangerous, and they do not stop the virus. The virus is very small, and it's like a mosquito going through a chain link fence. Even on N95 masks, it says it does not stop the COVID virus. People are dying from this vaccine that you are saying is a safe vaccine. I'm appalled by that. You need to look at the VARES in the CDC, which is only a small percent of what's really going on, because they make it hard for doctors to actually report. And I don't know if people are being paid off or you're just in line with what Governor Newsom is saying. But you know, everything is going against the Nuremberg Code, all 10 of the codes. And I will not be told that I need to put any kind of a drug in my body or my family's body when people are dying from this. Thousands of people are dying, more people on this vaccine than has died in the last 30 years of vaccines. They have pulled vaccines from the market when a handful of people have been killed from it, and this is just going on. I'm disgusted with
And thank
what
you so much
we're
for your
doing.
comment. That concludes the time. Thank you, Chair Hopkins. That concludes public comment for this item.
Thank you very much. And one thing that I think is very important is that we do not allow a public forum to become a vehicle or vessel for misinformation. So I would like to hand it back to staff to provide some counterpoints to some of the anecdotes and pieces of misinformation that were just shared by a number of public comments today. In particular, I thought it might be helpful to bring up the slide which sort of shared the disparities between the unvaccinated and vaccinated population with respect to new cases per day. I believe it was 17.5 new cases per 100,000 residents per day in the unvaccinated population and 4.2 new cases per 100,000 per day in the vaccinated population. And I'm also wondering if Dr. Shende or Dr. Mace, if you might like to share anything about what you are seeing with respect to hospitalizations, because we all know that the plural of anecdotes is not data. And so someone may know someone who was vaccinated who did wind up in the hospital, and that does not sort of amount to statistically significant information. So if you have any thoughts regarding hospitalization rates in the vaccinated versus unvaccinated population, I think it would be very helpful to share that with the public.
Yeah, so I think, can you see my slides now, Supervisor Hopkins?
Yes.
Okay, so this is actually the one that you're referring to, looking at new cases per 100,000 per day in unvaccinated versus the fully vaccinated population. And again, the case rate is about 4 times as high in the unvaccinated population versus the vaccinated population. So we're definitely seeing that vaccination is quite effective in preventing COVID. And then I also wanted to show, I think we have a slide looking at, here we go. This is the one, the hospitalizations, just that 83% of those hospitalized with COVID-19 and 100% of the COVID positive ICU patients have been unvaccinated. And so the majority again of people who are really ill with COVID are in the ICU are in fact unvaccinated. And even amongst just those hospitalized, you can see that. And all the fully vaccinated hospitalized patients did have significant underlying conditions like diabetes or heart disease or some immunocompromised state, that kind of thing. And they were older as well. And as far as deaths, so far, we've reported only 2 deaths in persons who are fully vaccinated, and they were over the age of 90, whereas all of the other deaths have occurred in unvaccinated persons, some being quite young and even under 55, that sort of thing. I don't know, Kate, if you want to add anything to the statistics or the data.
Yeah, I think you covered it well. We are having widespread transmission in the community right now, but where we're really seeing in COVID in terms of hospitalizations and ICU stays and deaths, it is among the unvaccinated. And as you said, 99.4% of our deaths have been among unvaccinated residents.
And, you know, one other point, and I can't believe I even have to ask this question, but efficacy of masks. Can we just address the efficacy of masks? It's sort of shocking to me to still hear misinformation regarding suggesting that they're ineffective or that they're going to kill you. So just would someone mind responding to that?
Yeah, I mean, it's really clear now. We have a lot of experience with the use of different forms of masks. And it looks like any mask, whether it's a simple cloth facial covering or whether it's a surgical mask, whether it's an N95 respirator, definitely, those kind of N95 respirators are the most effective. But the data shows that even cloth masks are quite effective in preventing transmission of respiratory disease. Anything that's passed from person to person, is airborne. So double masking has been also shown that it can be more effective than single masking. There's a lot of data out there now that suggests that masking is one of the best ways in which we can protect ourselves besides vaccination from COVID-19. I don't know if Dr. Shende or Kate or Paul or anybody else wants to jump in and add anything else.
Yes, as Dr. May said, the science is very clear. Masking does make a difference. It's true that an N95 is going to provide more protection. In addition, the science has shown that ventilation makes a difference. So being outdoors is much more healthy and less chance of transmitting a virus than being indoors. All these things have been studied extensively over the past year and a half and have been shown to be to stand up to science worldwide. There's no question that these are important preventative measures.
And if I could add, our previous speaker, I think, touched on about 8 of the top 10 myths that we're confronted with about the vaccines. And I just want to say in general, there's a lot of references to the Nuremberg Code, and I can't believe we actually have to go into this, but the history about the Nuremberg Code, which was developed after World War II, that had to do with experimentation. And vaccines that have gone through multiple rounds of testing and clinical trials and have been approved for widespread use have nothing to do with the Nuremberg Code principles. And, Nuremberg Code was about human experiments, not vaccination. And vaccination, these vaccines work, and they're effective, and they're free, and they are saving lives. And I think that just needs to be, as Mark Twain said, a lie can get halfway around the world before the truth ever gets its shoes on. And that's really what we're chasing these days.
Thank you very much. Any other comments or thoughts from my colleagues on the board? Supervisor Rabbit?
Yeah, I mean, it's so unfortunate to hear comments such as that. And I think Dr. Fauci was correct when he said that with those kind of facts or those kind of opinions out there, we probably still have smallpox, polio, and God knows what else amongst us. I don't understand people sometimes in terms of telling this board actually to look at other sources. Who here hasn't looked at all sources, reputable sources? And I think that's what's really the key. Reputable sources, not just listening to someone on the fringe telling you what you want to hear. It's unfortunate we're in the midst of a pandemic. No one likes it. Everyone wants to pretend it's not here and it should, we can just go about life as usual. It's not that simple. Sometimes life is a bitch and you got to deal with it. And this is what we have to deal with at this particular point in time. I know people who have died from this, from COVID. And, it's just, it's really disappointing. And, this day and age that we're having to deal with this is just a travesty.
Supervisor Corsi?
Yeah, I just want to thank you, Chair Hopkins, for asking for that reality check. And, we're told that we're looking at the wrong facts and we're not listening to the real science. There are not right and wrong facts. They're just facts. And we're listening to the science. The real science is what we're dealing with here. And we're dealing with real consequences of people who are not paying attention to those facts and that science. So just again, thanks for pushing back a little bit on that and getting a reality check.
Thank you, Supervisor Corsi. Supervisor Gorin, anything to add?
The chairs asked for clarification. It is, it's really disappointing to me that we have members of our community who believe what they believe. And I know that they've researched the sources that they think are viable, but I look at the folks who are unvaccinated in our hospitals dying and worrying about the future of our community when we're so close to moving through the pandemic. And now we're experiencing the rise and the surge of COVID across the nation, across the planet. And I remain committed to doing what it takes to reach out and try to get as many of our community members vaccinated as possible to be safe. Thank you.
Thank you, Supervisor Gorin. And Supervisor Gore, is there anything that you would like to share?
Just hell yeah and ditto with my colleagues, and much appreciation for the call out about referencing our employees for Jana with SEIU. Well put, and continue to let us know what we need to do to protect our employees. Thank you.
Thank you, Supervisor Gorin. Thank you for acknowledging Jana. I would love to continue those conversations with SEIU as well. I just want to conclude by saying that people are always entitled to their own opinions, of course, but it's very dangerous when people become entitled to their own reality. And the sad thing is that when people create their own reality and their own alternate set of facts that are not factually accurate, it's actually impacting the rest of our reality as well, because people who are not getting vaccinated based on misinformation are creating a reservoir for mutation for this virus. And that is where things like the current Delta variant come from. And, maybe next time it's not going to be Delta, it's going to be Epsilon, it's going to be, all the way through, right? We're going to have to circle back through the alphabet at this point. Because, if we don't step up and get vaccinated, we're never going to actually stop this virus. Last thing I want to say is that I think, I just added to my bingo card, Supervisor Rabbit swearing in the chambers. That might be a first for me after 5 years. But I totally appreciate the, frustration and the, we've got to call it like we see it. And we need to be able to live in reality and to counteract this misinformation and to own that. So thank you all for your work, staff, in terms of counteracting that misinformation on a daily basis. And I appreciate that we will be having a briefing and we can discuss some of these things as well tomorrow. So with that will conclude our informational item on the COVID update, and it will bring us over to item 10, which is a similar cast of characters for the COVID-19 response point in time feedback report. So with that, I'm going to hand it back over to Director Rivera.
Thank you, Chair Hopkins. We are equally as excited to bring you the COVID-19 response point in time feedback report. And joining me will be Dr. Irmela Shinde, our COVID-19 vaccine chief, Ken Tassif, our vaccine mission manager, Norma Melanie Brand, our health policy planning and evaluation manager, Denya Candela, our health equity program manager. And following this particular piece of the presentation, we will have Ana Lugo and Ana Horta, who will be presenting the Latinx Health Work Group feedback report. So with that, we'll begin our presentation. In June of this year, your board requested a review of our department's response to the COVID-19 pandemic. This was to be a point in time review. The COVID-19 pandemic impacted our county and our world in unprecedented ways. Like the rest of the world, we were unprepared for many of the initial challenges that we were to face and we continue to face. Yet I have to stop and say that in the face of a lot of fear and a lot of uncertainty, as we've even just heard in these comments, I must say that your board has taken and continues to take bold and compassionate action to provide funding and resources, support and services to this community and to our staff. I would also be remiss if I didn't acknowledge our Sonoma County staff countywide. If I did not acknowledge our community-based organizations, our FQHC, our community groups, who, as we always do in the midst of disaster, come together. On March the 17th, the county issued a health officer order for residents to shelter in place, with the state issuing the order just 2 days later. I believe that these early actions proved and attributed to our lower transmission rates early on. This particular report will inform our American Rescue Plan Act, or ARPA, and other funding decisions. This will also inform our ongoing COVID-19 and vaccine response. It will also inform our emergency response efforts, as well as our county operations moving forward. Next slide. We adapted many strategies in the face of changing conditions and new awareness of the virus. So this report is a high-level overview and a review of the first 15 months of the response. It shares our successes, our challenges, our barriers, providing feedback from staff and various stakeholders. Now, what this report is not is an official after-action report. This after-action report will come later when the response officially shuts down. This report is also not inclusive, and it's not a thorough countywide feedback report. The data that we will provide or have provided in the report that you have is a survey of approximately 177 responses from staff and community members. We had convened 2 focus groups, including the Latinx Health Work Group, healthcare partners. Data included also involves our CURA group, the Emergency Rental Assistance Program, our non-congregate shelter data, alternate care site data, Food Task Force, Permit Sonoma code enforcement data as well. Additional data included in this report is intra-action report data from our Public Health Division's Department of Health's COVID unit. Next slide. The impacts of this pandemic are felt throughout our community, with over 31,000 cases of COVID-19, over 1,400 hospitalizations, 329 lost lives due to this pandemic. And in cases per 100,000, the highest rates have been among communities of color. With our Latinx population experiencing the highest case rates, with our Asian communities following our American Indian communities, and then our Black and African communities at the 4th highest rates in our communities of color. Next slide. At this time, Ken, followed by Dr. Shinde, will provide us with an overview of our COVID-19 response.
And you're on mute.
Yeah.
Unmute.
I think I get it by now. Yeah, thanks, Director Rivera, and good morning, Chair Hopkins and board members. While the COVID response has had numerous missions and operational elements going back to early 2020, Dr. Shinde and I will focus on some of the biggest and most impactful operational elements of the response. So let's start with sheltering. The county established non-congregate sites, commonly known as NCS, early in the response to reduce the spread of COVID in vulnerable populations and individuals with underlying conditions who didn't have an ability to safely shelter in place. Most of the individuals referred to were over 65 years old. The NCS was originally located at Sonoma State University, which provided time for the COVID the homeless task force to establish a network of sites in various locations across the county. These sites were established at the Astro Motel in Santa Rosa, at Alliance Redwoods in Occidental, at Holiday Inn in Windsor, and we have 2 sites at the Sonoma County Fairgrounds using 37 trailers provided to the county by FEMA. In addition to these traditional NCS sites, the recent Project Home Key purchases by the county at the Hotel Azura in Santa Rosa and Sebastopol Inn in Sebastopol effectively serve the same purpose as well. So over the, and my apologies, let me go to the next slide. Over the course of the pandemic, about 429 people have been sheltered at these non-congregate shelter sites, receiving wraparound services, including meals, healthcare, case management, transportation, and other important means of support. And of those referred, well over 60% had most previously been in either emergency shelters or living in places not meant for human habitations, like on the street or living in their cars. So some notable successes in the NCS program. For example, the program's been very successful at isolating the highly vulnerable guests who didn't have housing and other resources to and preventing them from contracting COVID. We made very successful transition from Sonoma State University to Alliance Redwood and other NCS locations during the mission. We built on the success of models such as Los Gillicos and established a really great new precedence for how to provide successful wrap services to the unhoused during emergencies. And we helped many of these individuals find health homes and coordinated services with clinics. Oh, and we also, of course, collaborated with CBOs, including homeless groups, to help provide services and resources to these individuals. And some barriers that we encountered and lessons learned included dealing with rigid FEMA and county structures that made it a little bit difficult for disaster service staff to navigate and understand. These complex structures didn't promote a particularly nimble response, especially in the beginning when we were on the learning curve. We could have also had better staffing and communications in the very early stages of the response when the DOC and EOC were together, and we worked through those. But there was a little bit of a learning curve there, and I think we learned something from that. And because of the rigid FEMA and county regulations, payments to contractors have often been delayed. And this was particularly impacted those contractors that rely on cash flow. Securing transportation for the disabled, especially early in the response, was challenging, in part because of paratransit staffing challenges. And also the homeless task force didn't have construction management skills to really set up a FEMA trailer site. And we probably could have asked earlier for help from general services. Let's see, next slide. Just to show some of the demographics at the NCS, this slide shows the ethnic breakdown of individuals served at the NCS sites. While the homeless task force made efforts to reach out to communities of color, the metrics do show that we had opportunities for improvement, especially in the Latinx community. While more analysis needs to be done, likely barriers to achieving this equity include difficult to live at site locations and some missed opportunities with our location choices. Although we did our best given the acceptance of groups into various hotels and other sites. But especially in early in the pandemic, we could have done better coordinating with community-based organizations that serve communities of color. Let's move on to the ACS. Or alternate care site program, otherwise known as the ACS. While non-congregate sites are intended to house those at risk of experiencing adverse outcomes if they catch COVID, the ACS sites are intended to care for those who have contracted COVID, they're COVID positive, or must quarantine due to exposure and have nowhere else to isolate. So the county initially established an alternate care site at Sonoma State University in Rohnert Park, and that was very successful. And subsequently, we relocated to the alternate care site at Dry Creek Inn, Best Western in Healdsburg. To date, the ACS has served about 890 clients, providing them with shelter, food, and most importantly, medical services and monitoring. Some really notable successes include a very successful medical provider that we selected that provides 24 hours a day quality medical services to the clients. We have quality weekly care coordination meetings between the ACS and providers in the healthcare field to make sure that our healthcare with the clients is coordinating with the client's primary care providers, for example. We have a really simple referral and intake process to get individuals into the ACS. And we got clients county-owned cell phones, or at least we've lent them county-owned cell phones to support communications with their family members. Lessons learned included sometimes ACS nurses and nurses from community clinics that came duplicated efforts, which caused some confusion for patients. We worked through those. Transporting COVID positive patients during fire evacuations was very challenging. We did open a temporary ACS down at Petaluma Fairgrounds during, I believe it was the last fire. Food vendor contracts to provide culturally responsive choices and meet dietary restrictions were really difficult to complete. And finding a linen service that would handle COVID positive environment was very difficult as well. In terms of metrics and so on, virtually all of the individuals referred to the ACS were either not able to isolate at home or they were unhoused. The 55% of those who isolated at ACS rather than home generally did so because of space limitations at home, or there were highly vulnerable individuals living at their home. And nearly 40% of referrals were unhoused and had nowhere else to isolate. Now, while 41% of those staying at the ACS were from the Latinx community, we still had opportunities to serve this community because 62% of all positive cases came from the Latinx community. So, and barriers to achieving that equity included, in part, the location of the ACS. While the Healdsburg location was the only hotel in the county that at the time we could find that would accept COVID positive clients, its location so far north of major population centers was certainly a factor in utilization. Many of those referred simply didn't want to be that far from family. Let's talk a little bit about the Food Task Force. A notable portion of the COVID response was the work that the Food Task Force did in the community. The Department of Emergency Management worked closely with community-based food distribution charities and other community-based organizations to support and coordinate the distribution of food across the county. The Department of Emergency Management worked to provide substantial funding to key partners across the county, and the Food Task Force coordinated multiple food points of distribution throughout 2020. This resulted in over 1.8 million meals or equivalents of food being distributed to families across the county. And beyond the efforts of those organizations listed here, there were many other grassroots efforts to distribute food by community-based organizations, some of which you'll hear from shortly. These food distribution efforts were critical to helping support food security, especially during the early days of the stay-at-home orders. I'd like to now turn the presentation over to Dr. Armila Chendi, who will discuss our testing, contact tracing, and vaccine missions.
Thank you, Ken. So as we know, an important part of the COVID response was in testing. Early on, testing systems needed to be implemented to be able to identify and thus quarantine and or isolate patients. And systems like this had never been set up in Sonoma County, and certainly not on a scale as large as what was needed. So some of our successes in this program were that we were very quickly and nimbly able to set up testing centers and have high testing rates, higher than those for the state, such that the state was able to give us some special dispensations because the testing rate was so good and led to favorable COVID case rate modifiers. In addition, partnering with Movimiento Cultural de la Unión Indígena, I'm sorry that I'm not pronouncing it perfectly, but MCUI, to provide indigenous language translators did help in bridging the gap, the communication gap amongst different communities. The lab capacity was significantly increased. It was tripled in size by bringing additional staff on to be able to handle the number of tests that were required in the lab. Also, a scheduling and registration system was set up and turned around very quickly to enable ease of scheduling appointments within the county system as well as outside of. All these things happened in a very, very short period of time. We also were able to secure lab staff as well as additional testers through the National Guard. And in addition, OptumServe sites for testing were set up throughout the county, and that doubled our testing capacity. So some of our barriers in testing were worldwide. So there was a global shortage of supplies. We remember how difficult it was to obtain masks and testing and many different elements that were required in the process. Initially, the scheduling and the registration processes were difficult and slow. Before the previously mentioned system was implemented, it was done through simple Google Sheets, and it was a very, very slow-moving system. So these were barriers, and again, systems needed to be put into place to enable nimble availability of testing. Initially, the testing sites did not have sufficient bilingual and bicultural staff, and over time, this was addressed. But initially, this certainly was a barrier. And initially, the lab capacity was limited. And again, this was the county. We learned from our issues and continue to move forward. Next slide, please. In terms of contact tracing, so again, a program like this had never been established in Sonoma County before. Some of the successes were that quite soon, the program was scaled up to meet increased cases. Darcy Richardson was very instrumental in establishing this program, and within a matter of 2 to 3 months, a number of contact tracers and case investigators were added on, and the prioritization was to hire staff who were multicultural and multilingual to be able to meet the needs of the community. In addition, the translator services that were available by phone were implemented and ramped up to enable that volume of calls to be to have translation services. There was also a team-focused approach to grow expertise, to share information, to communicate with one another, to share best practices, and to be able to very quickly learn new information, which, as we remember, we were learning weekly. Things moved very, very quickly. And the implementation of the state-sponsored record-keeping system was very important to be able to accurately track the information and to be able to communicate effectively across different jurisdictions. Some of the barriers were retention of staff. This was very difficult work. It was onerous. It was time consuming. And it was difficult to speak to people for whom there may not have been easy ways to be able to help them or to isolate. It was difficult to be able to provide food and services that Ken had mentioned, and it took an emotional toll on the staff. So there were quite a few people who were hired. It took a long time to onboard, and then felt that it was not something that they could do. So there was a lot of turnover. The training and onboarding took quite a bit of time. And there was challenges in building community trust. It's understandable that people would be uncomfortable in sharing medical as well as personal information. So it took time for these kind of relationships to be built up. And it involved a lot of interaction with the community to build that trust. Scaling up infrastructure, so the record keeping, the phone systems, the translation services, as mentioned before, were certainly barriers. But the program very effectively worked through that over the ensuing 3 to 6 months. And again, initial lack of adequate technology took away from some of the work that actually needed to be done. And again, over time, these issues were addressed. Next slide, please. And then that brings us to vaccine administration. So as we all know, the vaccine was available in December of 2020. And in Sonoma County, we started implementing vaccine administration on a larger scale starting in January. So some of our successes in this program were that we were able to mobilize quickly to create capacity that actually exceeded the state and the federal supply. In January and February, we went from being able to administer simply 2,000 to maybe 3,000 doses a week. And over the course of the next 6 to 8 weeks, we were able to bump that up to a maximum of about 50,000 capacity weekly. So it was a significant and very rapid ramp up. we were at the top in the state in terms of delivering vaccines and the percent who were totally vaccinated in a short period of time. The prioritization of older residents, particularly those initially over the age of 75, saved lives. It made a big difference. We had some very hard decisions to make, but prioritizing this group in the face of limited vaccine supply was extremely important in saving lives. The engagement of the Latinx Health Work Group was extremely beneficial for communication and to understand the boots on the ground issues that were not easy to understand if one was not part of the community. It made a big difference, and a lot of the ideas were implemented as we move forward in the vaccine effort. Our engagement with Leap Solutions was also helpful to be able to interact with many stakeholders throughout the county, in business, in politics, in education, with community-based organizations. And it helped us to be able to communicate what was happening with this rapidly evolving vaccine program, as well as to hear from them what the concerns were. The engagement with the schools. So we did set up a number of clinics within the school system on campuses, and with the help of Sonoma County Office of Education. This created for very good collaboration as well as communication. It also allowed us to set up webinars to be able to educate the public, and has allowed us to be able to achieve success in the newest eligible population in the 12 to 15-year-old group. There was also regular communications. We had weekly, if not 2 to 3 times a week, information sessions online on Facebook to ensure that there was consistent messaging. In addition, we were able to provide these vaccines very rapidly with the help of the state-sponsored nurses as well as volunteer groups. Initially, we had requested somewhere in the range of 50 nurses from the state, and it increased to the point where we had actually more than 250 nurses within Sonoma County who made a huge difference in being able to administer vaccines. Some of our barriers are related to exactly that. One of our biggest barriers is that Sonoma County does not have a clinic system through which we are able to easily and effectively administer vaccine or provide medical care. And because of this, it was incumbent upon us to be able to set up centers and establish these sites, as well as to have staff that would not only be able to administer vaccine, but also to monitor, to do data entry, to set up security, et cetera. So these were definitely barriers that we were able to overcome in a short period of time. One significant barrier is that there were constant changes in the state and federal direction and response. We would hear one thing, and then within a day or even less, things changed. So it made it very difficult to continue to adhere to what was being said at higher levels, but also to communicate that to the community. Vaccine storage and supply issues were significant. As we know, this is a vaccine that needed ultra cold temperatures to be stored at, and there were many details and technicalities that needed to be learned in a short period of time and conveyed to the community and to vaccine administrators to ensure the integrity of the vaccine. Supply was a significant problem early on. As we know, for the first few months, we had a very limited supply, and that required us to be able to have to set up priority groups for which we were slowly able to roll out the process. And then finally, there was a significant challenges in consistently having the independent vaccine centers and administrators to apply the county's equity framework. With continued time and communication, this was implemented, but it certainly was a barrier early on in the vaccine effort. And next slide, please. And with that, I'll turn it back to Ken to discuss more about the logistics.
Thank you, Dr. Shendy. Let me talk a little bit about the logistics section of the COVID response, which was a critical factor in the overall success of the county's response. The logistics section was responsible for, or is responsible for, procurement of PPE and all other supplies, but it's also responsible for staffing of operational missions, supporting contract processing, procuring electronic equipment such as laptops for remote work and for operational operational work, supporting operational logistics for the testing team, for the vaccine team at the NCS and the ACS locations. And very importantly, logistics is responsible for operating the COVID warehouse. And I'd like to just give a shout out and thanks to General Services and Fairgrounds staff for their partnership on management of that warehouse. It was very, very helpful. The early COVID response was defined in part by the efforts to procure and distribute PPE to medical providers, community-based organizations, and first responders. Global supply chains disruption was just really, really difficult, and competition for limited resources drove prices up and made sourcing of PPE extremely difficult. Nonetheless, we were able to maintain key PPE supplies such as N95 masks, surgical masks, gloves, face shields, hand sanitizers, sanitizing wipes, and protective gowns, and other PPE without major disruption. We really had, we never ran out of PPE completely. Some notable successes are, for example, to date, the logistics staff has processed over 4,500 resource requests, and the warehouse staff has made thousands of deliveries to hospitals, doctors, dentists, first responders, essential workers, and community partners. The logistics team has procured millions of pieces of PPE items in the face of these global shortages and competition. And along with the Department of Emergency Management, we implemented the Web EOC electronic documentation system, which really streamlined processes and positions us for future emergencies. Lastly, we procured and distributed electronic equipment that kept during the shelter-in-place order. Some barriers that we encountered and lessons learned included that we had to overcome extremely slow supply chains during the early months of the pandemic, which required a great deal of our time and resources. And we implemented some rationing systems. Again, people didn't run out, but because we put these things in place, I think we were successful. We had to navigate complex FEMA rules that required bidding on contracts once exigency had subsided. And that was challenging because the pace at which things changed, rules changed and so on from the state, really everything was exigent and continues to be exigent, as we know today, even as the Delta variant emerges, right? We continue to deal with a slow resource request approval process because we still have yet to implement Web EOC workflow, but that'll be coming in the not too distant future. And we've had to overcome a significant loss of institutional knowledge as disaster service workers who designed and operationalized the response were required to return to their regular county jobs, and they were replaced by new extra help workers, which meant we had to start establishing a whole new set of institutional knowledge. Lastly, I'll talk about the rental assistance program, and I know Director Rivera had talked about it. I'll try and touch on items that kind of enhance what she talked about. So the Emergency Rental Assistance Program, or ERAP, this program helps eligible households who've been financially impacted by the COVID-19 pandemic by providing payment assistance for renters or landlords who need help with rent and utilities. To date, the program successfully served over 2,400 individuals and over 1,900 tenants. The program served many of those most impacted by the pandemic in Sonoma County, helping them be protected from eviction and preserving funds for fundamental needs such as food. Another success was the Department of Health Services stakeholder engagement with tenant organizations, landlord organizations, cities, and CBOs to try and get the word out to those that could take advantage of this. This engagement and dialogue resulted in better success and program coordination. I know there's a ways to go still, but we did a lot of that engagement. Also, the no wrong door approach made it really much easier for individuals to apply and get assistance. And our county-wide partnerships have resulted in having distributed over $6.7 million from all available sources. Some of the barriers that we encountered, though, and lessons learned, were having to navigate some complex federal program regulations that slowed program startup. We could have been more efficient with our outreach to undocumented communities and engaging with community-based organizations earlier. We found that communication about our acceptance of self-attestation for individuals that didn't have traditional rental agreements didn't reach all of the field staff, and some eligible applicants may have been rejected early in the program. And there were some efficiencies due to overlap between our ERAP community-based organizations and the CURA providers. If we had done a little bit better job of coordinating outreach, we might have been able to avoid some of those inefficiencies. But that was generally early on in the program. Just from an equity standpoint, the program did a good job of reaching community colors, with over half of rental assistance awards going to communities of color. And lastly, from a geographical standpoint, the rental assistance awards successfully went to regions in the county where we find lowest healthy place index census tracts, and it reached those most in need. So with that, I will turn it back over to Director Rivera.
Okay, and with that, Ken, we can continue going.
Oh,
yeah.
Okay, let me.
Denia will share our CURA successes and barriers.
Thank you. All right, perfect. I'm glad the slides are up. Thank you for sharing those, Ken. Thank you, Chair and Board, for the opportunity to give an update today on the CURA project. I'll be providing today an overview of the history, evolution of CURA, the collaborative network of community-based organizations, an outline of the program components, its corresponding results, and most significantly, an immediate opportunities for growth, as well as successes that have been today. Next slide, please. Oh, no.
Oh, okay, no problem. There you go.
Apologize for interrupting, but I did just get a note that our translators are requesting a bit of a slowdown in speech. So if we could try to pace ourselves. Thank you so much. Really appreciate it.
Of course. Thank you. Thank you, Ken. Our EPI data show significantly higher rates of COVID-19 infections in the Latinx communities. The Department of Health Services moved to establish a Latinx health work group. And as the work group identified the urgent and critical need for culturally responsive resources and services focused specifically on these populations. This led to an equity design process to identify the following priority areas: availability and access to COVID-19 testing, case management and wraparound services, and also outreach and meaningful community engagement, including a specific focus on farm workers, as they were one of the most impacted communities here in Sonoma County. It was clear that the resources and services being provided to those more disproportionately impacted did not match the scale and scope of the disaster. In order to change the trajectory, services would need to be both hyper-local and culturally responsive as well. To honor the voices of the Latinx Health Work Group, Department of Health Services put in RFP what is known as the CURA system and network. Next slide. So this is kind of where On the Move came in. On the Move applied and was awarded the contract on what became the CURA project in October 2020. On the Move is the parent organization for La Plaza, Nuestra Cultura Cura, which is a family resource center located in Santa Rosa. The Plaza program itself was founded over 35 local Latinx leaders in Sonoma County to promote health, well-being of the Latinx community by combining traditional and non-traditional healing practices. Next slide. So a little bit about CURA's partners. The vision and the idea was to build upon the efforts of individual organizations and their neighborhood level expertise. CURA established a collaborative network and provided resources to support the coordination and delivery of direct services countywide, while relying upon the wisdom and relationships of its partners, without which CURA would not have been able to do and have the level of impact that it did. These partners weave together a safety net of direct services to support the needs of the Latinx residents, farm workers, low-income, and Indigenous-speaking communities. More than 70 number of community, 70 community-based organizations throughout Sonoma County came together to leverage each other's expertise and respond to the disproportionate impacts of COVID-19 and the crisis that it caused. This would not have been possible without the unified effort of each participating organization, and really the key leading factor to the success of the project, including having partners who represented each region throughout the county and bringing them an investment and intimate knowledge of their local community and their priority populations. Together, the CUDA network has provided the following services and achieved the following results. And I'll be walking you through some of those results. Next slide, please. There are 4 pillars to the CUDA project: outreach and engagement, food access, case management, and emergency financial assistance. Through the implementation of CUDA, we've begun to better understand the scope of disparities and inequities, the burden that this has actually placed in communities during the pandemic. In 9 months, 13,276 people have been reached by CUDA's outreach teams and community partners. 4,161 people were supported at least through one of CUDA's direct services. 3,074 people received a total of $5,106,300 throughout Sonoma County in terms of emergency financial assistance. Next slide. So now to dive in a little bit deeper into, next slide, oh, there you go, into each pillar. Outreach and engagement. The outreach and engagement strategy employed by CUDA was designed specifically for and by the Latinx community, including the Latinx health worker promotoras, case managers, and CUDA staff, all who are all community members as well. Together, they identified gaps, created systems to improve communication, coordinated outreach strategies, create aligned messages, and shared resources. These efforts were coordinated in weekly meetings, trainings that led to greatly expand reach into the neighborhoods and communities that were most impacted by the pandemic. A key component of the project was getting accurate, relevant, and timely information to our community from trusted messengers. Trusted messengers are really individuals who are known and trusted by community members. They're leads in their own communities. Informal community leaders, community health workers, or promotores and promotoras. CUDA specifically focused on centering promotoras in guiding and developing culturally and linguistic relevant outreach and education strategies. This is also what research is telling us about how we're going to get the remaining 10% vaccinated. They focus on hosting charlas or informal chats and conversations with residents in their workplaces and community, as well as neighborhood level engagement of residents to educate them about the risk associated with COVID-19 and how to keep themselves and their family safe, the support services that CUDA offered, and also how to access vaccines by highlighting events and clinic locations. All of these strategies combined a reach and engage targeting 3,276. We can see here 43% were through canvassing and neighborhood outreach efforts, 27% were through pop-up clinics, 17% was through vaccine actual clinics, 9% were through charlas, and 4% through food distribution sites. A little bit about the languages that are spoken of the individuals that were part of these events. 83% were Spanish speaking, 11% were English speaking, and about 6% or so were indigenous speaking languages. Next slide. Food access. Food insecurity and access to culturally appropriate food continues to be a significant challenge communities face. Access to food has been critical to supporting community members to stay at home during their time in isolation and quarantine. This was critical because individuals and families needed both adequate nutrition, but also a sense of care. Being able to eat food that they were familiar with was key. The support of partners, CUDA was able to help meet the need in community by really connecting individual or family to remember their nutritional needs during the isolation and quarantine, acquiring foods that were requested or needed, delivery of foods directly to that individual, but also providing bags or groceries while canvassing neighborhoods when outreach was being conducted. CUDA provided over 1,966 folks for over 4,000 meals 1,252 of them were children, and the average family size that we're looking at was of 5 per family. Next slide. So case management. The network's goal was to provide a safety net of basic needs support. And the goal was really to help stabilize an individual or family facing a crisis due to a pandemic. Through family resource centers across the county, CURA provides case management and wraparound services. It's important to acknowledge that beyond case management, these incredible case managers were confidence advocates and system navigators for their clients. Some of these services include support in securing and navigating COVID-19 testing appointments, vaccine appointment support, food access point, connecting to immigration or legal aid services, supporting completing government application for aid, and emotional support as well. Many clients identify isolation as part of a big challenge during this process. In addition, emergency financial assistance was provided to 1,270 individuals to date, and long-term food resources through mental health services, like as mentioned, COVID-19 testing and vaccines, provision of PPE and emergency preparedness information, legal assistance, and medical resources. So some of the folks that we were looking at, some of the people that make up the clients that CURA serves were working with Latinx community members, low-income wage earners, and renters here in Sonoma County. The ethnicity were 84% Latinx Hispanic, 5% identified as non-Latinx, non-Hispanic, 2.5% of them were Indigenous speaking. And also, in regards to their housing status, 80% of them identified as renters, 7% of them were homeowners, 1% was temporarily unhoused, and less than 0.5% were unhoused in terms of who CURA served. Next slide. Thank you, Ken. Emergency financial assistance. So individuals and families affected by COVID-19 needed additional supports and resources to ensure that they could isolate and quarantine safely without having the additional concern of losing days of work, which many meant that the difference between putting food on their table or putting a roof over their financial assistance played a critical role in protecting public health and helping community members stay home during the 2 weeks of isolation and quarantine. Key partners in this effort were UndocuFund, the Child Parent Institute, who issued over $5.1 million throughout Sonoma County, and other additional partners that were critical in supporting this process of applying were Corazon Healdsburg, La Luz, McDowell Family Resource Center, River the Coast, and Via Esperanza. Emergency financial assistance was administered in each region of the county. The slide you're looking at shows how many individuals were served in each kind of side of the county. What percentage was the total number served and how much aid was distributed in each region. Finally, I'll be reviewing the major lessons learned over the project, and I'll start with growth opportunities, which outlines areas in which learnings have informed strategies to continue improving systems like that CURA has created. Next slide. All right. As a county, we must build capacity to learn and engage with subpopulations of different ethnicities, but within the Latinx community, our Indigenous speaking folks, LGBTQI+ community, and other regions of Sonoma County, like West County and other rural parts. Until recently, also, the eligibility criteria for emergency financial assistance was narrow and only allowed individuals who were employed to access support if they needed to isolate and quarantine. This left significant unmet needs in the community. Many individuals and families experience economic hardship due to the pandemic, including lost wages, increased ongoing and medical expenses, bureau information costs, as well as continued economic hardship due to the pandemic. Most recently, we've been able to expand the criteria and been able to address some of those gaps. As we move into long-term recovery phase of the pandemic, really the recommendation based on some of the lessons that we've learned and we've had thus far, it's that when we have co-design processes that ensure that community members and leaders are able to continue to provide input on those ongoing needs, that helps our systems change and move forward. There's so much we're able to glean from opportunities for growth and also from ecological wealth, the collaboration amongst just many unique hyper-local organizations who took part in serving communities through Cura. Something that's not listed here, but I love to highlight were the significant successes recognized by the Cura project and also just the tremendous partnership. It was really, truly the sense of belonging that embedded through the Cura system and ensure families' preservation when serving communities with dignity and respect. In order to trust and confidence in the community, it's crucial that individuals engaging in their services do not feel isolated or stigmatized or singled out. Embedding practices to create a sense of belonging in every aspect of the program from the first point of contact when somebody walks through the door, and really ensuring the services ensures communities do not face additional harm that was already caused by a disaster. It's been successful to have caring, for caregivers, including acknowledging and addressing secondary trauma. Playing an active role in disaster response and recovery can take a significant toll on nonprofits, community serving organizations, and their personnel. Being flexible and nimble to meet those emergent needs, it's absolutely needed. On the Move was able to respond its emerging community needs and needs from partners by leveraging its capacity and infrastructure as a lead agency. And last and major, I would say, success was practicing the deep listening and let community lead through this process. And there's one thing we've learned from this effort is that when we allow community to lead and co-design systems with us, those systems themselves serve the people that are most impacted and create avenues for healing, therefore leading us to a sustainable recovery. Thank you for your time. That's it for my presentation.
At this time, we'll move on into the feedback survey, and we'll have Nora Melanie Brand present this part of the presentation.
Thank you, Tina. Thank you for letting me share about another element of this report. As a reminder, Tina mentioned up front, but we sent out a survey to folks involved in the response to hear their feedback on successes and challenges. We sent the survey to staff involved in the response, to our partners, community partners, including many of the CDOs that we heard from today, health partners. So I'll go through some of the highlights from those responses, and I think you'll find that much of what I'm going to share reinforces what we've already heard throughout this presentation. So the survey began by asking respondents to rate our overall preparedness. So thinking back to the beginning of the pandemic, how prepared was the county in a variety of elements to stand up a response? And so what you see here from most prepared to least prepared are the elements of that response. You see at the top that our ability to provide information to the public about the response stands out as the area where we were most prepared. I think this reflects, the county's growing area of expertise, unfortunately, in this area in emergencies. And then at the lower end of our preparedness, you see our establishing a contact tracing program, providing a safety net, and standing up our non-congregate shelter and alternate care sites. And as discussed earlier, these are all areas that were new to the county in terms of standing these things up at this scale. Next slide. So survey respondents identified a few factors that contributed to our overall level of preparedness. I think it's important to note that respondents really did have reasonable expectations about what we could have been prepared here, a real acknowledgement that our nation, our globe was not ready for this event. But looking locally, also noting lack of uniform messaging among leadership early on that might have contributed to our preparedness. elongated timeline for establishing a response structure. Internally, in particular, staff noted the parallel Department Operations Center and Emergency Operations Center structures and some of the duplication and confusion that those led to. A sense that our public health infrastructure was just under-resourced initially, and so there was a perceived kind of scramble to staff up and resource our initial response. And I think echoing much of what Denny has shared, just a sense that we weren't initially centering equity in the design. So survey respondents addressed language access issues in early communications, the lack of interpretation and navigation in languages beyond English, testing in the early days, and health orders that didn't consider the variety of living and working conditions of people in the county. Next slide. So I think if this, pandemic was defined by one thing, it was by how quickly the situation changed on all fronts. And so the survey asked for people's feedback on how well we were able to adapt to those changing conditions. So again, here you see at the top, our ability to provide information about the event to the public rises to the top, followed by our ability to secure and distribute supplies and standing up adequate testing. And I think these two really reflect our ability to overcome some of those early challenges that Ken and Dr. Shende addressed, and to, again, just adapt and respond to the changing conditions. And then at the lower end of our adaptability, we see the same areas, providing non-congregate shelter sites, safety net, enforcing health orders and mandates, operating our contact tracing program, and providing alternate care sites. Next slide. So again, survey respondents acknowledged that the rapidly changing information from the federal government, the state, just the general political landscape over the last year really influenced our ability to respond locally. People identified internal processes, things like contracting and hiring, processes that take time, and the best of times all had some influence in our ability to adapt or change course. Internally, staff also just acknowledged that as our response grew, our COVID unit was established, it was more challenging to communicate and collaborate across various components of the response just due to the sheer size. And again, a sense from survey respondents that it took us time to implement equity-driven strategies. Our ability to identify racial disparities and communities and geographies most impacted, and then to use those data to implement strategies specific for those communities. Next, the survey asked, how well did the county meet the needs of our most of our diverse community and those most impacted? And we see here at the top a real recognition that the county did evolve and reflect in its collection. People cited the ever-evolving SoCo emergency website, and it's, again, just how it evolved in terms of looking at disparities and equities in different ways. Followed by establishing our vaccine and testing programs. I think these are testaments to some of the collaboration and partnerships as well that helped these be successful. And then in terms of equity, again, the same programs and services are ranked lowest here. Next slide. So I think the overall takeaway on this piece was just a real sense that we were slow to be able to implement culturally appropriate, language accessible services and programs for those most impacted. A sense that guidance and strategies overlooked particular communities. Survey respondents identified a number of communities and groups that faced excess hardship due to our initial response. So essential workers, multi-generational households, those without access to healthcare, our undocumented community, youth and children and the unhoused all had separate challenges in terms of being able to follow the health orders, shelter in place, and stay safe. Next slide. So the next component of the survey asked for specific feedback on key elements of the response. So I'll go through a few of those areas, again, looking at successes and barriers. So key to the response was collaboration and partnership with a variety of entities. Too many to name, but our hospitals, our federally qualified health centers, skilled nursing facilities, community-based organizations, and survey respondents really credited that collaboration and partnership with helping make the response what it was. So achieving more equitable testing and vaccine distribution, really making sure that these efforts reached and were accessible by everybody in the community. Community-based organizations were really seen as essential to connecting individuals with systems, with healthcare, with the resources that they needed. Dr. Mace herself was called out numerous times for her transparent and frequent communication with partners about not just changing conditions, but about strategies for responding. There was a sense that broadly communication was a real collaborative effort, shared resources, shared messaging, and efforts to instill equity principles in our communication strategies. And people really acknowledge that, particularly within our health system in this county, pre-existing collaborations, things like Health Action, the Committee for Healthcare Improvement, and numerous other collaborations were really essential to building a strong, unified response because trusting, longstanding relationships were already in place. I think the barriers here that rose to the top had to do with some of that historic partnership. So many of the community-based organizations that were so essential to kind of this boots on the ground effort lacked that partnership and history with many of the other partners, with the federally qualified health centers, for example, or hospitals. And so it took time to build relationships and build some trust in order to establish those partnerships. I think there was also a real acknowledgement that the community-based organizations leading in this way were just under-resourced to meet the overwhelming need in the community. Next slide. So CUDA, and we heard just a wonderful presentation about CUDA. I think the survey reflected much of what we heard there. Really an acknowledgement that CUDA played an essential role in providing resources and supports to those most impacted, as well as really crediting CUDA for its role in its this kind of pulling together and relying on this vast partner network of trusted partners, really engaging organizations that are trusted partners in their community, but also recognizing the role that CUDA played in building its own trust and its own branding just by being present, by really being an engaged partner, by hearing feedback, by making program changes. Barriers that rose to the top, again, just the massive need in the community was very difficult for CUDA to meet, staffing and resource-wise. Overall, there were insufficient funds to meet the need around cash assistance, which was such a critical component of the work, and insufficient inroads with Indigenous communities. Much of the feedback we got through the survey on the emergency rental assistance program we have already heard today, but people did really feel that it provided critical rent to keep people housed during a really unsafe time. But barriers were around just people not being aware of the program or being afraid to even engage with the program in the first place for fear of some of the requirements that might be required in the application process. And the last item here, survey respondents were asked for feedback about some of the policies and ordinances that were put in place to protect the community, things like sick leave and eviction moratorium, and then the enforcement around those. So people, again, really recognize that these were critical interventions to support those most impacted, workers with sick leave, renters, families. These were critical to helping slow transmission by allowing people to stay home when they were sick or suspected they were sick or had been exposed. County staff appreciated the supportive policies that the county put in place around telework, both in terms of their ability to contribute to the response, but also to just acknowledge the extra burdens that staff were facing in terms of also supporting families and children and things like that. I just want to recognize that a lot of the feedback in the survey was about the amazing work of the community. The community was largely compliant and understood the health orders and followed the health orders to keep each other safe. The barriers that were identified had to do with needing more communication to those who could have benefited from some of the policies. So employees who might have feared retaliation, for example, but also employers asked for more support and resources to successfully implement some of these things. And the early public comments from the sheriff about compliance and enforcement, I think, also came up as setting a precedent in the county that wasn't helpful to the overall enforcement response going forward. Next slide. And lastly, the survey asked respondents to identify best practices, things that they had seen in their community or in their organizations that they wanted to share. And it was a long list of really amazing work. So I'll just share a few things. Again, highlighting the really critical work that community-based organizations did right off the bat to support quarantine and isolation support, but also to identify the real need around wage replacement and cash assistance and making funds available immediately to get money in people's hands who were losing work because of the shutdown or because of the virus. We heard a little bit about food resources. This was echoed in the survey. A number of respondents identified food distribution went way up despite putting in place all of these safety and health measures for their staff and volunteers, and credited the county for playing a large role in helping increase that distribution. Staff, again, really credited the Emergency Operations Center and Department Operations Centers for adapting to work from home, and really felt like this is going to open a lot of doors for disaster service workers in future disasters when we face evacuations and things like that that have previously prevented people from being able to fulfill that duty. And then a number of people identified the quick expansion into telehealth. So setting up telehealth where it didn't exist for clinical visits, but also for social and welfare checks and things like that, that really helped ensure that essential services continued to move forward when we weren't able to meet in person. And with that, I will hand it back to Tina.
At this time, Chair Hopkins, we can, if you prefer, open for questions at this juncture of the report, or we can proceed with our Latinx Health Work Group presentation. Just wanted to gauge and see what you would prefer.
Thank you very much, Tina. We'll go ahead and take questions and then take a very brief break because we haven't had an opportunity for a morning break, and then transition over to the Latinx Working Group presentation. So any questions from my colleagues, recognizing that we will have time for discussion afterwards? Okay. Supervisor Gorin?
Just an observation. It's not surprising to me, but it is revealing that there were few responses to the survey from the outlying communities that may have had disproportionate impacts among the Latinx and Indigenous populations, such as Sonoma Valley and elsewhere. And that's just the county, and we need to acknowledge and create better outreach efforts to solicit those opinions. It doesn't mean that the data is wrong, but just a reflection that, once again, we need to do a better job of outreach to verify and contextualize some of the information that we receive on this. So thanks so much for all of your help.
Any other questions from members of the board? Supervisor Gore.
Yeah, thank you, Chair Hopkins. A couple things. First is something that I talked with Dr. Mace about a while ago, which was, do we need to have a federally qualified health clinic that's associated with the county? So the reason I say this is that our public health lab, prior to the pandemic, there was discussion about that coming as a recommendation to the Board of Supervisors to outsource it. And from my take is that the public health lab was one of our most vital assets to run as a public entity as we took on this pandemic. And I do know that other counties, for instance, Contra Costa County operates 11 FQHCs with others. We are no longer in the system of direct care, having signed our contracts over to Sutter from Sinead years ago, and not having any health clinics. And I just do this as a spot open question. Do we want to be able to be in the business of direct care, or not even trying to get continual patients day after day, but if there is a pandemic in the future, being able to move into that area? And I just interested in thoughts on that.
I would say there are reasons we're not in the business of direct care. I think that would take some analysis. I think there some serious cost analysis. I think that probably is the main reason we're not in the business of direct care. I think we can still achieve, our objectives with greater integration and greater partnership. I think that was proven during this pandemic. Certainly, there are advantages to having an FQHC, but I believe that there are also advantages not having one, in particular cost advantages. But also deepening those partnerships, I think, is key as we continue to move forward. So I think if your board chooses to explore, this particular suggestion, I believe it would take some serious cost analysis and looking at sustainability, because it's my understanding there were reasons why we do not have this particular, why direct care was shut down.
Any follow-up to that, Supervisor Gore?
Yeah, a couple other things. One is if you look at the percentages of satisfactory or not with respect to our management, the entire system of care, not just our management, but how people looked at it, you see the numbers are very low. And it's not surprising. There was a lot of frustration. I think the point of doing a point in time review is to make sure that if, as Supervisor Hopkins, as you said, is if we go from the Delta variant to the Epsilon variant, and we get back into a difficult situation, or if we're good for a couple of years and then COVID becomes TOVID or something like that, is that we're more able to actualize those partnerships on the front end. So instead of talking high level, I know a lot of this might go into discussions about ARPA and other things like that. So I just want to encourage all of us to look at this point in time and any proposals that might come for deepening the system of care, to have metrics and other kind of deliverables and accountability measures attached to them. One of the things we talked about was how long it took us to fund some things with equity. If you want to do equity work, you have to put a lot of funding and a lot of time into it right off the bat. The one time when the state, and I would ask some of the thoughts from our staff, but when the state finally started to hit equity goals was when they prioritized vaccines directly for those and said you have to get the Healthy Places Index, the 2 HPI quartiles. So once again, once it finally was attached to vaccines or attached to, so just hoping any kind of high level from the Cura project folks and what we can do going forward. Thank you.
Thank you for that. Any other thoughts from staff, or should we go ahead and take our break and then reconvene for the rest of the presentation? Seeing none, any final questions from my other colleagues? All right, so we are going to just take a brief break. Let's try to keep it even under 10 minutes if we can reconvene at 11:20, and then we will hand it over to our presenters for the rest of the presentation.
Hi, everyone. We're going to resume the meeting, and so we'll take down the slides. Thank you. And then we'd unmute and show video in the chambers.
Marcy, this is Ken Hassett. Would you like me to start share screen right away?
Just, if you allow me 1 minute, I'll just make sure that we're all seeing and hearing each other.
Thanks.
Thank you. Okay, excellent. That looks great. We're good to go, Ken, whenever you are. Unless the chair has some comments.
I was going to hand it straight over to Ana Lugo and Ana Horta from our Latinx Health Work Group for their presentation. And thank you both so much for attending today.
Thank you, Chairwoman Hopkins, Board of Supervisors. Before we move on to the next slide, we just want to thank you for giving us the opportunity to be here again today. This is about a little bit over a year since we were here last, when the CUDA project was merely a set of recommendations that we put forward to you all, and we are grateful to be able to be back here.
I also want to thank the Office of Equity and the Department of Health Services for their continuous work and support.
Next slide, please, Ken. So I want to give you just a little background. I'm sure you've heard this before. The Latinx Health Work Group was convened by the Health Services Director at that point, Director Barbie Robinson, in May of 2020, after that showcased the disparate rates and COVID-19 in the Latinx community. In June of 2020, in June of 2021, the Department of Health Services hosted a focus group with the Latinx Health Work Group to provide feedback on the response for COVID-19 and suggest recommendations. Next slide.
Okay, so a little bit of who we are. We are composed by many people and wonderful people. Dr. Jenny Fish, Mari Carmen Reyes, Sonoma Valley Community Health Center, Stephanie Manieri, Latino Service Providers, Ana Horta, Gabriela Orantes, North Bay Organizing Program, Irene de Baracuaira, Líderes Campesinas, Elliot Enriquez, Petaluma Health Center, Shalene Lopez, Rocio Rodriguez, Sonoma County COAT, Ana Lugo, Equity First Consultant, Rosa Gonzalez, Great Dale Labor Center, Christine Lubin, Great Dale Labor Center, Griselda Correa Martinez, Santa Rosa Community Health, and also MCUI, Movimiento Cultural de la Unión Indígena. Next slide, please.
Before we move on to key successes, I just want to point out that there were many other members that were here prior to the current list, many who started, who are no longer here, who provided their wisdom and expertise and their knowledge of community to the Latinx Health Work Group and all of the work that has happened in partnership with the Department of Health Services. Some of the key successes that happened in partnership with the Latinx Health Work Group, the Department of Health Services, and the Office of Equity was the focus on data and really making sure that we disaggregated data, that we were able to understand who were the most impacted. And we have, and this has been continuous work, the most recent result really understanding the disparate impacts, not just on the Latinx community, but communities of color in general. So the more that we're able to focus our efforts in data, we have found that the more that we're able to truly understand what the impacts of COVID-19 have been on communities. The level of engagement and wraparound services, right? The CUDA was started through the Latinx Health Work Group. We just heard an amazing presentation by Ms. Candela around how impactful it has been, and on the ground, the amount of gratitude that community members have around this program. And it all is because it was truly co-designed and developed by people who were on the ground, who were doing the work on the ground, and it was and continues to consistently change and evolve. And just want to place such a deep emphasis on the amount of work that On the Move has done to make sure that they are taking care of their employees, that they are taking care of the people who are taking care of our community members. That has been a huge success. Addressing root causes and pressing for equity-driven systems change, that has been a success. I think we still have a lot of work to do to make sure that we are institutionalizing our learnings and we're changing systems. And right, credit where credit's due, it is happening. Making sure that we're bringing culturally responsive services to community. In partnership with DHS and the Office of Equity, we have worked really hard to make sure that this is happening at the vaccine clinics, at pop-up testing programs, etc. And really making sure that we are empowering the people who are doing work on the ground. You may or may not be familiar with promotoras and promotores. These are people who do engagement, who bring education, who bring their whole selves into the work and make sure that they're connecting with community. They know community the best. And so it's really about harnessing their wisdom and expertise so that we're able to reach the communities that we seek to reach. And this is definitely a model that can be implemented in other programs and spaces throughout the county. Next slide, please.
In terms of the local health orders, the local, the health orders impacted communities, those other underserved and less resourced in a very different way. And that wasn't taken into account. Families and individuals that don't have access to healthcare or a place to isolate safely, don't have access to sick leave or safe outdoor spaces. Entire families sometimes sharing small spaces, being afraid of coming forward and ask for sick leave or even ask for assistance because of fear of being deported. The county was slow at providing communication definitely needs to be improved in a meaningful way, in a culturally competent way. Different cultures communicate differently. And if those populations that are more impacted are not getting the message, then the communication is not happening. Outreach and engagement, that's definitely another big need. Quarantine and isolation was also slow. Many people were afraid of, seeking for help and assistance, again, because of being undocumented or not feeling that they could trust the system. Food and housing resources as well, and emergency cash aid. In terms of food, a lot of us could call or could order things through Amazon or Whole Foods, and many of the people in our community simply couldn't do that. So just having those things in mind. Next slides, please.
Thank you. And I just want to clarify that this is all the feedback that was received from the Latinx Health Work Group. The way in which the vaccine was rolled out, the plan and the implementation of it really failed to incorporate lessons learned from testing. We had very robust conversations and changes in the implementation of testing, and we just failed to incorporate that into actual vaccines, and that really created hardship for communities. There was a leadership gap in ensuring that all partners centered equity and best practices. The Latinx Health Work Group definitely understands that the County of Sonoma and Department of Health Services ability to get other partners to center equity and build best practices into their systems may be limited, and yet it was so deeply necessary. And so we definitely fell short in that. There were instances during vaccine clinics where people did not feel safe, where there was no translation, or if there was translation, maybe it was a small document on the wall. And so we saw this during testing, and we continued to see it during vaccine rollout. And that is why we continue to say that our lessons learned must be institutionalized. Policies and systems change have to be priority. And we did not consider the disproportionate impacts on farm workers and Black, Indigenous communities of color. We continued to put the burden on communities of color to continue to serve this county and run this county. But we didn't actually place a priority in making sure that we kept them safe. So while we utilized a formula in a prioritization that we thought was accurate based on the not dominant culture's narrative, we didn't actually prioritize the people that were most at risk, who were on the front lines, and we are continuing to see that today. Next slide, please.
Communications, like has been discussed throughout the whole presentation, definitely needs to be improved. The traditional methods that the county has been using don't work for communities of color and underserved communities. The county lacks mechanisms of and best practices to reach and engage this community. We need language access. We need to trust our messengers in the community. We need to do outreach and engagement, a genuine engagement that is centered on building relationships and trust. And also, some of our trusted messengers are also the community-based organizations, which are crucial and have been crucial in this. Tools like Nixle could be really helpful as well. And just also making sure that this engagement and this communication system, it becomes a consistent method throughout all the departments. So there is, so it's clear and it can be conveyed through anything that happens, not just like one department implementing it and then the other one not doing it. Next slide, please.
So this takes us to race and social determinants of health. We have had many conversations around Healthy Places Index, right? So we want to really keep in mind the intersectionality between race and the well-being of individuals, and taking a holistic view at the way in which we live our lives, right? We are not just a part of a whole, we are all of it. And so making sure that we are also activating and implementing county point of view. So making sure that we are addressing racial and ethnic disparities will be key to ensuring that we deepen our understanding of the role that systemic oppression, systemic racism and systemic oppression plays in health disparities. Making sure that we are addressing social determinants of health, right? This is where we talk about policy change and ensuring that we are taking into consideration the root causes of these inequities, right? Making sure that we are not pathologizing individuals, but that we're truly understanding the ways in which systems fall short of truly serving communities. There are very big problems in our community that are not news to any of us. We have housing that is not available to everyone, that not everybody can afford, right? We have many times heard the narrative that Latinos love to live all together. Well, that's not necessarily the reality, but that is what happens when you have inequities, right? And so pathologizing communities that live in in spaces with many other individuals and saying that the reason that they were infected is because they live with all these other individuals, that is pathologizing an individual and a community rather than truly understanding the systems. And that leads us to the lack of living wages. We really have to look at how do we make sure that people are able to live here. If we want them to work in the types of industries that people work in, how do we make sure that we're also coupling that with policy that gets at housing, that gets at living wage, that gets at helping people own their own home, right? And making sure that people have access to healthcare. I think that we take that one for granted quite often. And unfortunately, the way we have seen through COVID-19, that is a huge barrier, and that actually keeps people in spaces where they may get sicker than they need to get because they don't have access to healthcare and because they don't know how to access it. Making sure that we are collecting and using race and ethnicity data, but not that we're just collecting that specific piece, that we are using that to see the full humanity of beings, right? We need to start humanizing data and stop creating narratives that pathologize individuals. And we have to make sure that we're also making data-driven equity-focused funding decisions. And we all talk about equity, and I think that the disconnect is that we're not all working from the same definition of equity, right? It needs to be embedded in all of the work we do, from the tiny decisions to the big decisions. And that brings us to the American Rescue Plan Act, also known as ARPA, and I think most commonly known as ARPA. And we have to make sure that the way in which we distribute funds is equitable, and that we are centering communities of color, because we did open this community back up last year on the backs of these communities, and data shows that. Next slide, please.
Opportunities for growth. Well, I think COVID-19 has definitely handed all of us an unprecedented lesson, and I really hope that this translates into an unprecedented learning. In terms of BIPOC communities, data shows that these communities, have been most impacted by COVID. The data has been there. We know some of this truth, but if we don't use that data, if we don't have intention behind that data and making change, then it doesn't translate into improving the lives of people. Communications, again, learning what from our experiences and having language access plan, having a culturally sensitive plan that address other communities that are different than us. Engagement, building those relationships and those trust with community members, providing an avenue for feedback and conversations, listening to them. Policy change, that's what we all hope. We hope that if things are not working, things will be changed and things will be centered into equity, and will start actually uplifting those that have been living in very hard conditions and under very hard conditions historically. Equity-centered decision-making, take the lessons that we have learned and that we have had learned in the past as well, to really make an impact on those communities of color, or those communities that don't have access to all the things we have access to, that experience inequities. And finally, having accountability mechanisms, way that we can, hold the county and ourselves accountable for these benchmarks, these goals that we want to achieve. Foster, engage in the capacity building across all the departments in the county. Next slide, please.
So we want to also talk about what can we do in the future? What can we study in the future to understand the impact better, but also understand the community better? And I'm truly grateful to Chair Hopkins for asking around how do we advocate to the state and federal level when our needs are not being met? Because one of the things that we had that we didn't list on this slides, but that we are going to start to see, is the mental health impacts of the pandemic. The amount of support that will be required for communities, and who will hold that knowledge of who needs the support will not be known by the county. It will be by the promotoras and promotores, and figuring out how do we get that data so that we can truly understand the impacts will be key to the well-being of our community. And I just want to emphasize that we are as healthy as the sickest person in our community. So if we are not designing to the margins of the people who are most disproportionately impacted, then our community as a whole is truly impacted. The other thing we're asking for is that we schedule the CURA systems and other equity-driven efforts a study session. We asked for a study session. We were told we would get a study session. We are happy to co-design and co-facilitate the study session with the board, but we really need to take a deeper look at CURA. What we saw today were highlights of a very complex system that can truly be a catalyst for systems change locally and beyond. we want to make sure that we all fully understand what culturally responsiveness is. It really isn't one at the expense of the other, making sure that our community fully understands that what we as government need to do is expand our systems, expand our culture, expand our institutions so that they can fully encompass everyone in our community. When we design to the margins, we collect every single other population, and making sure that we are also designing for other communities of color. We want to make sure that we're institutionalizing equity. Like I said, that we are truly driving policy change and systems change, that our board is at the helm of this change, that our board is pushing for this, that our board is asking for this, and that our board is requiring this of their employees and their staff and their departments. And lastly, it is not here, but we will be adding, maybe Ms. Rivera will talk about this, but the Latinx health work group will become the equity health work group, because we know and understand, and the Latinx health work group has asked for this, because we know and understand that it is beyond just the Latinx community that the disproportionate impacts have been felt. Next slide, please.
Institutionalizing equity in terms of the ARPA funds, these communities that have been disproportionately affected is not new, it's historic, and this is going to take time, and it's going to take investment. Therefore, those communities should be the recipients of those funds, and should be those funds should be centered. The plan should be centered around equity and the equity metrics. So if you have a community that is already stretched thin, and then you on top put a pandemic, that community is going to be in dire need of help. Even we've seen it today, right, with the Delta variant. Some of the numbers, we continue to see those disparities in those numbers. So there is a lot of work that needs to be done, and there is a lot of investment that needs to be done. I also feel those communities deserve our time and our investment. And I hope that we center equity and those communities at the ARPA funds distribution. In terms of equitable systems, having policy change and transform the current systems that we have, uplift and resource the county with staff so they can implement equity, have a shared responsibility. So the equity should not be just the job of the Office of Equity, it should be everyone's job, and it should be in everyone's mind, should be incorporated into the county structure and system. Becoming part as well of that county system. Dialogue with the community, feedback, taking feedback, building trust, building relationships. Accountability, creating a county-wide equity framework, and ongoing investment. Again, continue to support those communities that throughout time and throughout history have been suffering in disproportionate ways, and don't have the same amount of resources that the rest of us have. Next slide.
If we go back, that we want to also acknowledge that the Latinx Health Work Group has said time and time again, we don't speak for the Latinx community. We can bring our knowledge and our wisdom and our own experiences and positionality in the community to inform efforts. And with that said, we saw through the survey responses that that we haven't gathered enough feedback from community members. And so we do want to recommend, and we want to ask that we start to truly create a plan for how we will get feedback from community and from communities more disproportionately affected. I also lastly truly want to honor every member of the Latinx Health Work Group, every person who has worked on the ground for so long. It has been such a hard road. I will say that I was feeling deeply overwhelmed earlier when I was hearing the CUDA presentation, because there is so much grief in our community. and a lot of grief that continues to be created and that hasn't yet been processed because this isn't over. And the people working on the ground were listening to people be in the ICU, being afraid of dying, feeling alone. And they were the ones that were calling people so that people didn't feel alone. And that's the level of work that has happened on the ground that I want to make sure we uplift and that we honor. And Ana Horta and I are here simply to provide a voice to that. But the experience are ample and they expand all of the communities and all of the organizations that were named earlier. And I also just want to honor the pain of the communities who have had to lose families because of the inequities in our systems. And with that, we want to open it up for questions.
Thank you very much, Ana and Ana, and thank you for your tireless work over the past, what feels like decades, but has only really been a year and a half. And I know that it's been a tremendous amount of meaningful and emotional and difficult work. And so I just want to say thank you for your dedication and for bringing your intellect and your fierce determination, and most importantly, your heart to this work. Because I know that you, and as well as many of the members of the Latinx work group, really just brought your whole selves. And we're seeing this suffering going on in your community, and we're working very closely with government to try to find a way forward. So thank you for that work and for that dedication. And please extend my thanks and my gratitude to the entire group and committee. So with that, I will bring it back to the board for questions and conversations regarding the information that was presented. And I briefly saw my colleague Supervisor Gore, and didn't know if you wanted to jump in as one of the members of the equity pillar of the task force, the ad hoc rather.
Yeah, thank you, Chair Hopkins, and everybody for leaning in on this. I think the biggest thing is a lot of this goes into our questions and our focus on with our ARPA discussion, and how we have not just an equity lens attached to a bunch of initiatives, but how we have an equity focus on a lot of it to really use this opportunity to turn the tide. So I would ask, really for Ana and Ana's kind of take on just the core partners and institutions that we need to support. So what I've heard is Cura, number one, we need a gathering place so that we're as a county not always trying to work with 160 CBOs, and obviously we've learned that. And then the second conversation really was really how to get to equity metrics and beyond good intentions. So looking back and just saying, if hindsight were 2020, what are some of the things that we would have employed with an equity-minded focus on the vaccinations and a lot of the testing from your perspective?
Thank you, Supervisor Gore. The biggest success we saw was the coordination of efforts, right? Making sure that we are not duplicating efforts, making sure that there's a deep partnership between our CBOs and the county, and that the information both ways is free flowing, and that we're making sure that we are designing to the margins when it comes to CBOs as well, right? So we have a lot of CBOs who are very small, but that are the CBOs that are doing the work on the ground. We saw CBOs like Raíces Collective really step up during the vaccine rollout, right, and start to do events to make sure that people were being vaccinated. We saw other organizations that started to do community engagement efforts. We saw Latino service providers really focusing on the youth population, right, and we have such a great opportunity. I think that the blessing and the curse for Sonoma County many times is that we have thousands and thousands of nonprofits, and then we have to start to prioritize who are the organizations that need the most support, who can have the biggest impact. And so when we can bring these organizations into the fold, when we can bring organizations that are led by people of color who are on the ground, who understand, right, who may not have the infrastructure. And I think that that's the biggest thing we saw, and the biggest deterrent for organizations time and time again, which is that they do amazing work, but they don't have the infrastructure. And what On the Move was able to do was bring that infrastructure and that flexibility and their deep connection to purpose and love. I mean, this is not a word we hear at the Board of Supervisors often, right? But love and healing for the community, and prioritizing that, not just with the community, but with their partners. And I think if we can focus on that and harness that, we will be much better off. The other thing is policy change, Supervisor Gore. We need to see policy change. We need to see you start to address housing. We need to see you start to address living wages. So until we start to see some of those policy changes and our advocacy up to the state and the federal government, and that deep communication and engagement with community, we're not going to see many different results. We will see temporary results, but not long-term results. And we know that the impacts of the fires have been compounded, right? We've been through so many fires at this point that have been catastrophic. And I will pass it off to Anna in case she has anything else she wants to add.
Yeah, and so what I want to do what Anna said about trusting those community-based organizations as our partners, and at the same time not burdening them, because what I have felt is that many times is that the county has put the burden of what should be their job on others. And those communities and based organizations are already stretched thin with resources. So they're being asked to do more or to do the job that the county should be doing with very limited resources. So that is very important, is trusting them, but also making sure they have the resources that they need. And again, yes, policy change. I think everyone is ready for that. And it's needed, it's very much needed. It's about time. Thank you.
Supervisor Gore, any follow-ups? No. All right, thank you. I will bring it back to the board for other questions or feedback. No. And that's if you want to go ahead and share any thoughts as well, that's fine, since it's an informational item. Supervisor Corsi and then Supervisor Gorin.
Thanks, everybody. First of all, I want to find out how we can get love and healing added to our county seal. I think that would be appropriate right now. Seriously, I want to thank all of you for the work that you are doing, that you've done, that you will be doing in the future. And not just the folks who are on this in this meeting, but throughout the Department of Health Services, throughout this organization, throughout the community. 16 months and counting. This has been hard, and the organization has stepped up. The community has stepped up, and I understand the feelings of exhaustion, of grief that you talked about, Anna, and just want to acknowledge that a lot of hard work is being done here, and I want to appreciate that. We asked for this in June, and we, I think, started off by calling it an after action report, and clearly we are not after action. Point in time is an accurate reflection of what this is. Eventually, we will get to an after action report, and in that, I hope that we can actually have some lessons learned from this exercise today. I appreciate all the information that's come to us today. I appreciate that we have input from others in the community as part of the survey. The information that the Latinx Health Group has presented is very valuable. But I think we need more voices when we get to an actual after action report. And most of these voices, most of these participants have been mentioned here in this report, but we don't have their actual voices. And I'm talking about our emergency management departments, the providers of care sites such as SSU and the hotels, more input from community organizations, federally qualified health centers, providers such as OptumServe and Cheryl Fox, schools, code enforcement, Cura itself. I appreciate the conversation and comments about Cura, but I'd really like to be hearing from people who have been on the ground and really part of this when we get to talking about this as an after action. So just some suggestions there. I want to return for a minute to the conversation about the emergency rental assistance program. I've been reminded that it's not just the state money that we've been talking about, but also federal money. And we've got some $46 million outstanding there that has not been put into the community. I want to put that into the community in every way that we possibly can. Talking about the equity effort that we've had across all these programs as part of this last 16 months, we still have a ways to go there. The renters in this community are very much overrepresented by minority groups. The white households, about 37% of white households are renters. 63% of Latinx households are renters. 89% of Black households are renters. So this is certainly part of our equity effort. And in the presentation about Cura, I was impressed about the way that they've been able to get into parts of the community that maybe we don't ordinarily do such a good job of. And I think that the theme of this discussion this morning is making that part of our everyday efforts, not part of a special COVID response, but something that we do all the time. So if we're able to use some of that $46 million to get help in getting that money into the community, let's do that. I don't know if Cura is the vehicle, but I think we ought to be looking at that. And there was just a passing reference to Nixle about being a way to do this. Can we send out messages in Spanish on Nixle advising renters that this resource is available, inviting them to get in touch with appropriate language speakers who can help them get their applications in and use this money. I'll leave it at that for now. Again, thanks all for your efforts, and unfortunately, we're going to have to keep it up for a while.
Thank you, Supervisor Corsi. Supervisor Gorin?
I also wanted to thank you so much for all of your work as part of the Latinx group, informing and advising us every step of the way. I also want to appreciate the representation that you have both formally and currently on the work group, because as you know, I've been really focused on representation from the more rural areas as well as the central area. And we probably could add a few more folks to the working group to get a fuller, richer understanding of what is happening in the outlying areas, Sonoma Valley, the river area, the North County. I also appreciate your recommendations or comments on its institutionalizing equity. And I've said previously today and previous to this meeting, community outreach is authentic community outreach. And we have not figured out how to do that. You are part of that, certainly, with the work group that you help with. I wonder if you could help us take a stab at what community outreach looks like, not only from the public health perspective, but providing information on applications for boards and commissions and appointments that the board makes. And every subject matter that we touch, we talk about community outreach, and we're not successful. I think for the most part, because we are a very large organization and we're, as you talked about, siloed in some of the subject matters. So if you would, I know this is outside the purview of the Latinx Health Group, but if you as a group could take a stab at what does that outreach look like? How can we use you, outreach to you to help us understand all of the groups that need to be included in community outreach? Is it a contact for each group moving forward, or is it individuals that are influencers or contact people in the community? Does our master list need to have a cast of thousands, or could we have just 50 to 100 people? Help us figure this out. That is probably the best way or at least one way we can move forward on institutionalizing equity across the board. So again, thank you so much. I'll go back and review your presentation and comments again, but this is, and I love the fact that it is part of the context of the after action report. Looking backward is so important and reflective so that we can be informed for moving forward, whether it is looking at the ARPA funding or any other grant opportunities. We can't be effective in that, first of all, without authentic community outreach, as I mentioned before, but also understanding your observations over the past 18 months. And I wish we were at the tail end of the pandemic, and your group, your contacts are more important now than ever to approach the vaccine hesitancy for families and children and young adults. So please help us with that, as I know you will. Thank you all.
Thank you. Chair, if I may add a comment?
Please.
I think Supervisor Gorin, thank you for your comments. I think the number one thing I would say before we dive into having the Latinx Health Work Group do any strategizing on how to get it, how to better engagement, is that it must be institutionalized and it must have a home, right? So whether that is under the CAO's office or the Office of Equity, wherever it makes most sense to have a Department of Community Engagement or a Division of Community Engagement, it has to be invested in, it has to be resourced, and it needs to have a home. I was calculating the amount of resources I have invested in the Latinx Health Work Group based on my hourly rate, and I have almost $250,000 invested into the Latinx Health Work Group that I have decided to put into this work, right? So if you think about the amount of resources that have been invested from organizations who allow Latinx Health Work Group members participate on their behalf, right? You're talking probably, we're going to get into the millions of the amount of time and resources that are being invested from the community into this group. So with that said, it will take a large investment, and it needs to be institutionalized, and it needs to be understood that it is a priority. Otherwise, it doesn't matter how much strategizing we do, it's never going to go anywhere.
Thank you, Anna.
And through the chair, if I might add, Chair Hopkins, I think it's also important to recognize, as a health department, we've been looking at broadening, our scope to support these systems changes with respect to equity. And as Anna mentioned earlier, dropping off the name of Latinx Health Work Group and just making an equity-focused work group and incorporating other communities of color, but also recognizing that making additional investments in the Office of Equity. Your board has, done some incredible things and made creating the Office of Equity and hiring our Director of Equity, and then creating equity as a pillar but I think it's also important to recognize that we do have this incredible critical investment, and it is centralized. And then understanding that to take that particular investment and institutionalizing equity across the entire county and looking at our policies, our procedures, et cetera. And, I believe that, Alegria could speak to this as we've been working together and looking at some strategies as how we can raise up or stand up a work group, a centralized work group together that can address just what we're talking about, incorporating other communities of color to deal with, those traditional policies that we have and how we can reimagine and redesign those so that we're looking at equity not as an afterthought, but institutionalizing it and looking at it, layering it into the everyday work that we do. Because when we think about the social determinants of health, it's across, it's not just the Department of Health, it's across all of our departments. It touches everything that we do here in the county. So it's really going to be important to assess the investments that we're making also in the Office of Equity.
Chair Hopkins, can I add a little something?
Sure, go ahead.
I want to really highlight the importance of having spaces like we have had with the Department of Human Services and Health Services and the Office of Equity and everyone involved in our conversations. That is really has been key to be able to continue to talk about these issues, which are very incredibly hard issues. And there were times where everyone was really overwhelmed and feeling really, done. But to be able to come back and have those opportunities to talk, to dialogue, it has been huge. And I feel like institutionalizing equity, it is institutionalizing humanity. We're not just talking, equity is not just a word, we're talking about humanity. So, providing spaces like this where we can all come to the table are going to be key to build those relationships, to engage the community. Thank you.
Thank you very much. Any further comments, Supervisor Gorin? Supervisor Rabbit?
Yeah, thank you very much. Thank staff for the presentation and thank our community members for participating and being here today. I think just stepping back into 30,000-foot level, it's been a frustrating year, right? I mean, we've all felt it at different points in times. We felt it with one another, with ourselves, with the state, you name it. But we persevered. And I think if you do look back from the higher level, that we did a lot of things right. We certainly, each and every time a decision came before us, I think we made the right decision with the information provided at the time for the right reasons. I think that, this is the inequities that are out there have been out there forever. But if you look back even from 2017 and in the first wildfire disaster to where we are today, it's vastly improved. And all we have to do, our job is to continue to make that continuous improvement going forward. In 2017, I think Anna Horta and Daniel Sanchez were translating press releases in my office to try to get out. I mean, so we've done better on the language side of things. Not perfect, but much, much better. All these things and bringing folks in and really trying to figure out those populations that need that we need to have additional work to really reach, I think are still there, whether it's racial, ethnic, age, disabilities. The disability community is something that came up in 17, and I'm not sure if we are as far advanced there as we need to going forward. So I think that, in some of the early on, some of the prioritization and even talking about testing or vaccines, the focus on first responders, essential workers, hospital workers, of course, the equity, the numbers were always going to look skewed because that's the demographic at the time, and the tiers, I think, emphasize that. But as we work through that, tried very hard and made some significant investments to, place where the county was the one to ensure equity within all the institutions. And I very much do appreciate that. At the same time, we learned as we went, and and sometimes I do think overall it was the right places to go. But looking back is always important, and lessons learned. We've advanced a long way from 17 in terms of a disaster. A pandemic is a very unique disaster in so many ways. But I do appreciate today, and I appreciate that we did call it a point in time as opposed to the after action, because we're not quite there yet. But I think it's important to kind of take all these things into consideration as we go. Some of the issues that keep creeping up within the disasters are issues that are out there all the time. Housing. So how do we actually get together and, we have a housing crisis, but we just kind of keep lingering along doing the same kind of things over and over in much of the community, much of the Bay Area. And so we need to kind of band together to figure out paths forward that aren't necessarily just about aid for housing, but really providing housing for future generations so that we can leave this place a better place for our kids and grandkids and so on and so forth. So I just want to say thank you to staff. Thank you for all the participation. We have a lot more work to do, but we have done a lot of work. And I just want to make sure that we were, put it out there that we're very appreciative of where we are, where we've come from, how far we've gotten, and we'll continue to work. Because I think if we get frustrated, you just have to overcome it, power through it, and keep talking to one another to find the solutions that are going to put the entire county and its residents in a better place. So thank you.
Thank you, Supervisor Rabbit. I just want to reiterate a few of the phrases that really hit home from the presentation, which is, the danger of pathologizing communities and the need to humanize data, seeing the humanity in things, and the fact that equity really needs to be embedded in everything that we do. It is not a check the box exercise. It is not, look, we applied an equity lens to the pandemic and now we're done with equity, right? It's how do we look at that with our day-to-day work? And then how do we also shine a special spotlight on it, particularly when it comes to these kinds of disasters, which we know disproportionately impact communities that are already at a disadvantage and just further exacerbates those pre-existing inequities. And I also would like to second Supervisor Corsi's suggestion to add love and healing to the county seal. And I really do feel like it's that love and healing that makes the difference between data and people, right? And to always remember that even when we're having these high level, conversations, even when we're tracking the data, which we know we need to do, right? To remember that there are human lives, there are people, there are families, there are loved ones that have been lost, there are wounds that will never be repaired, losses that can never really be compensated for in any way. And so just thank you very much for bringing the humanity to the conversation today. I feel like I could ask 100 different questions of, what do we do in terms of, ARPA funding going forward? What are, the next steps? What is the new committee sort of reconstituted and added with other communities at the table? What is that going to look like? But I think what I would like to do instead is just to ask you, what are your parting words? What are your final thoughts on it in terms of, just share with us sort of your thoughts on the future and next steps and where to go from here. And then we'll accept public comment and then we'll close out the item.
I'll let Ms. Orta go first.
Final thoughts. Well, yes, I agree. We have made some progress, but it's, to me, if people continue to suffer, it's not acceptable. So the level of progress is not acceptable, and that we need to continue to push for those changes and especially changes that are meaningful to those that are suffering, to those that are mostly impacted, to listen, to go and sit at the table with those communities and those individuals, to continue to engage and invest on them. If throughout history they've been getting the message that they're not worth it, that they can continue to live, in a shanty town, or they can continue to live at the margins of society, then that has to change. Then that's why they need more investment. That's why we need to show them that they're worth it. And until we don't, we need to uplift everyone in this society. If we don't do that, none of us is going to together. And I want to just thank you too for listening, and thank all of you for your hard work. Anna, the other Anna.
This is a new experience having two Annas in one space. I want to thank you, Chairwoman Hopkins, board, for giving us the space and time to be here with you today, for the questions you are asked and for your remarks. If there's one thing I would want to leave you with today, is that this is a job that we all have in front of us, right? The moment that we realize that the job we have in front of us is systems change, and not an individuation of blame, that's the moment that we're all going to be able to work together toward creating this change. There are many things that weren't done correctly. There were many things that were done that were harmful to our community. And the moment that we're able to acknowledge that and honor the harm that's been caused, and focus on how we heal moving forward, which I believe we have done in partnership with the Department of Health Services time and time again, to say this isn't working and this is harmful, and for the department to say, okay, we're going to change it. I think that the moment that in partnership we were able to say no is not an answer that we're going to take, no is just the start of figuring out how we're going to change something that seems impossible. Those have been the key moments that we have been able to make very impactful changes for our communities. And so the moment that we start to realize that no is not an acceptable answer to communities that have been historically marginalized and who are disproportionately impacted by COVID exactly because of that, the moment that we realize and understand that we have to say yes and we have to figure it out. And if that means getting on the ground and doing the work or advocating at the state and federal level, as community members, we are not the enemy of the county, and the county is not the enemy of community. And we have to figure out how we work together, because ultimately community is the county. Right? And so the moment we figure that out, and the moment we are willing to truly work together, we institutionalize changes and we create policy change, regardless of how popular or unpopular we believe that is going to be, how politically advantageous or not that could be. The moment that we actually start to center equity and focus on community, that's the moment that we're truly going to make the difference. And with that, I say thank you again.
Thank you so much, Anna and Anna. And with that, we will go ahead and accept public comment on this item. Looking like there is one person out in the hallway, and so we will go ahead and accept public comment in the chambers to begin with. And I do want to remind all members of the public that I will ask to keep the subject matter limited to this agenda item, which is really about the response to COVID-19, and in particular, the different programs, the efficacy of those programs, the challenges, and opportunities that we have going forward to work on that. Good afternoon, Dwayne. How are you doing today? It's wonderful to see you in person. Here, we'll give you a second.
My name is Dwayne DeWitt. I'm from the disadvantaged community of Roseland Creek. In the 2014 Portrait of Sonoma County, funded and put together by the County of Sonoma, my census district at Roseland Creek was listed as number 99, the most disadvantaged and the most impacted by the negative effects of many things at the time. This presentation that just came forward, the word community was mentioned often. One of the dilemmas, though, especially during this COVID time, has been that folks who are from a disadvantaged area such as ours may not have the resources that all of the employees of various agencies, organizations, bureaucracies, etc., have. Many people in Roseland Creek aren't online. They're not able to do the Zoom that government has become. They're not able to actually participate in the decision making for the healthcare situations that are needed. We recently lost one of the longtime members of our community, an Indigenous man. And it was sad because we had been working together on a project that would involve public health that we call the Roseland Creek Neighborhood. The dilemma with working between the city and the county is there's not a lot of collaboration with the community on what we need for our health. So we would ask you to actually reach out to us community members for what we would like, rather than just for what the agencies, organizations, and paid staff of various groups think is best for the community, as they say. Please come talk to us. As a matter of fact, Chairwoman Hopkins, why don't you set up a meeting over in Roseland Creek as soon as possible? We'll wear masks, we'll socially distance. We know how to do things. Thank you for your time.
Thank you so much, Dwayne. And I will absolutely take you up on that offer and appreciate your words. And I think they very much echo the desires of the Latinx working group to really listen to the community and let the community drive the conversation. So thank you very much for that, Dwayne.
Indigenous, the Native American, the Pomos.
I appreciate that, Dwayne. Thank you and have a great afternoon. So with that, I will hand it. Thank you. Look forward to seeing you next time. And with that, I will hand it over to Marcy to take public comments via Zoom.
Thank you, Chair Hopkins. For our participants in today's meeting who are in Zoom, if you'd like to comment on this item, please raise your hand in the Zoom app or press *9 on your phone keypad to raise your hand. Okay, and the first individual is Thomas, followed by Gregory, and then Dave. You can please unmute and state your full name before beginning your comment.
Hi, this is Thomas, and do forgive me for being away so long. I guess I dropped in at just the right time. I hope that this is in keeping with the comments as Chair Hopkins was mentioning about the what I heard was about the Office of Equity. And when I looked at the evacuation areas, zones throughout the county, the largest evacuation zone was for Roseland, and by demographics and population. And it has the least effective evacuation routes. And I would dearly appreciate either the office or the individuals who would be working on those types of equity to look into that, because there are some improvements that are going to occur, but those improvements will not really benefit Roseland. There'd be improvements, but they actually don't benefit Roseland. They benefit the east side of the freeway, south of Highway 12. And what I'm talking about is Hearn Avenue. And so it would be very important to have those reviewed as to the benefit for evacuation of Roseland. It's very important. And obviously COVID hit, I think, people of color way more, very much harder than the rest of the community. And I think all the responses need to be tailored to that. And I do appreciate being able to have a chance to talk. Thank you.
Okay, our next commenter, please unmute and state your name.
Thank you, Chair Hopkins and members of the board. My name is Gregory Farron. I want to thank Dos Annas for their colleagues for bringing their passion and their commitment and hard work to the task of trying to bring community to the county. My wife and I and lots of other people have been doing it for a lot longer and have had successes periodically, but I have to admit that the current environment in which there is both great need and great resources might make this moment the time in which the city and the county both decide that they really have to get serious about partnering with the community. One of the most important, I think, and having been at the fiscal end of a whole lot of nonprofits and helped them partner with the county and the city, one of the most important and effective policy changes for infrastructure, as was mentioned, has to do with advancing contract funds to nonprofits. Just simply for those who don't understand, most contracts with the county and the city require the community agency to raise money and spend it and then get reimbursed sometimes 2 or 3 months later. You didn't used to do that. There was times when you had great need and some resources in the AIDS programs that were developed in the 80s and in the first 5 that I helped start in the 2000s, in which money was advanced, in which the 12th month was given upfront. And then we worked off that until we got to the end of the 11th month, and then we were out of money. That allowed agencies without any money to get started to do the things that the county wanted them to do. That policy alone helped a lot of nonprofits partner, and you've got to reinstate that if you're ever going to help nonprofits really partner with you. Thank you.
Here, next commenter, please unmute and state your name.
Dave Ransom from Santa Rosa. I'd like to thank Las Dos Anas for their informed, truthful, hard-hitting, and emotional report. I think that is a tremendous addition to the discussions that are going on now. I had the opportunity a few weeks ago to sit with a community listening session in El Verano in the Springs. Folks are probably not aware that that area has the 3rd largest collection population of Latinos in the county. And a woman there with her 2 kids explained that her concerns were first that she wasn't getting enough information about the COVID situation, and started asking what to me were very basic questions, showing that the outreach had not reached her, and then that discussed that how they had paid all of their savings out for rent during the COVID pandemic after losing their jobs, taken one shot of help from Fish, and now we're putting everything aside, quote unquote, for the next crisis. And I think that is the situation that many families are finding themselves in. Just one word about equity. Let's look at it as a class problem, not simply a race problem. The statistics show that half or more of the poor in the county are Anglo. And when we lump them together with the rest of the white population, we make a big mistake. They're the ones who are actual allies of the Latinos and others.
And thank you so much for your comment. Our next commenter can please unmute and state your name.
Hello, my name is Suzanne Dershowitz. I'm commenting on behalf of Legal Aid of Sonoma County. Thank you to the board and thank you to the Latinx Health Work Group for this report. I want to highlight one key barrier that was discussed today in implementing the Emergency Rental Assistance Program. The presentation identified many in the community were unaware of the program as a barrier. Legal Aid has also found that many in the community are unaware of the program. Most tenants our homelessness prevention attorney has spoken with in the last 4 months had never heard of the program. We're calling on the Board of Supervisors to improve outreach and public education on the Emergency Rental Assistance Program as the CBOs work to distribute the remaining $46 million. Strategies like going door to door at the neighborhood level or sending out a brochure in English and Spanish to every renter in the county are best practices the county should prioritize as soon as possible. The county needs to do more to get the word out, especially now that the program covers 100% of back rent, prospective rent, and utilities for eligible tenants. Tenants are now eligible for that 100%, even if their landlords do not participate in the program, and tenants are now eligible for assistance even if they moved out. These changes should go a long way to getting assistance in the hands of impacted tenants, but only if they know the program exists and how to apply. In the next phase of the emergency rental assistance program, the county should prioritize public education and outreach, especially to the undocumented community. The report also notes in the survey section that some clients were turned off by fears or miscommunication about what the process required, e.g. an email address, proof of a lease, engagement with the landlord, etc., and did not proceed with the process even though workarounds were available. This is especially troubling. Improved public education and outreach strategies should provide accurate information about the flexibility of program requirements to ensure that all eligible tenants are able to access the assistance they need. Thank you.
And Chair Hopkins, with that, that will conclude public comment.
Thank you very much. And thank you to all of our panelists for sharing their perspective and the information today, and for all the members of the public for participating as well. With that, we will be adjourning into closed session, and we'll be coming back for the ARPA funding discussion in the afternoon. Do we have a time for the estimated length of closed session, Council Pittman?
An hour and a half.
An hour and a half. So we can anticipate hopefully coming back around 2. Thank you.
Thank you. Sorry about that. If I can ask to please have the slide taken down, we're going to do public comment. So we'll need to unmute. Thank you.
Thank you. And I want to start out by giving a huge gold star to Supervisor Gorin, who was the one person who caught that we did not accept public comment on the closed session agenda. So at this point in time, we will be accepting comment on the closed session calendar today, looking to see if there are any members of the public who wish to speak in person. Seeing none, I would ask Marcy to go ahead and accept comments on our closed session calendar, which includes item 12 and 13 today.
Thank you, Chair Hopkins. For anyone in the Zoom meeting, please raise your hand to make a comment on either of the closed session calendar items. There are no hands for comment.
Thank you very much, Marcy. So with that, we will now adjourn into closed session to consider items 12 and 13. Thanks all.
And good afternoon. We are ready to resume the meeting, so we'll begin to take down the slides and get our sound set up. Thanks, everyone. Thank you, everyone. Just 1 minute. Not a minute, it won't be a full minute. Okay, wonderful. We should be ready for you to take over, Chair Hopkins.
Thank you so much, Marcy. So I'm going to first hand it over to Council Pittman on a report out.
Thank you, Chair Hopkins. This afternoon, the Board of Supervisors met in closed session to discuss the matters listed as items 12 and 13 on today's agenda. On item 12, the Board of Supervisors met in closed session with legal counsel to discuss anticipated litigation, the significant exposure to litigation in one case. No reportable action was taken. Direction was given to council and staff. On item 13, the Board of Supervisors met in closed session with legal counsel regarding proceedings before the California Public Utilities Commission, anticipated litigation pursuant, for one matter. No reportable action was taken. Direction was given to legal counsel. And that concludes the report out from today's closed session.
Thank you very much, Council Pittman. So with that, we are going to be moving on to item 11, and thank you everyone for your patience regarding our ARPA or American Rescue Plan Act funding. I am joined today by EDB Director Sheba Pearson-Whitley, by CAO Deputy County Administrator Peter Bruland, and by our Office of Equity Director Alegria de la Cruz. Welcome, and I'm looking forward to the presentation. And I also see Oscar Chavez joining us as well. Apologies, you were not on the list.
Thank you, Chair Hopkins and members of the board. I am here to kick off today's presentation. Just as a quick reminder, at budget hearings, we laid out a draft plan for how the county will allocate its funding under the American Rescue Plan Act, or ARPA. And in that, we laid out 3 pillars. One of those pillars is funding towards the community, and the board requested that we return earlier than we'd initially planned with additional information on how that pillar would work. So the primary purpose of today's presentation is to provide you with additional information on how that pillar will be distributed under the board's guidance. What I do want to quickly start out with is a quick overview and reminder of what the American Rescue Plan Act is. It's been perhaps a little more than a month since we last talked to you about this, but in that time in my world, we have gone through the end of the previous fiscal year, close of books, started out a new fiscal year, and I've had a vacation. So in all of that time, it seems like much longer to me, and I at least needed a refresher. The American Rescue Plan Act provides $96 million for Sonoma County. These costs must be obligated by 12/31/2024 and expensed by 12/31/2026. So for example, if there's a contract that you are entered into by 2024, there is some additional time to get all of that funding out. But essentially 2024 end of the year is the date we're looking at to be bringing things towards a close. Under the Act, funding is available for supporting public health response, addressing negative economic impacts from COVID, replace public sector revenue loss due to COVID under some fairly strict guidelines from Treasury, premium pay for essential workers, as well as water, sewer, and broadband infrastructure. Under the county's plan for distribution, we are looking at 3 broad areas. The first is funding for the direct COVID response to ensure that we can continue to respond to this. Now, Back at budget hearings, when we were scheduling for today, we were hoping that what health would be coming forward with would be more of an after action report. And as we're seeing, it's really a point in time report on the middle of the action. And to use them a historical example, we can all hope that this is more Battle of the Bulge than Tet Offensive in our war on COVID, but we are not maybe quite where we wanted to be. So it's good that at budget hearings, the board did allocate about $20 million towards ongoing COVID response. In additionally, the second pillar of our approach is funding for strategic investments in county departmental services. Under this, we have requested departments to prepare proposals for potential items that could be funded under ARPA to help the improve county operations in the community. We are looking at one-time projects. We're not looking at sort of pilot programs or other things that would require ongoing funding beyond the ARPA window, but are looking for places where we can put that money to use. And those will be due later in August, and we'll review and we'll talk a little more about the timeline in a minute. And finally, today's focus is on the third pillar, which is funding going directly to the community through community organizations or businesses. Also, wanted to just give you a quick update on a reminder of some of the decisions to date. As I noted, funding for COVID-19 response was allocated during budget hearings. In addition, 2 term limited positions added to the upstream investment to support the ARPA program, particularly the community portion of the ARPA program, and those are funded by ARPA. And the total funding allocated was about 20 million of that 96 million initially discussed. Lastly, before I turn this over to the main point of today's presentation, I did want to quickly look at the upcoming timeline. So today we are discussing having this board discussion on ARPA implementation to get more feedback on the community component. On September 14th, we will be returning to give the board a preliminary view, an initial view of the preliminary department proposals. And at that point, the board will not be allocating funding, but what we will ask is that you look at those proposals, you prioritize which ones you would like to see further developed and move forward, and departments will work on doing that. On November 2nd, we will return again on the community funding proposals. And at that point, we will be presenting on looking at what are the primary areas or buckets in which to utilize that funding, and really evaluating where exactly the needs are and how where ARPA might be directed towards those needs. But again, we will not be asking the board to make final funding decisions at that point. Finally, on December 14th is when we get to the actual final funding decisions for both community and departmental proposals. So that is the date that the final funding decisions will be made. Now, for departmental proposals, that will result in sort of a direct approval of a specific proposal, whereas for the community element, that will really be assigning funding into some of these buckets and giving direction to staff on how to move forward on getting that money out to the community to address those identified needs. And with that, I will turn it over to Oscar Chavez of Upstream Investments, who will talk a little bit more about their process and strategies.
Great, thank you, Peter, and good afternoon, Chair Hopkins and members of the board. Oscar Chavez, Assistant Director with the Sonoma County Department of Human Services. As mentioned, I am here along with Alegria de la Cruz, Director of the Office of Equity, and Shiva Person Whitley, Director of the Economic Development Board, to seek guidance and direction from your board on the process for the distribution of funds to the community. One of the key words that we heard from this morning's presentation was the need to institutionalize equity, of embedding it within existing practices to support long-term social change. And to achieve that aim, we want to leverage and build on existing practices to support the community funding process. To manage and support the community grants, we will utilize the contracting principles that your board adopted in 2019 with the goal of ensuring that policy priorities are addressed in a coordinated and strategic manner, and to ensure that resources and services are distributed equitably and fairly across regions. We also propose to utilize the results-based accountability framework to support the planning, reporting, and monitoring of ARPA-funded community grants, informed by community need, equity metrics, and in identifying solutions with an eye to root causes to disrupt and shift racially disproportionate outcomes in our community. As noted on the timeline, for the past 2 years, our upstream investment staff has been providing training and technical assistance to county departments and community-based organizations on the use of RBA and in developing performance measures for contracts issued by county safety net departments. Using RBA supports ARPA funds to support the ARPA funds provides a consistent and already adopted process to track and monitor contract performance for the ARPA lifecycle and will inform future funding decisions. And this year, with the assistance and leadership of the Office of Equity, we will center equity in the county's RBA process with their assistance and the assistance of their consultant, Equity and Results. Next slide, please. In a moment, Sheba will share the results of their recent Small Business Stabilization Grant Fund and EDB's equity-focused design in supporting small businesses hardest hit by the pandemic and to inform our engagement process. And Alegria will discuss our approach for community engagement and the role that the ARPA Equity Work Group will have in identifying community need, funding priorities, and accountability metrics, which will come back to your board in November. And to support the administration and monitoring of the ARPA funds, HSD and upstream staff will work with the EDB, the Office of Equity, and the ARPA Equity Work Group to draft the Notice of Funding Availability, as well as manage the application process and funding recommendations. Technical assistance will also be provided to community-based organizations and businesses seeking to apply for funds, and we will have a special targeted focus on small and grassroots organizations who historically have not applied for county funds. Once funding decisions are made by your board, we will meet with the funded organizations to establish performance measures and training on quarterly reporting requirements. And as part of the RBA process, we will meet with the funded organizations to review and monitor the performance of their contracts and offer technical assistance as needed to ensure that we are meeting performance goals. Quarterly performance data will be published through a public-facing scorecard to inform your board and the public on the progress and performance of contracts funded through RBA. At the conclusion of the 3-year grant cycle, we will conduct an evaluation of the community grants program to document how these investments supported an equitable recovery for those hardest hit by the pandemic. I'll now turn it over to Sheba.
Thank you so much. So Board of Supervisors, Chair Hopkins, thank you so much. My name is Sheba Person-Whitley, Executive Director of the Economic Development Board. Next slide, please. We've heard repeatedly that, from our other presenters this morning on other items, and as well as from the community, that there really is a desire to add an equity lens to the way we make funding decisions, as well as utilize data to inform the way those funding allocations and decisions are made. So for your board today, we did think it would be helpful to provide more of a case study as to what EDB has been able to do historically and how we were able to add an equity lens to the work that we were doing around the Small Business Stabilization Grant Fund. Of course, this was CARES Act funding, but it was really, the intent of it was to support our small businesses, micro enterprise and entrepreneurs, to provide a safety net for them, especially the ones that were not well positioned to take advantage of other funding sources which were made available. We've heard a lot about barriers, whether they be access related to language, geographic barriers, as well as just technical challenges around some of the other programs, residency requirements, some of those barriers as well. And what we were trying to do was utilize the data that was made available to us through study that we had with Dr. Eiler, as well as add an equity lens to the work. And so we really were intentional about prioritizing low to moderate income. So really looking at socioeconomic, as well as being very intentional about supporting our Black, Indigenous, and people of color, because we know that the data has shown us historically, they really have struggled with access to capital and other barriers to entry. And so we did have $2.3 million made available in CARES funding. We received over 1,300 applications. We were able to award 542 grants. Of course, you can see here the data, the results from that work, really adding that equity lens, focusing again on socioeconomic and people of color. We had 81% low to moderate income, 58% female, 48% overall people of color, and 24% Latinx. And so this is just, again, meant to be a case study of how we're able to get different results if we change the approach to the work. So next slide, please. So how did we do this in terms of our tiny little department? A lot of it was partnering. It was recognizing that we had some limitations and that we could not get there on our own. So we partnered with a local CDFI called Working Solutions to help us out. We also established technical assistance centers throughout the county. We understood from our feedback, from surveys, and from just anecdotal work as well, that there were challenges around technical, whether or not it was things like the digital divide, people having access to the adequate technology, understanding how to fill out the application, making it really easy and accessible for them. Language access has been repeatedly brought up for several years. And so from our department's perspective, we had an opportunity to really lean in on language access. We've heard about barriers because of geography and people being located out in other more rural parts of the county and the community and really struggling. So we had 5 technical assistance centers set up. We worked with the Russian River Chamber, Corazon Hillsburg, Latinx Hub, La Luz, and the Hispanic Chamber. So they partnered with us. We did everything, of course, in a safe way, masking, appointment, physical distancing, but they let us use the equipment, actually have our program managers go out on site, make sure people could access the application, walk through the program, help them with scanning and submitting the documents. Also, we did a virtual service center through the Napa Sonoma Small Business Development Center. So I do think that this is a great example, just from our department, of how we were able to be very intentional about the engagement and outreach, thinking about language access, thinking about geography, other barriers, including the digital divide, and trying to mitigate for those on the front end, on our end. So next slide, please. That brings us to work around data. I know that your board has really wanted to be very intentional about utilizing data to drive the decisions and to be very strategic about where those allocations are made. So last summer, you will recall, our department, EDB, we worked with Dr. Rob Eiler, Sonoma State University, and in August of 2020, he did a comprehensive economic impact study, really looking at the impacts of COVID-19. What are we seeing in terms of housing? How do the disparities break down in terms of demographics? What are the sales tax revenues and different things like that? How does that look? What occupations have been impacted the most? What industries have been impacted the most? And so we have found that was very, very useful data and information. As a result of that, we given Dr. Eiler a brand new scope of work to update the study that he did for us August of 2020. That report will be ready at the end of August 2021. I would be remiss if I didn't mention that I know that this has been a long haul for the business community and the broader community, and that the impacts are still being felt and have not fully been realized. However, if we can utilize information that is available to us, I do think that will be beneficial to your board to take into consideration and just have one more piece of data available to you as you make those funding decisions later on this year. So with that, I will turn it over to my colleague, Alegria de la Cruz. Thank you.
Thank you so much, Director Person Whitley. Good afternoon, Madam Chair, members of the board. I'm Alegria de la Cruz, Director of the Office of Equity, and I'm here to speak to the Office of Equity's role in ensuring that the promise of this powerful piece of legislation and the resources that it makes available to serve the hardest hit community members is made real. The language in ARPA recognizes that while the pandemic has impacted every human being in our country and our county, there has been a much harder hit borne by people of color, people who are Black, Indigenous, Latinx, Pacific Islander, and Asian American, and that this is because of generational, structural, and institutional racism. This team, and I include Director Rivera in this team, is excited about the opportunity that ARPA creates to achieve equity in our long-term recovery efforts, as well as how we can best solidify a culturally responsive and flexible disaster response network in preparation for future disasters. We recognize that achieving ARPA's goals requires a strong, connected, multi-departmental approach. We heard this from the community during the COVID response. We must design for and serve the whole person. And sometimes our bureaucratic silos can hurt the folks whose bodies or lives don't fall neatly within those lines. The language and focus in ARPA allows us to accelerate the equity work of the county to address the more intense impacts of this pandemic, as well as other disasters, both concurrent and past, on people of color, as well as to develop and imagine outcomes and to implement strategies and services that focus on those communities of color and their well-being in our day-to-day. Next slide. We've heard from the community, and we know from our research to other jurisdictions leading on equity, how important it is to have a shared definition of the actual word. So I want us here to really get grounded in our county's working definition of equity. And this is something that we've borrowed from excellent thinkers nationally, and credit goes to Miss Yannick Redwood for this idea that achieving equity requires 2 steps. Our county's focus is on race equity because we recognize that the single biggest indicator as to how healthy, wealthy, or well someone is in our country and is in our community is still race. So Black, Latino, Indigenous, Pacific Islander, and Asian American people continue to experience disproportionately negative outcomes as compared to white people. And so this definition recognizes that the root causes of those outcomes are grounded in past policies, and it recognizes that a path to different outcomes lies in a new process. Next slide. Our proposal here, therefore, provides a process solution, and we offer an opportunity to accelerate our county's equity work that is described in your Race Equity and Social Justice Strategic Planning pillar, and that we were intending to get to later next year. But ARPA creates an opportunity to bring that work to the forefront now, and to create an external equity work group made up of the people who are living and experiencing these structural and institutional inequities. And as a result, those people are the ones who can best help us to flip those switches, make those tweaks, and elevate those great ideas and the wisdom that comes from those lives. We have such good people working throughout the entire county, and we all know how tired we are in dealing with disaster after disaster. So we're proud of our good work with lots of good reasons, and there are so many things that are happening right now in our county that will allow us to more deeply understand our best areas of focus for creating new outcomes for the people most disproportionately impacted. So Sheba mentioned EDB's excellent work in collecting new data with Dr. Eiler. Oscar and I are deeply engaged with the Portrait of Sonoma. We've had many, many county staff engaged with the MAP 1 effort through the United Way of the Wine Country. And Gura is another great example of a collaborative planning process, as well as the Sonoma Connects process. All of these things are happening at the same time. And so we have a real opportunity to align those efforts with an eye towards a just and equitable recovery with the support of ARPA funds. This group that we're proposing builds on the lessons and the best practices from the Latinx Health Work Group and draws really important connections from the deeper understanding of the disproportionality of the pandemic from the health department into the ways in which we will need to direct our efforts and this funding to those members of our community who have shouldered a heavier burden and experienced greater losses during this time. This team understands that it's a moment for us to really practice a yes and approach. This is not a zero-sum game. There are not either or choices here, but a real opportunity for us to continue our excellent work and to also target and focus our efforts, as we heard today, with love and with loving concern on those communities that have been most impacted. You've heard from staff and from members of the community who served in that important and unique effort what kinds of changes were made as a result of bringing those folks into the middle of our emergency response and the design of services. And we've learned a ton that we will bring to bear with this new group. There are a couple of things that we want to raise at the outset, is both the importance of proposing a formal application process to ensure that we really understand representation and positionality of all the members of this work group. That process includes a short application and some letters of recommendations from CBOs or community members. We also recognize how important it is for us and for your board to be clear on the role of this group. So we propose that the group develop community priorities and accountability metrics, and that it really be responsible for also engaging with community-based organizations and us to ensure access to these funds in a way that's equitable. This group will also be critical to the implementation of the Equity Plus RBA approach that the excellent team at Upstream Investments and the Human Services Department working with us will bring to ensure that we achieve the racial equity principles embedded in the ARPA as well as in our strategic plan. Next slide. We need some additional capacity in order to do this excellent work. So we are proposing minimum staffing needs, don't worry, but budget one-time shopping here. 2 analysts in the Office of Equity, one really focused on data to help us gather all of these different efforts and align these different efforts to help us set priorities for what it would look like to equitably fund these different community organizations and the different priorities, as well as to really assist in the development and monitoring of those performance measures to ensure that we're really getting to the folks that we know have been disproportionately impacted. The other position that we are requesting in this board item is somebody who is deeply engaged in community engagement. You've heard earlier this morning how important it is to acknowledge the heavy lift, the huge amount of work that it takes to do meaningful community engagement. And so this ask here ensures that we have the capacity to support our partners, our county departments as a whole, to really engage community members and CBOs in this funding process, and maybe in others as well. And to ensure that we're really gathering and we're intensely listening, and that we're also showing the folks that we're engaging with what it is that we're doing with the information that we're gathering from them and that we're hearing. And this will help us to be clear on how efficient and how important our work is to really focus on the deep needs in these communities that have been most disproportionately impacted. And with that, I'm going to turn it back over to Peter. Thank you.
Peter, you're muted.
So all I was saying there very quickly was a quick thanks to Oscar, who can point out my foibles on Zoom continuing to this day, as well as to Alegría de la Cruz and to Shiva Person Lee for their excellent work on this. This slide just lays out once again what we're looking at today in terms of asking the board to provide any additional input on this process and to bless a process for moving us towards these later decision points. We are looking for approval of those 2.0 term limited positions in the Office of Equity. And then, as you can see, once again, just a reminder that we'll be coming forward again on September 14th with departmental proposals, on November 2nd to define community funding areas, and on December 14th for final funding distribution. And with that, I will return to the board, and we are happy to answer any questions.
Thank you very much for the excellent presentation. I'll bring it back to my colleagues for any questions on this presentation. Supervisor Gorin.
Well, the question that I have right off the top is, I appreciate the articulation of the additional staff people that you need to try to provide outreach and do some data analysis, and probably your needs were this all along. And we're looking at ARPA as a potential funding source. But you've heard me explain, yes, you and Alegria, you and I have talked about the need for community engagement across the board at the county. So is it your anticipation that community engagement in this new position would be focused just on ARPA, or are you taking on the task of working with the communications team at the county to figure out a better way of engaging the community across the subject matter spectrum?
That's a great question, Supervisor. Thank you for that. We've been in quite a few conversations with our colleagues at the Department of Health Services about the kind of idea to figure out how to, as they are doing right now with the expansion of the Health Equity Committee, to also have the Office of Equity support a larger county-wide equity work group. So there is the possibility that this group that's initially focused on ARPA is able to expand its focus. ARPA does require a time-limited nature in terms of the work, and so we can see these two positions be probably fully engaged in that deep effort with ARPA, both the creation of the community engagement efforts as well as the tracking and assistance to the upstream investment team throughout the course of this funding. So I would welcome direction from your board with regards to how best you see these positions moving from a focus on ARPA to a larger focus at some point. But we do really see these two positions as being largely focused on this effort for the time that we're asking them for.
Well, I appreciate that perspective. I'm not sure that I necessarily see that we need a full-time community engagement specialist just for ARPA when the need is so great to have community engagement across the board. So I would love to have the CAO ponder how we actually create authentic community engagement, perhaps starting with this, but very quickly expanding that to other arenas. Because we've had the challenge of lack of authentic communication, community engagement across the board, probably for the last year or two, and we desperately need that in addition to ARPA. ARPA may be convenient for funding, but my goal is larger than that.
Thank you, Supervisor. I would just add that the goal of creating a community engagement plan and best practices is contained in the strategic plan pillars as one of the goals that the Office of Equity and the Communications Department and the CAO will be working towards. And I'm imagining that there's lots of good things that we can pull out of both the Latinx Health Work Group and hopefully this ARPA Equity Work Group that would inform those processes in the future, as well as to continue to support the development of those best practices across the county as a whole.
Thank you. And I see our CAO writing down some notes, so I think my message was clear.
Any response, CAO Bratton, or are we good?
Thank you for the question. I think on the front end of this process, that community engagement position's going to be fully engaged in ARPA, but perhaps after the grants go out, there may be some capacity in that position to help with some of the broader issues and help us develop our objective under the strategic plan. So, I'm happy to work with the Office of Equity in using that position fully, but I do think ARPA is going to take use all of that position's time for probably the first, 6 months, I would imagine, if not longer.
And I guess I would say somewhat facetiously, so to all of the community members who said, you've never informed me about cannabis outreach or any other things, that I would say, just wait 6 months. We'll have a plan in place. I'll let you ponder that. I don't expect a response.
Thank you, Supervisor Gorin and CAO Bratton. Other questions? Supervisor Gore, do you have anything remotely?
Less questions and more comments about the direction. I like what I'm seeing. It's reflective. So after public comment, maybe some more. Thank you.
Wonderful. I did have a couple of questions. One is regarding RBA, which I think is a fantastic concept and program and really important. But one of my questions would be, will this be challenging with respect to compliance for upstart NGOs and nonprofits? Do we have kind of adequate resources currently if we have newer nonprofits, who haven't been kind of part of the upstream program, who want to apply for funds? Would we be able to provide the technical assistance to ensure that they weren't being hindered, right, by essentially being new? Because I do know that we have a lot of wonderful grassroots efforts that have really started up or have expanded during the pandemic, and I wouldn't want them to be at a disadvantage.
Excellent question, Chair Hopkins. And separate from the ARPA funding, we do have the upstream investments team that is currently providing training and technical assistance. So we envision investing and in supporting additional opportunities to support these smaller grassroots organization. Additionally, if those organizations or if a small organization with limited capacity applied for funding and received funding, we would be meeting with them to develop the performance measure and to get additional information about any limitations they might have related to data collection. And we would be in a position to support them with the larger TA that's provided through the Upstream Investments Initiative.
If I might, Supervisor or Chair Hopkins, I think an additional best practice that really came out of the Cura planning process was a recognition that collaborative planning efforts really allow for specific areas of expertise and focus from smaller community-based organizations to be included in a larger response. And that has been something that Cura has really worked on and continued to include in its future planning efforts or in its recommendations around how best to ensure disaster response in a culturally responsive way.
Thank you very much for that. Next question is regarding sort of the committee process. And I'm really excited about this, and I wholly support leading with race and ethnicity as sort of the biggest single determinant, factor with respect to the outcomes that we're seeing. However, I do also want to recognize that there are intersectionalities and sort of wondering if, as we look at the development of that committee, if we're also going to be looking at LGBTQIA, sort of representation as well as geographic representation on that committee, recognizing that, again, those are some additional factors that can create barriers for folks.
Absolutely. Our proposal here on the ARPA equity work group should have been clearer on its desire to have geographic representation. That was also one of the intents in the Latinx Health Work Group, recognizing the diversity in different communities throughout our county as a whole and how different some of the needs are depending on where somebody lives, how they live, where they live, how they get around. And Chair Hopkins, you raised an important point about intersectionality, and we're hoping that our application process will really unlock some of that that ability for us to understand the way people walk through the world and what their lived experiences may be to bring to bear to those solutions that they can help us identify with regards to how to focus our recovery efforts.
Thank you very much. Because I think it's really important to acknowledge that the needs of a socioeconomically disadvantaged rural community are often very different from the needs of a socioeconomically disadvantaged urban community. And that, I think that it'll be really wonderful to try to ensure that geographic diversity in addition to racial, ethnic, and gender diversity. So thank you for that. Any other questions? Supervisor Corsi.
Thanks. None of you will be surprised to hear that all of us are already hearing from individuals and groups who want to know how to access ARPA resources. Which one of you should we refer these questions to?
None of us stand alone in this work. I think that's one of the things that we want to make sure is comes across very clearly is how important this is, that this is a multi-departmental team effort. I would say on the community funding side that our intent is to be able to develop a NOFA with the work group, and that is the NOFA being the Notice of Funding Availability, which will hopefully translate bureaucratic speak into, these are the big buckets that you can apply for funding from the county for with ARPA funds. That will be coming towards the beginning of next year. Oscar, if I'm not speaking out of turn, is that correct? And I can't speak to the departmental as well as Peter can, but hoping.
Just, sorry to interrupt, I'll agree, but right now, is there a single place that people can go to get information, ask questions? And if not, when do you think that'll be up? Because as I said, people already want to know, and right now it's a little bit nebulous.
If I may jump in, I have asked my team, Paul, Gullickson, Peter, and Crystal, to get a website up specifically for this topic. So we are working on a website that would help funnel information and help answer questions. So I don't know, Peter probably doesn't have a time estimate on when that will be up, but we're hoping to get it up soon.
Thanks, and that'll be a good start.
Any other questions before we move to public comment on this one? Seeing none, I am looking out in the hallway to see if we have any members of the public out in the hall waiting. Nope, thank you so much. So there are none in person here, and I would ask Marcy to go ahead and lead us in the public comment via Zoom.
Absolutely, thank you. This is for item number 11 on today's agenda. Please raise your hand in the Zoom app or press *9 on your phone keypad should you want to comment on this one item. We have some commenters here in queue, and so I will get ready. And thank you for the slide. Our commenters are first Jana, followed by Thomas, then Dave. Please unmute and state your full name before beginning your comment.
Hi there, Jana Blunt, President, SEIU 10-1 Sonoma County Chapter. As has been mentioned, ARPA's legislation clearly outlines the disproportionate impact on essential workers, American labor, and communities of color during this pandemic. And so this legislation is designed to address these disproportionate impacts. As we develop the criteria for departmental ARPA funding applications, it's our collective job to ensure an equitable recovery for our most impacted communities. And this may actually include some of our own workers. For example, last week I surveyed 161 bilingual county employees. 26% are performing regular translation services without receiving bilingual pay. 78% had to translate documents, signs, and press releases for public consumption during COVID. 61% were expected to continue to perform their usual amount of normal work, no decrease in their regular responsibilities. And 1 out of 5 have had to translate during unpaid time like breaks, lunch, or even after their shifts. What might this say about how we value disproportionately impacted communities, the people that those people are actually serving? In spite of being some of our most valuable workers, bilingual staff are often unable to perform their regular job as well as somebody who's not tasked with bilingual work. So not only are we not putting our money where our mouth is and showing that we value these crucial workers and the communities they serve, but this is impacting their ability to promote. Rather than multilingualism being viewed as a benefit or an asset brought to the county, this additional talent is inadvertently being used against them. So thanks for listening. You'll be receiving an intro email from me today that includes my raw survey data and our initial ideas on how to ensure we ensure this equitable recovery. Thanks for your feedback.
Thank you so much for your comment. Our next commenter, please unmute and state your name.
Hi, can you hear me?
Yes, we can.
Oops, my volume is messed up here. This is Thomas, and I wasn't clear exactly the focus of ARPA, but I just wanted to reiterate about the situation in Roseland. Of course, the planning for the Hearn overcrossing was done many, many years before the annexation of Roseland. And Supervisor Corsi may recall that it had, the design is rather inferior. I'll just make it really quick. It takes the 2 existing lanes and removes them and builds 4 more lanes. So you only have a total of 4 lanes. You've added 2 lanes, and it's costing $50 or $70 million, something like that. I think 70 million is part of the cost. There's some other reimbursement costs. It's a huge cost. That all needs to be coordinated with the county through the transportation plans, through the general plan, and through these evacuations, which it was and would be in conformance to 40 years ago when Roseland was not part of the city. And I would just encourage you to ask and seek to get a redesign of that, which could keep the 2 existing lanes, add 4 lanes, which you're going to add 4 lanes anyway. Then you would have 6 lanes, and you would have an effective crossing for the people to evacuate from Roseland as they would need to. So you could get north and south as opposed to just south out of Roseland. And that's my only comment. And I do appreciate all the work that's being done for people of color and the problems that we've had with regard to equity, and appreciate all the work that's being done. Thank you.
Please unmute and state your name.
Dave Ransom. I'm one of the ones I suspect who's knocked on Chris Corsi's door asking about how the money is going to be spent and when it's going to be available. In the Sonoma Valley Housing Group, we are connected with the both the Anglo and Latino communities in the Sonoma Valley, and many people have spent their savings for keeping up with the landlord, taken a little help from Fish, which I suspect was ERAP money, and they're on edge. It's going to be very important that the ARPA money becomes available soon and clearly. We need better community outreach than we have had up till now. I would really appreciate either sending out a brochure through the mail to every renter household, or even better, a knock on the door from a regularly existing set of folks that keep in contact with the community. And as well, we need to be able to reach folks who didn't dare not pay their rent and are at the end of their rope. We're already seeing that that landlords are getting payment for months missed, and then evicting tenants. And particularly in the valley, we fear an eviction, a wave of evictions. So this is not something to put off until next year. It's something to address now, please.
Apologies. Thank you. Our next commenters are Demetra, Jack, then Kirsten. Please unmute and state your name.
Good afternoon. My name is Demetra Smith. By now, everyone should have a working knowledge of structural racism and a sense of responsibility to address it. Black residents in Sonoma County have been systematically denied generational wealth, economic, educational, and political advancement through vehicles like redlining, racialized real estate steering, denial of mortgage and business loans, implicit and explicit bias and unemployment, subpar education in the school to prison pipeline, and so forth. In addition, we're disproportionately represented within the unsheltered community due to failures by multiple systems and over 20 years of a racist and biased housing voucher program. We were uncounted in the Portrait of Sonoma and have struggled to access data on our community as we were not even considered. We're finally beginning to see a fuller picture emerge, and it's shameful. All of this has been exacerbated by COVID-19 in a period where we've been bombarded by near daily incidents of abuse, torture, and death of our people nationwide and locally. We've joined a historic regional Black Health and Housing Advisory Task Force with Black organizations from 9 Bay Area counties. This is the moment long overdue to walk the talk of equity and allocate funding to Black communities to recover, rebuild, and begin to undo the harm of generations of policies created by design to deny us opportunities that all Americans. The Black Forum has submitted a proposal for ARPA funding, which will focus on health, housing, and youth. The Bay Area Regional Health and Equities Initiative has lobbied state and local government to create a funding pool for these efforts. Unfortunately, multiple emails from Barhi to the board have gone unanswered. Honesty is a prerequisite for justice. Please, I urge the board to engage with Barhi. We must invest in Black futures. If not now, when? If not us, who? Structural racism won't go away until we address it. The time is now. Thank you.
Hi, please unmute and state your name.
Yeah, good afternoon. My name is Jack Buckhorn. I'm the Executive Director of the North Bay Labor Council. And good afternoon, Chair Hopkins, supervisors, and county staff. We're here to support the idea of a community equity work group to help develop criteria requirements related to community grants associated with the ARPA funding. We think that relationship with the community is essential. While programs are vital to support disadvantaged communities and the need to be funded, we believe that policy change must also be considered as a funding priority. In this morning's presentation, I noted one of the bullet points from Cura, which said equity-driven policy change is necessary to achieve sustainable systematic transformation. And I wholeheartedly agree with that. We've all heard the old proverb that if you give a person a fish, you feed them for a day, but if you teach them to fish, you feed them for a lifetime. We believe that policy change that the county can take using their procurement power can lead to real important changes that lift low-wage, low-income workers up out of poverty. And some of the areas that the county could consider is an update and expansion of the living wage ordinance. They could require contractors to provide sick leave. They could pass an accelerated minimum wage ordinance. They could also pass a ban the box ordinance. All these important policy changes would lift people up out of poverty. So I would ask that you use a portion of the ARPA funding to affect these important policy changes and advance low-income communities. Thank you for your time this afternoon and the important work you're doing in considering these ARPA funds.
Please unmute and state your name.
Good afternoon. This is Kirsten Lange. Following up on the Bay Area Regional Health and Equities Initiative, this is a pivotal opportunity and critical for Sonoma County to pull up to the table with our partners across the Bay Area and utilize the larger resources that have been provided and allocated to support the growth, improvement, and betterment of quality of life for Black community members and residents. This ask and this proposal that has been submitted definitely needs your attention and an opportunity to leverage the support of you all to allow this organization and its partners to take and work in parallel and in partnership with the initiatives that have been presented earlier today. We recognize that the county is stretched thin, that resources come far and few in between. There are a number of asks that are all very important, but this is an opportunity that can work and function for itself. And all it requires is your time, attention, and response to carry out the call to action and support of Black community members and residents. For the long term, for the long run, the time is now. It's necessary and it's pertinent that you all truly look at the Black lived experience in this county and in this community. We may be a small and mighty group, but we are here and we deserve to have the support, especially if we work to garner those partnerships and bring them to us to work in partnership with the parties established and presented before you. Thank you for your time.
Our next commenter, please unmute and state your name.
Greetings. My name is Gregory Farron. In answer to Chris's question, when I get asked, how do I find out about this bill? I've always tried to turn everybody into congressional wonks, but this one's actually the easiest. It's HR 1319. If you go to any Google or anyone else and put in HR 1319, you'll probably end up on a website that has hopefully the text of this bill. It's actually the easiest way to find out what's coming down the pike, because it not only includes the $350 billion coming to states and cities, but all the other 1.8 billion or trillion coming to everywhere else. So treat yourself to a congressional learning session by looking at the most significant bill that has been passed in a long time. It actually will, I think, make you a little more optimistic about America. So HR 1319, that's the bill. Thanks.
Thank you. Chair Hopkins, that concludes public comment.
Thank you very much. And I will bring it back to my colleagues for any remarks that they'd like to make on this item or thoughts on how best to move forward. Supervisor Gorin.
Well, I appreciate the timeline, and I also appreciate Supervisor Corsi's question about where our community gets information. And it really would be helpful for our communications director and team to have a press release that we could then post in and share on Facebook to start with the community engagement. And I'm specifically looking for how the community accesses the information, the timeline, the calendar, and the way the board is considering moving forward. And right now it's as clear as mud, but I know the needs are so great among our business partners, among our community members, as Dave Ransom talked about, with the accumulation of debt and the fear of being evicted from homes. And I worry that the timeline that was suggested may come too late for a number of those uses because the need is right now. So I guess my question is, can we alter the timeline a bit to provide funding sooner rather than later?
Through the chair, certainly that's the board's prerogative. However, we did design this process intentionally to not make any allocation decisions until it was all in front of you. That was an interest expressed by individual board members as we designed this. So that's one issue. The second, the timeline really would be hard pressed to move it forward, largely because of board meeting, impaction already, so this was the soonest that we were able to kind of bring it back to you based on the process that we've identified. So those are my comments.
Any follow-up from that, Supervisor Gorin?
No, I appreciate the complexity of the board's work plan and all that we have in front of us. And I guess I would ask Oscar and Alegria and Sheba for their thoughts. How do we spread the word effectively? How do we start that community engagement to really understand the needs and quantify them and prioritize them, so that we can get that information back quickly? I know the next date, I believe, is August, and then there's a date in September. So I'm looking for your thoughts on how we jumpstart the community outreach process and to get that information back so that we can prioritize it.
Or through the chair, I can start and turn it over to Alegria. One of the strategies that we had proposed is sometime in August to actually conduct some community engagement meetings in each of the supervisorial districts. So part of that process could be to further develop the timeline or give information about the timeline and the process and communicate that broadly so that we can get as much community input to inform and to get feedback from the community. But that's something that we have planned to do to help gather additional data points and information from our community.
Thank you, Oscar. I appreciate that. And it goes without saying that work through the supervisors' offices to schedule, date, help us get the word out and be specific about the intent and what you would like to receive coming back, because the needs of the business community is somewhat different than the social service needs of the community.
Will do.
Supervisor Gore, I see you leaning in.
I don't know where you see me leaning in from, if I'm in front of you or behind you. I appreciate it though. Thank you. So a couple things. One is I think the most immediate thing was from the prior item, which was the rental assistance. And that I see some nodding heads there, but personally, I don't think we closed the loop on that, even though we're not talking about that item now. I heard Supervisor Corsi talk about, the mail, maybe, if we're sending out tax payments for property taxes through Rozier and others. I mean, on one side, I would just say, I'm good with the timeline that's set for this money to go out. I want it to have lasting impact and deep impact, especially in the areas of equity in terms of demonstrable results. So I think I'd love to hear from the rest of the board as well, but I personally would love to see Office of Communications, Paul Gullickson, and maybe Tina Rivera work with us in our offices to really push it through our partners and do other things on that previous item, the rental assistance. I think we have to make sure that people sign up. The numbers look good, but they don't look great. And I think we all have communities of interest that we want to make sure take advantage of that. So with respect to this item, I want to talk about a lot of the stuff that I like first and foremost, because we talked about this during budget. And I appreciate the structure. I love seeing EDB with Sheba, equity with Alegria, and upstream with Oscar in partnership on this. This is, it wasn't to, I think the goal when the board discussed this, it wasn't to create a competition. It was to create some unity and some focus on these. We already have the positions allocated for upstream that we allocated during budget. I'm good with the request for, not only good, I'm supportive of the request on the equity side. We've always talked about putting an equity lens on our work. And so doing it through ARPA and having the staff to do it, I think is extremely important. I'm going to throw a couple things out. I mean, obviously what I heard that I really support is Economic Development Board focused on BIPOC businesses. There's been a lot of great work with the Latino outreach and the work of Marco Suarez and the partnership with the Hispanic Chamber. But, there's been a lot of discussions. Also, I think Demetra talked about a couple of the groups I've met on 2 or 3 occasions with Alegria and with a group of 5 or 6 different groups that represent African-American business owners and voices. And I'd love to see partnerships, long-term partnerships pushed through those. I do think that the linkage to procurement, one of the speakers, I think it was Jack, brought up, is going to be a very important one. And so I want to encourage upstream, which is a big focus on procurement and everybody else, is to try and think about ARPA, but also something else that we supported in the budget hearings, which was a discussion to fund a procurement study that looks at a lot of our different preferences and what we can prioritize our county contracting money towards long term. If we do this right, we have ARPA investments. Then we don't just look at procurement as a county, but as the county of Sonoma, but we look at procurement with our 9 cities, our special districts, the other public entities. There's billions of dollars in contracting out there every year. And we don't need to make everything so expensive so that we can't pay for it, but we have to prioritize local hiring. We have to prioritize diverse contractors and other things of the like. So I really am in my head starting to see it more and more that going into the design process for ARPA and then having that leverage into long-term contracting as opposed to just what few $1,000,000 we have at the end of the fiscal year every year to put towards grants is really a game changer in my mind. So excited to explore those. You know, the biggest thing I would say as well is I'd love to see a focus on some of the work that we're doing. I would definitely lead by saying farm worker, but I would actually widen that out to see what kind of a partnership we can really get into with the federally qualified health clinics, which are the primary healthcare providers for what would be called indigent care in Sonoma County, which is predominantly the uninsured and Medi-Cal recipients. And so we dealt with this during the pandemic quite a bit. You know, we have to make sure that we go where people go already. And so I'd love to see something considered with the core team of Upstream Equity and EDB with the federally qualified health clinics and their partners. You know, we have groups like Corazon up in North and in the Springs, La Luz, and others that partner with those groups already. But I do think that that's there. Also, you know, one thing we've talked a lot about with this kind of exploration is I encourage the core team of Upstream Equity and EDB to look at also workforce. So, you know, there's a group that some of us met with that's called, I think it was called Resiliency Force, out of New Orleans and Louisiana. And, you know, this opportunity that we also have coming in of $50 million in federal funds to match our $25 million in veg management, or $37 million in federal to match our 13. That's a $75 million nut that's going heavily into our community in terms of home hardening, vegetation management, fire adaptation, and preparedness. And we have to think about how we leverage into those dollars. Personally, you know, I'd love to see, and I know I've heard other members of the board talk about seeing expansion of the Sonoma County Youth Ecology Corps, or some of our partner groups, CTE Foundation, Lime Foundation, that have been able to really get young people and people of diverse backgrounds into workforce, and how we fund those kinds of jobs of the future, that veg management work, that land management work that can scale into, you know, the work of our future, which I think is climate change adaptation and mitigation. So I know that's a lot, but I just want to say that I support the process. And I'd love to make sure that we look at the linkages to procurement, the linkages to workforce, and the linkages specifically to health through the federally qualified health clinics. I think that's three kind of key areas. When I look back at whatever our ARPA investment is, I'm encapsulating in my head that we had a different allocation of money, which is the PG&E settlement dollars. And a lot of the PG&E settlement dollars went to make sure that we are not, well, that we're better prepared and more resilient for that kind of a disaster. In those kinds of disasters, I feel that ARPA came out of the pandemic, and we got to make sure that by the next time we have a pandemic or this thing resurfaces in our face, is that we're better prepared and we execute a lot of the work that was left kind of gaping and unaccounted for in our community. So I'm going to be looking at it with a keen eye towards those equity investments. And I have not just big money, but I think also as one final thing is I would encourage the folks in the Upstream EDB and equity is to figure out a way that you get together. And if you need the board to support you, let us know, but with other funders, philanthropic, and otherwise. With this kinds of process, we should be meeting with the groups like Tipping Point that invested in us heavily in the past. We should be meeting with the Sonoma County Community Foundation, maybe even North Bay Angels, with EDB. So as much as we're talking about spending the money, I'm sorry, it was something I forgot and I wanted to bring it back up, is I would love for you guys to let us know if you need help. But but see if there's ways that we can partner in funding and leveraged funding as well. Thank you.
Thank you, Supervisor Gore. Other comments, my colleagues? Supervisor Rabbit?
Thank you very much for the work. I would be interested to know, to the extent possible, not because I'm not sure of the timing, what the 9 cities are doing with their dollars so that we can take advantage of any leveraging opportunities that exist there. I know that Petaluma had a preliminary discussion about, I think they received about 8 million or thereabouts, but it would be nice to see if we can't work with our cities, especially as was mentioned earlier, that the needs are different in the different geographic areas of the county, and the cities will take some of that into consideration for sure. I do think that data analysis is something that we've always needed, so I do appreciate the opportunity to have some more folks working on that. It is, we throw numbers at things thinking that we're solving a problem, but we haven't really necessarily truly refined the definition of the problem, nor if the dollars are appropriate to really make a difference in the big picture. So the more that we can do on that, the better. And I know that's not usually in our bailiwick. That's more of a state federal thing because we're usually the people carrying out the programs. But in this particular case, where we have a significant amount of money to deliver to the public, I think we need to make sure that we are being as thoughtful and deliberate and making sure that it's impactful. I do appreciate the upstream aspect of that. I think that's a great way to go. So look forward to the ongoing discussions, refining those needs, really kind of making, I think as we all know, of the 3 COVID bills, this is it for the most part. And we need to make sure that we do hit the things that are most important for this county to surge forward in the next 2, 3, 4, 5 years. Thank you.
Thank you, Supervisor Abbott. Supervisor Corsi?
Thank you. And thank you, Gregory, for HR 1319. Just don't want to dismiss the value of knowing our civics, but what I was asking was really for information for people who are trying to apply for this money at the local level. So glad to hear there's a website on the way, and we'll all help in our district offices, I'm sure, to spread the word in every way that we can. Looking through this report, I was struck by one line, and that is the intent to strategically disrupt common funding investment practices. Now that's a little bit bureaucratic, but it's also music to my ears. I would like us to use this money in the community like we haven't done before. And what I hear you all talking about is exactly that. Having low barriers to applying for this money. Having technical assistance available for people who don't know how to respond to an RFP, or maybe even put together an application. Making sure that we hear new voices in the process of asking for and receiving funding from the county. I want to see small businesses and even individuals applying for this money with ideas that we may never, ever think about without their voices involved. So Supervisor Gore had a list of ideas and probable requests that are coming our way, and I can't argue with any of those. I want to see all of those. We're going to see everything from requests for help from groups representing farm workers to groups representing hospitals that bring in tens and hundreds of millions of dollars of revenue a year. And that's great. Let's look at it all. But, just up front, I want everybody to understand that, in my view, this is not about providing resources back to those who lost the most, but whose losses hurt the most. And that's, a whole different level of funding. Let's help people who need this the most. So I'd also just encourage you to look at and encourage applications, maybe provide some of that technical assistance to help small businesses, small organizations, new efforts and enterprises create capacity beyond the 2 or 3 years that this money might last. As Supervisor Rabbit suggested, let's take a look at what cities are doing with their ARPA money. They're on a different timeline than us. We're probably not going to be able to coordinate with them. That doesn't seem to be in the cards here, but we can certainly piggyback and maybe learn something from their experiences as they go through this. I'm very much in favor of the timeline here and the process of getting all our ducks in a row, understanding what all the needs are from top to bottom, and then making decisions. I understand Supervisor Gorin's concern about, a lot of money is needed in the community right now. And I hope that, we can tap into that $45 million of emergency rental assistance and get as much of that out there as possible. There's a lot of new ways to do that. Let's work with that creatively. I think that's all I got. Also, just as far as getting people into this system, into the process, as I said, website is good. Website is a good start, but let's not have any door closed to this. I'll be, taking phone calls from people and getting them in touch with somebody to understand what the process is going to be. So the sooner we can get all that figured out, the better. People are waiting. People are not waiting. They're ready right now. Thanks to all of you for your work.
Thank you very much to all of my colleagues for their remarks, and I really support the ideas and the intent, and in particular what Supervisor Corsi had to say, about those who hurt the most, those who sort of are feeling the pain the most, being really critical to address. I tend to think about this in terms of investments in infrastructure, but defining infrastructure very differently than we have defined infrastructure for, I think, forever. We tend to think about infrastructure only as physical infrastructure, as buildings that have been battered, whether it's by fire or flood or earthquake or just the wheels of time churning. And yet, I think we also need to acknowledge that our social infrastructure has been tapped and has been degraded and has been challenged by the repeat disasters that we have experienced here in Sonoma County. And that we right now have an unprecedented opportunity to really make an investment in that social infrastructure to shore up those communities that have always struggled, but are struggling even more as a result of COVID-19, but also our fires and our floods and everything that we've been through together as a community. So I would really encourage us to think in terms of social infrastructure. And if there are ways in which social and environmental infrastructure can both benefit, that is all the better, because we also, I think, sometimes think about kind of human created infrastructure, not acknowledging that we also have spaces like parks and the environment that can often provide tremendous benefits to our community when humans interact with them. And honestly, some of our most under-resourced communities tend to lack in those areas as well. So I hope that we can think broadly about this investment in infrastructure and really think about the long-term stability of our community, which is that we need a good foundation. And a good foundation is going to help those who need the most help in our community to be stable. So I really look forward to this conversation. I think one of the things that I am most excited about is the community engagement. And I think it's critical that we get staff on board to focus on that work, to lift it up, to try to hear from folks, to meet people on their terms, not on ours, and to really hear their needs. Whether it is a small $5,000 grant that could really catalyze something critical in a community, maybe that leases a small meeting space for a small community for a couple of years to do community organizing and health education. I mean, you can often do a lot with not a whole lot of funding. And so I hope that we think about, yes, those big picture investments, but also those small investments that can take care of folks block by block, community by community, neighbors helping neighbors and us supporting that work to be done. So thank you all for your work on this. Really, really appreciate the efforts. And I appreciate, especially I've had some conversations with different, department heads and with folks who are involved in this effort. Creativity is critical. And so bring the creativity, bring the community engagement, bring the new ideas, bring the break from tradition. And that's what I'm looking forward to. So thank you all so much. Any final comments from my colleagues? Not seeing any. Supervisor Gorin.
Well, I have a question regarding our comments. Some are more specific than others. Are you going to try to put our comments and our suggestions within a framework and then bring it back? Or how are you going to receive the ideas that the board has provided as well as the community?
I'm happy to jump in there and a little bit of the silent space. Supervisor Gorin, I think the goal here is to include you as community members in this engagement process and to make sure that everything's in the hopper. We're not starting from zero. There have been a lot of really important ideas that have been raised here and that have also been raised in the community. And the goal is to really align those things into one place so that we can get to prioritization in a way that is reflective of your direction, the community needs, and ARPA eligibility. So this whole process will be to align, what we've heard today and what we're planning on hearing from the community as we move through both setting the priorities and then creating some metrics and some funding areas.
Any other thoughts from my colleagues? And with that, thank you Supervisor Gore.
I just wanted to see if Cheryl or Paul or somebody could respond on the issue that we've talked about with rental assistance, or Chair Hopkins, if you got any thoughts kind of around that one up. I know everybody expressed an interest in going after that as a short-term need.
Supervisor Gore, I'm happy to weigh in on that. I really appreciate the ideas that were brought up today. Some of these we have already explored. I've already been listening to your discussion. I've already done some research on how we might want to do anything from direct mailers to, in addition to the work that's already started on setting up a website or a web page. We're looking at some things we can do to be more direct in our outreach and our marketing about the ERAP program in particular. And so I will be working with Tina and her team about brainstorming on these ideas and getting them going. We have the benefit of already having done some of this with COVID already, so we can piggyback on the things we've already learned that have worked, and we hopefully will roll this out quickly.
Good. Well, I would just say, figure out what you need to do that too from us. I mean, existing resources. I've heard the idea come up a couple times in conversations about having an ombudsman or ombudsperson for rental assistance, kind of a one-stop shop for, sending people to the legal aid world where we're trying to provide eviction defense, and then on the other side with directly into the program, what's working, what's not. I know a lot of this is for Tina as well. I don't know if I'm not asking for any response, but just when you guys get together, I mean, I just want to make sure we tie a button on that and let us know what you need from us in our districts. Okay, thank you.
Thank you. Any other follow-up on that? Or Paul, did you cover that pretty well? Is there clear direction and a path forward there?
Yeah, I feel like we have some really good ideas here, and I think we've been encouraged to think big here, and I think we'll take that back and work with that and come back with some ideas, or actually just get rolling on some of the outreach ideas that have already been expressed.
Wonderful. Thank you. Any final comments from my colleagues? Seeing none, I just want to say, I'm just really excited to launch this process, and I look forward to the ongoing conversation and responsiveness and engagement with the community. So looking forward to making sure that we have deliverables from this, right? That actually folks will see a difference to their lives, and that will be accessible to them. Not just kind of some, high up in the clouds, something that they don't really feel like they own, I'm looking forward to partnering with the community so that there's ownership and a shared sense of success when we get across the finish line. So thank you all so much. And actually, we do need a roll call vote on this one because we are actually approving those staff positions. So I would entertain a motion.
Move to approve.
Looking for a second. Scraping the bottom of the barrel here. Someone help me out.
Second.
There we go. Thank you, Supervisor Corsi. And with that, Marcy, would you mind leading us in a roll call vote on this item, please?
Supervisor Gorin,
Aye.
Supervisor Rabbit,
Aye.
Supervisor Corsi,
Yes.
Supervisor Gore,
Yeah.
Chair Hopkins.
Yes. And with that, we will go ahead and be moving on to, let's see, item 14, which was our 2:30 time certain. Thank you all for your patience on this one. It's our fiscal year 21-22 one-year action plan for the use of CDBG home and ESG grant funds. And I will be handing it over to our interim executive director of the CDC, Dave Kiff. Welcome to your first, presentation at a board meeting.
Thank you, Chair Hopkins and board members. I have an opportunity to give you some time back because if you've been following the staff report in this item, this involved a question as to whether or not there is HUD guidance that would limit the expenditure of some of our CDBG funds into cities like Santa Rosa and Petaluma for affordable housing projects, such as PEP Housing's Linda Tunis project. So we did get additional guidance about an hour and a half ago, and it was quite clear in that the provision that was recommended by your two committees, CTAC and CD committees, that suggested that the only funds for affordable housing go to projects in the unincorporated area or the 7 non-entitlement cities, that guidance was appropriate. So therefore, I have a new recommended action for you, and I can go through the PowerPoint if you'd like, but I think you'd probably rather have some time back. The new recommended action is simply to adopt the one-year plan, to direct staff to accept and include further comment through the end of the public comment period, which is August 9th, and then to authorize the staff to submit the plan to HUD by August 16th. And I'm happy to take any questions if you have it.
Thank you very much. And I do see, and I appreciate your brevity and I appreciate the update. Maybe our delay was actually helpful in getting that information across the finish line. And it looks like Supervisor Gorin has a question.
Thank you, Mr. Kiff. I guess I was hoping for a different outcome, a different opinion, of course. This is a project, as I've talked with you before, that has been actually being played as a ping pong ball between the city and the county for almost 4 years. And it is a really important project that we bring over the finish line. Okay, we cannot use this funding, apparently, HUD says. So what's your recommendation? How are we going to be able to work with the city to bring it over the finish line?
Well, I think we have an opportunity to look for other fund sources, as you note, Supervisor. Maybe some of the funds that have been turned back from other projects. I do think your conversation that you just had about ARPA, that there'll be folks who do submit requests for funding for affordable housing project or more funding for the county fund for housing. So I pledged to Mary with PEP Housing that I would work with her to try to find other sources, and I'll certainly keep you posted on that.
Thank you. I do appreciate your outreach to Ms. Stump and PEP Housing. It's been a really challenging journey for them, as we've talked before, but I think not only the county shares in this responsibility, but the city does too, especially in light of this guidance. So if you could outreach with the city about how we collaboratively could help finish this project, it would benefit both constituents and our homeless individuals from the unincorporated county, as well as the city of Santa Rosa. So thank you. And I would, if other housing projects are submitting requests for the ARPA funding, I absolutely think it's appropriate for that source of funds. So thank you.
Other questions? Supervisor Rabbit.
I just want to thank Dave Kiff for his work on this and trying to find a solution. I think initially it came as a bit of shock, only because I think we, I guess, had not, or I don't know if it was the NOFA or whatever we did in the past. It seemed like projects within those jurisdictions were funded. Perhaps it was a different source of funds, but following through and getting the definitive answer that you did, not the one we would like, but at least following it through to the conclusion, I do appreciate, and I'm sure that, you know, in a way, PEP will as well. And I do appreciate your ability or your offer to continue to work to see if there's something that we can find with some other color of money to try to get that project over the top. And for all your leadership, thank you so much. It's great to have you there.
Supervisor Corsi.
Thank you. I just want to note that this project has received money through the continuum of care, different funds. I'm sure that they'll be applying again as more of those funds come in on annual basis. But most of all, for the first time today, I'm glad we're an hour and 45 minutes behind, because we wouldn't have had this answer when we started at if we had started at 2:30. So thank you, Mr. Kiff. And that's all I have.
Thank you, Supervisor Corsi. Supervisor Gore, anything to add?
Nope, supportive.
Great. Thank you. And I just want to say thank you so much for your work on this topic. And thank you also just for your leadership in the interim role at CDC. And not too many folks would stay for a 2.5-hour homelessness meeting out in Guerneville, after 3 weeks on the job, I think. But really, really appreciate your participation and your attention, not only to the affordable housing development side, but also the homeless services side. So with that, we can go ahead and see if there are any members of the public in person who would like to make public comment on this item. Again, this is item 14. Seeing none, I would turn it over to Marcy to see if any members would like to participate virtually.
Thank you, Chair Hopkins. I see a couple of hands, so I'll ask that we have the slide up. I thought we did. Just one moment. Okay, thank you so much. And for our first individual, if you can please unmute and state your name.
Good afternoon, Supervisors. It's Mary Stomp from PEP Housing. I just wanted to thank you for your support of our project. I know that this source of funding is not going to work. It took many, many tries to get HUD to actually come up with a determination on this. But we look forward to, we're ready to start construction, and we're hoping by sometime in September, we can secure just that last bit of funding we need that has been caused by some of the cost increases during the pandemic. But anyway, I wanted to just thank you for your support of our project. And it's really been nice working with your new director. So thank you for your support.
All right, our next commenter, please unmute and state your name.
My name is Gregory Fair, and I want to first of all thank David Kiff for answering the question that has been wrestled with, and I support Mary's project in PEP. But I have another challenge to this use of this money, and I'd like to read it to you if I can get it up. Hang on. This one actually operation of Sam Jones Homeless Shelter. I must question, based on the recent effectiveness of operating other alternatives that the community supports. At a time when you're increasing pressure to use state and federal funding for optimum homeless facilities and services, I believe that an open must occur concerning what best assists homeless now. Santa Rosa's successes with Tent Village at Finley, your success with cabins at Los Quilicos have demonstrated safer and more successful alternatives. The dangers of the virus in congregate environments and community questioning have convinced Santa Rosa City Council to rebid the Sam Jones shelter next spring. The Sonoma County can entry contract to place homeless into permanent support beginning in January. Isn't it time to admit that safe ground, safe parking, and safe rooms are the future of homeless housing. Specifically, the state is funding safe rooms in non-congregate hotels in Rookie and Homekey. Local funding for safe parking is currently being examined and planned. The state legislature just passed a large new safe ground pilot project to encourage and explore sanctioned encampments of 50 or more. Are shelters like Sam Jones still the best practice? And funds into them? The homeless community, in my experience, wants you to fund a variety of transitional and permanent supportive housing. Please re-examine your thinking about what is needed going forward and consider making different decisions. Thank you.
Thank you. And Chair Hopkins, that concludes public comment.
Thank you very much. So we'll bring it back to the board to see if there are any more comments on this one. Looking around and seeing none. Oh, Supervisor Gorin.
Just a thank you to Mr. Kiff. You dived into the deep end of the pool, and we're so glad you did. Thanks so much.
And I would accept any motions on this item.
I move that we accept the recommendation.
Second.
And so, Marcy, I would ask if you wouldn't mind leading us in a roll call vote on this item, please.
Supervisor Gorin.
Aye.
Supervisor Rabbit.
Aye.
Supervisor Corsi.
Yes.
Supervisor Gore.
Yes.
Chair Hopkins.
Yes. Thank you so much. And thank you for the gift of time as well, because that brings us then a little bit more into line with a reasonable meeting end time here. So with that, we will be moving on to item 15, which is our new county government center selection of preferred proposed site location and CEQA initiation. And so it is my pleasure to hand this over to Caroline Judy, our Director of General Services, who has been at this just for what feels like forever. And I'm hoping that you are feeling excitement at potentially getting some firm direction and at least a launching point today.
I am feeling excitement, Supervisor. Thank you very much. And good afternoon, Supervisors. We are pleased to update your board and present information for your consideration regarding a possible new county government center. And I hope you can see the screen here. In January this year, we brought information to your board describing phase 2 of our multi-phase process of planning for new facilities. We provided information on the current staffing, the overall property portfolio size, the average space per person, and the total office, training, multi-use, and specialty purpose spaces that we need to replace. We determined that an overall space program with a need to provide space for 2,443 employees, with 974 of those consolidating from leased properties into new facilities. We described the search for a new site in the Airport Business Park area, in downtown Santa Rosa, and at the existing campus. And we presented site fit and financial models associated with building out the program. We also described how, given 92% of the overall space need was driven by office space, that reducing office space either through remote work or space standards could help reduce the overall cost of the program. We received direction from your board to come back with more information on the downtown sites, to work with the Board of Supervisors ad hoc committee, and to work with the city and other downtown property owners to further consider opportunities in the downtown area. In today's presentation, we will provide an update on the activities undertaken in the last 7 months, provide additional information on the downtown sites considered, present information on our neighborhood services research, and hope to obtain your board's direction on a preliminary site selection, enabling us to start CEQA and move into the next phase of our overall replacement plan. Oops, let's try this. No, it's not going to move nicely. Sorry. There. Since the 1980s, the county's been working to identify how to address the aging county government center buildings. Our buildings are old. They are costing the taxpayer over $10 million a year to continue to operate. Our buildings are not big enough to accommodate all of the services that the county provides, so we have to lease almost 1 million square feet of office space and other specialty purpose spaces. Our specialty purpose buildings, such as the Emergency Operations Center, the morgue, and the public health lab were not designed to the resiliency standards of today that is appropriate to their function as essential service facilities. Our buildings do not reflect current energy codes, accessibility, or seismic standards. Over the past 8 years, the board has commissioned several studies, identified goals and objectives, directed staff to work with departments on programming, and evaluated different approaches to delivering the program from bond financing, build to suit, and public-private partnership. We have hired consultants to assist us in evaluating different site options. The business case for new facilities was described in the 2013 County Real Estate Financial Vision Comprehensive Facilities Plan, and again in the March 2017 Deferred Maintenance Report. We identified the challenges that we are facing, where we have over $660 million worth of deferred maintenance on the entire 2 million square feet within our owned property portfolio, and a backlog of $265 million in deferred maintenance on the county government campus. Your board created a new financial policy that identified funding to address some of these deferred maintenance needs and to help us plan for the future. Much of our property on the county campus is taken up by surface parking, which is not the highest and best use. We launched this process to solve those issues, to improve service delivery, to consolidate leased facilities, and to replace our aging buildings with modern, safe, efficient, and greener facilities. Over the past 7 months, your board's ad hoc committee of Supervisors Corsi and Rabbit and staff met with city officials to discuss downtown site options. We held design and risk workshops. We refined our parking numbers through visitor and client surveys. We pondered the future of parking, where autonomous vehicles will soon upend the current use of parking garages. We conducted an analysis of real estate alternatives for expanded neighborhood services. We met with representatives of the Downtown Business Association. We continued our financial modeling and site assessment analysis, and we evaluated lease termination schedules and conducted further legal analysis. As a result of that work, we updated our program to account for a 30% remote work model with 68% employee parking, which is consistent with the City of Santa Rosa's models for employee parking. We increased the size of our emergency operations center to reflect its potential shared use as a regional center, and we assessed visitors' parking needs at 20% of daily visitors based on survey data, and then accounted for fleet in our parking numbers. In January, we described the base case program when we came to your board. We've made a few adjustments over the past 7 months, as I've indicated. The program includes new facilities for 2,443 employees, assuming 225 square feet per person, with a 50 square foot drop-in space for remote workers, 20% common area, and a small 0.5% growth factor over 30 years. That equates to 590,966 square feet of office space, including our justice partners, specialty purpose spaces of 41,450 square feet, training and multi-use spaces at 19,000 square feet. We identified the total parking need of 2,324 spaces, including our justice partners. A new emergency operations center, a new morgue, and public health lab were included in specialty purpose spaces. While the morgue and the public health lab will likely be pursued separately under a design build contract and located here on our existing campus, the rest of the program could be accommodated in new facilities delivered through the public-private partnership. These square footage and parking assumptions were then test fit into each of the sites under consideration. Based on your board's direction, we considered the existing campus and downtown Santa Rosa sites. We looked at city-owned sites, City Hall, as well as the library and White House site, which we refer to as the tandem site. Just a note about the City Hall site. Although initially it looked very promising to us due to its size, we struggled with the timeline and complexity of the property. Opening up the creek, which has been a long-standing goal of City Council, would have brought significant regulatory complexity to the project, and co-ownership of the site would have also brought complications into the P3 deal structure. The public-private model works best when the property in question is owned by the county and improved by the P3 entity who designs, builds, finances, operates, and maintains the property. We've also looked at the Sears site. Over the past several months, we explored the opportunity to acquire the Sears site. We'll look at each site in a bit more detail over the next several slides, and we'll also describe the site evaluation matrix. The site evaluation rubric and criteria are the work product of input from county department heads, our consultants, and input from your board. The scoring categories, weights, and criteria were previously approved by the Board of Supervisors. Working with the ad hoc, we reviewed all of the evaluation matrix scoring criteria within the 3 categories: service, affordability, and design and other considerations. We discussed the subjectivity of the scoring and the challenges with evaluation matrices such as these. To address some of the concerns, we increased the range of scoring to try to provide greater differentiation between the sites. We added equity and access. We unpacked sustainability and climate resiliency. We re-examined and provided more detail to parking and site size, among other changes. These adjustments changed the scoring slightly from what we had presented in January, but still the county campus scored higher with most advantages and the fewest disadvantages compared to the Sears site or the tandem sites downtown. The detailed narrative description of the scoring is in attachment 3 in your packets. Turning now to the test fits and the conceptual visualizations. The County Government Center site. The entire campus is 82 acres. About half of that total is justice and detention focused, with the Hall of Justice, the main adult detention facilities, the Sheriff's Office, the Sheriff's Evidence Facility, and soon to be the new Behavioral Health Housing Unit. Of the 82-acre total, 27 acres could be used for new facilities or possible mixed-use development, accounting for circulation. This slide illustrates one possible concept where office space is constructed in several new 5 to 7-story office towers across from the new courthouse, a parking garage buffering the freeway, and mixed-use development along the Mendocino corridor. A freestanding board chambers and conference center, transit hub, and childcare facility could all fit within the available land. The orange color on the slide indicates properties that could be potentially sold for mixed-use development, subject to CEQA, the Surplus Act, and to the City of Santa Rosa entitlement processes. With the new buildings as illustrated, approximately 1.5 million square feet of mixed-use housing could be built in the 6-story buildings as shown along the Mendocino corridor and on the La Plaza site, with a potential density of 50 units per acre. The county site provides the flexibility and can easily fit the entire program that we need and meet multiple board objectives for housing, creating a campus microgrid, and improving resiliency. As we described in January, using the available surface parking for development requires construction of a parking garage, which is expensive. This slide illustrates the relative scale of 5-story buildings with an open-air plaza design that could help activate space. These images are purely conceptual examples and are not designs for the site. Moving now to the tandem site, we illustrated how both the library and the White House sites would be needed to accommodate the entire program. As described here, this could be in 240 or 16-story towers and a podium construction with 20,000 square feet of ground floor retail and some limited parking on site. The library could potentially be accommodated in a new separate structure on the site. Next slide illustrates the 2.8 acres. The limited size of the library and the White House sites creates a challenge for parking. It would be possible to construct a new 2,324 space parking garage on site, but this would require some underground parking and the use of a significant portion of the 2 lots. Therefore, additional parking would be needed from the City of Santa Rosa in addition to other parking solutions such as perhaps shuttle busing employees. Next slide. This slide provides some visual examples of the relative scale of heights of a building that would be necessary given the size constraints of the tandem site. The Sears Auto Center property is 7.4 acres, which provides sufficient space for the entire program. In this conceptual site layout, office space could be accommodated in 2 office towers, one 18 stories and one 4 stories, in addition to podium office space. The board chambers could be constructed adjacent to the creek with surrounding green space. The site offers existing on-site parking with 779 spaces and 550 leased parking spaces. The city has offered 500 additional parking spaces in downtown garages. The Sears site is very close to the downtown SMART station and next to the transit mall. This convenient proximity enables greater transit ridership than what we currently experience at our existing campus. However, with the full program, we have a parking gap of 495 spaces, but this could be addressed with further program modification or increased remote work or increased transit ridership. The Sears site offers, in addition, the potential to open up 3rd Street to on-grade pedestrian and bicycle access, and creating an outdoor plaza between new government facilities and the existing mall retail space. These images illustrate the plaza food court potential concepts for the adjacency between the buildings. Working with the ad hoc, we evaluated the cost drivers for each site that contribute to the annual availability payment, either one-time costs or ongoing costs that might be outside the availability payment. For the existing campus, we would need to demolish the administrative buildings and construct a parking garage. In addition, we would have to swing out county departments, either entirely or in phases, both which contribute to one-time costs during the 2.5 years of construction. The existing campus is the least expensive of the 3 site options. For the Sears site, we have a high-rise premium that's associated with the towers and the site characteristics, and we have delay costs that are associated with the acquisition and CEQA processes. The acquisition itself creates a one-time cost, and then there are ongoing costs associated with leasing the parking from the Santa Rosa Mall and from the city of Santa Rosa. The Sears site is the second most expensive site. The key factors driving the tandem site are the high-rise premium, the demolition costs of taking down the existing library building, and the delay associated with acquisition processes and CEQA. As I mentioned before, acquisition is a one-time cost, but then there are ongoing costs associated with leasing parking. This simplified chart illustrates the cost drivers for each site. However, cost is not the only factor to consider. There are opportunities and challenges associated with each of the sites. There are climate benefits, jobs, housing, balance benefits, service and operational efficiencies, and others. We have tried to summarize just a few of these in this chart. The existing county center can achieve the board's objective of consolidating all of the leased properties. It is the lowest cost and it provides the most flexibility in designing the program. Because of the proximity to the court, some services are more easily accessible for clients if they are located on the campus. Splitting off the justice partners from the rest of the county administration offices creates inefficiencies. Although surface parking is free now, a parking structure is expensive to build and the site is not within easy walking distance from SMART. The Sears site provides an opportunity for placemaking. It can accommodate the full program, yet it has insufficient parking. It creates a split campus and service inefficiencies, especially for clients who, as I mentioned, need court services and health and human services, and it is expensive. The tandem site provides an opportunity for revitalization in downtown Santa Rosa. It has a low acquisition cost, but it has insufficient parking, creates a split campus and service insufficiencies, and is the most expensive. The site selection is a policy issue for your Board of Supervisors. Cost, while important, is not the only factor in which to make the decision of location. Locating facilities near transit has the potential to reduce our overall greenhouse gas emissions from employee commute and visitor trips and our operational expenses. Building new facilities downtown can help spur housing development, both downtown and on our campus. While we don't currently have an urban transit system countywide, our transit model isn't static. Your board works with SCTA to improve transportation and transit and continually advocates for funding to improve public transit in the county. There are economic benefits for any location where you have 2,400 employees. Furthermore, if housing is developed on or near the existing county site or on the downtown area, there's the opportunity for future employees to live near enough to walk to work. The amount of housing that could be developed on the campus will be examined in the CEQA process and ultimately be determined by the City of Santa Rosa through their entitlement and land use planning permitting processes. We have heard some community concerns expressed about the amount of housing potential on the county campus, and we want to reassure neighbors and others that no decisions have been made regarding housing or development, and that there will be significant opportunities for public input as we start the CEQA analysis in the next phase. Over the 50-year life cycle of facilities, we can also anticipate that how we access government services is going to change, which brings us to our neighborhood-based service delivery, which is attachment 5 in your packets. In January, your board directed us to study ways of improving remote or neighborhood service delivery. Establishing neighborhood-based service centers was an objective that was originally identified in 2014 in the county's real estate master plan. At the time, the Sonoma, Cloverdale, and Guerneville Veterans Buildings were identified as possible sites for neighborhood services. However, since 2014, the board has approved a number of neighborhood-based services provided in leased facilities. The South County is served at 5350 Old Redwood Highway in Petaluma, offices where Human Services provides adult and aging, economic assistance, employment and training, family, youth and children's services with staff permanently assigned on site. The Department of Health Services and Probation offers services from the leased property at 16390 Main Street, Guerneville. Safety net services are also provided in partnership with community-based organizations throughout the county. We've surveyed departments to find out what opportunities they saw for satellite services, what design and information technology features they would need, and what models work best for their functions. There are many different models that can be deployed to improve access to services. Mobile services such as Bookmobile, app-based services such as online permitting, kiosks in small office spaces with a navigator to facilitate access to online services for those without computer or internet access. The local assistance center model of pop-up or rotating service delivery, similar to the services that we have provided during COVID, floods, and fires, or the tiny house village model, where services are provided meeting people where they are, rather than assuming that people will come to county offices. Establishing brick and mortar offices can be expensive, on average $24 a square foot, including tenant improvements. For Health and Human Services departments, approximately 55% of non-staff operating expenses, such as leased expenses, are reimbursed by federal sources and about 45% for state funding sources. For example, as I mentioned, DHS has offices in Cloverdale and Sonoma, which have fixed office hours several times a month in Cloverdale, twice a month or so in Sonoma. Petaluma services are offered full-time, and Guerneville is open about half-time. Mobile services are also offered in these areas. This combination of mobile and fixed services can help meet clients' needs. We searched for real estate property listings for commercial and retail shopping areas in West, North, and East County. There is a limited inventory in most of these areas, and our research was described for you in your packet. Your board direction is needed to help us shape the future of neighborhood-based services. Looking at timeline, on the existing county campus, if your board directs us to move forward with the preferred site today, then our next steps are to start drafting our request for qualifications and proposals documents and start CEQA. Then Then we will bring back findings and a short list of possible development partners for board consideration, leading to an occupancy in as early as the fall and winter of 2025-26, potentially into 2027. For Sears, both and the downtown sites, the site acquisition must be completed after CEQA, and therefore there is a delay. Occupancy is approximately a year and a half later. At this point, what I'd like to do is transfer the presentation over to Peter and Christina. They're going to talk a little bit about potential financing plans. Then we'll come back and talk about the recommended action in closing. Go ahead, Peter.
You, Director Judy. So what I wanted to share with you, similar to those artists' drawings you saw a little bit ago, is not a final design or a final plan for a funding structure, but it is an illustration of what a funding structure for this kind of a deal might look like. And first of all, we don't actually know what that final cost will be. Within the board item, there is a range of costs looking at the county center site, at the higher end of which is about $46 million a year net of lease savings of about $8.7 million, which is where we come to this $55 million, because we are not netting out those lease savings to begin with, but rather looking at how those might be applied. A second thing I just want to point out before I talk a little bit about some of the sources that we might use in an eventual plan is that you'll see two dates at the top. Fiscal year 25-26 is listed as a potential for first year of occupancy. And so that would be a year under the P3 model in which we would begin making these annual payments. The second year you see there is 2030-31. And the reason that is there is because some of the potential sources we could use, notably funding that is currently going towards payment of the 2010 pension obligation bonds, drop off of our expenses in 2030-31. And so that gives us our sort of full range of ongoing sources. And within that time, there might be a need to use some one-time sources under this illustration to backfill some of that. So what sources have we been looking at? One is the Deferred Maintenance Fund. A few years ago, your board started putting away money in the form of excess property tax growth above what we needed to balance the budget. There's a policy that 40% of that growth above what we need to balance the budget goes into the Deferred Maintenance Fund. In addition, we have made some other increases in there. Now, these funds go in there on an ongoing basis. So essentially what we have been doing is sequestering ongoing general fund capacity towards these eventual payments. Currently, in fiscal year 21-22, we have $7.9 million budgeted into this. With the latest close of the tax roll, we will be calculating an additional increase on that. We're estimating that to be probably about $1 million, a little less, but we are still looking at what that final number would be. What we do anticipate is that by 2025-26, we would have about $14.5 million available in ongoing capacity from this fund. In addition, we have some savings from debt that will be coming off of the county's books from both in the form of pension obligation bonds as well as in some other debt on facilities that will be coming off the books. And we also have some potential capacity on our other post-employment benefits collection rates that we currently have that goes towards retiree health care. And because of the rate at which we have been putting away, we anticipate that we will have the ability to send less money into paying down that to the tune of about $2.4 million. So this is the category that grows over time. In 25, 26, we're anticipating about 2.4 million available from this. But by the time those pension obligation bonds come off the books, this would grow to about 14.1 million. We are also proposing that one potential source would be to utilize some of the general fund allocation that currently goes towards capital projects each year for this project. So currently we have $3.9 million that goes towards general capital projects, in addition to $1.6 million going towards capital projects under the Americans with Disabilities Act plan that is devoted to capital projects each year. Obviously, building a new county center will be the largest capital project that the county is undertaking for some time. And so we are suggesting that some of that funding, not the ADA portion, but a portion of the other funding might go towards this. We do have some general fund lease savings. The lease savings are mentioned earlier. However, most of the lease savings are not coming out of the general fund, but are associated with the Health and Human Services departments. And so we'll reflect that a little bit below. We also have seen our transient occupancy tax bounce back faster than expected. Some of that is tied up by board policy into percentage allocations, primarily the Measure L funding. So that's not something that we would be anticipating using here. However, we do have other aspects of it that are fixed amounts. And so with extra growth, particularly as some of this was backfilled with general fund, we anticipate that we could create 1 million in additional capacity that we would need to begin taking now, reserving now, that would carry forward to help us in the future. State and federal reimbursements is a bit of a gray area still. We do know that we will be able to get some funding from state and federal reimbursements based on services provided by departments like Human Services Department and Health Department toward this. And the number we're looking at here is really tied very much towards their current lease payments and towards some of the items that come here. This is something that's going to need more exploration in terms of what a fair allocation is and what portion of a fair allocation, should that be greater than the feds and state will reimburse, we can in fact get reimbursed from that. But this gives us a good starting point of what we might be seeing on that. We also will have fee producing departments being housed in the new complex, and the costs of that building is a cost that would be fee recoverable. We're estimating here about 1.42 million. That's probably low in terms of what we could do, but that's being a little conservative based on an assumption that we may not want to pass on that full cost towards the people who are consuming these services. Additional general funds. So all of this gets us much closer to that big number at the bottom, but we do still have a gap that we would need to find additional general fund to the tune of 13.2 million under this illustration. And again, with high degree of uncertainty on some of those, to the extent that we can recover more from state and federal reimbursements, et cetera, this number could go down. But there is still a gap there, and we'll talk a little bit more about that in 1 second on the next slide. And finally, we are looking at some one-time funds. As I mentioned, you see that growth from the 2.4 to the 14.1 on the debt and OPEB payments ending. And so that creates an initial year gap of 11.7 that generally goes down over time. So we would be looking towards various one-time sources to help us bridge this gap until we reach that full 55. Some potential sources do include surplus land sale from the county campus. So even if we are building on the county campus, as Director Judy noted, we would have some surplus land that is no longer needed, and sale of that should provide some one-time funding that could be utilized. We also will have some accumulated deferred maintenance balance. Now, currently, the money goes into the deferred maintenance fund, and a portion of that gets used for two things. One of the largest shares is actually funding all of this work on the county government center project. So we have consultant costs, we have various costs to the departments that do get funded out of the deferred maintenance. We also do fund deferred maintenance projects out of this. However, if we are frugal and do not utilize the full amount that's going in, and remember that amount will be growing each year in terms of what's going in, we do anticipate that there will be some fund balance in this fund by the time 25-26 rolls around that will be able to help cushion the blow as we move into a longer process. In addition, there are various service enhancement fund balances that may in different departments and around the county that we may be able to utilize because we will be moving those services into this new facility and enhancing them. And finally, Shanate land sale should generate some one-time funding by that point, which the board could choose to set aside and for future use on this project. Just very quickly, looking at that $13 million general fund gap that I noted, this is not insignificant. This would be about 3.4% of discretionary general fund budget based on our projections of what that budget will be by fiscal year 25-26. So this is not nothing, and there are trade-offs involved in putting money here. But there are ways we can try to make that a little bit easier. One of which is to look at phasing that in over time. So as I mentioned, we set aside money into the deferred maintenance each year based on capturing unanticipated growth in property taxes. We could begin setting aside and continue setting aside an additional $1.5 million per year on an accumulative basis, which would help us generate a significant portion of this gap. In addition to anticipation that we would continue to grow the share of property tax. Also on the past slide, I anticipated that both that growth of property tax and any other one-time money going into deferred maintenance is frozen, and that set amount is frozen in that 25-26 year that we're beginning. And so if we continue those policies, both increasing that 1.5 million additional and capturing the unanticipated growth, which is of course unanticipated and hard to predict, but we can look at historical trends on that. We do anticipate that by fiscal year 29-30, we could close that $13.2 million gap. And so right around the same time, a little bit before those pension obligation bonds come off the books and we get there, and that we would be able to identify sufficient one-time funding in part based on the additional money we would be squirreling away earlier to meet those one-time needs. However, that is all money that's not going out to departments to provide services to the community directly, but instead is being invested to help us better provide those services from a new location in the future. So an alternative is that the plans could be scaled down. So if we either consolidate fewer FTEs, if we reduce the square footage per FTE, this is based on a 225 square foot per person model, or if we increase our assumption about what share of work is being performed remotely, then there are possibilities for savings. And as Director Judy has mentioned, and I have mentioned, we don't have a plan, we don't have a final thing that's going to come in a next phase when we get more into that RFQ and RFP process. So we're not going to, we could scale down the project. And the third option is to capture more excess property tax growth. So right now we're capturing 40%. We could increase that to 60% or to 100% of growth in excess of what we need to balance the budget. This, as I've mentioned before, is a little harder to project exactly what that does, but I can say on average, we've been increasing by about $1 million per year based on the excess growth, and that's 40%. So increasing that to 100% gets us pretty close to that 2.5 million, that the 1.5 million extra a year plus the $1 million there gets us to, but through a slightly different method that could be bigger in some years and smaller in some years. And again, we would need to adjust as we get towards planning and see what that final looks like. And that brings me to the end of this illustration of how we might be able to reach these funding levels. And so with that, I'm going to stop my share and turn it back to Director Judy to conclude the presentation.
Okay, oops, this moving things around. There we go. So thank you, Peter. I really appreciate that. The positive news is we can get there. So this is really an opportunity for us to see beyond where we are right now, to think out 30 years into the future about the services and the facilities from which we provide those services. It's an opportunity for us to create a revitalized place, whether that is on our current campus or downtown, and at the same time to improve our neighborhood and remote services, to meet people where they are, to improve equitable access and the convenience of our services, and to further green up our operations. We recognize that we are on the cusp, as I mentioned earlier, of autonomous vehicles and further technological improvements. However, as the past has shown us, those innovations are not always equally accessible to all, and therefore we must plan for and consider the needs of our employees and clients as we see them now, as well as out into the future. In January, I thanked our team, and I want to thank them again for their work over the past 7 months. From the General Services Department, Michelle, Keith, Peter, Tony, Tamra, Gloria, Lana, and Simeon have all provided behind-the-scenes support. From the County Administrator's Office, Maggie and Crystal have been invaluable. Chris Sepler from PRMD, Adam Brand from County Council, of course, Cheryl and Bob, the consulting team from PFAL, Victoria and David, and from Nossaman, Corey and Andre, and of course, the board's ad hoc committee, Supervisors Rabbit and Supervisor Corsi. It's really been an honor to work with this talented and professional team, and I thank you, and I look forward to your questions. Your board actions A through E are noted. They're also on your agenda and in your packet, and that concludes our presentation. Be happy to take any questions.
Thank you very much. And I will bring it back to my colleagues for questions. But first, I would ask if the members of the ad hoc who've been working on this would like to offer any remarks or just kick off the questioning. Supervisor Corsi, then Supervisor Rabbit.
I'll just start off the questioning at this point. It's 5 o'clock. Ms. Judy, you have in the recommended actions, the first action talks about, if needed, we will include study under the National Environmental Policy Act, NEPA. I'm wondering what determines if needed? It seems like no matter where we put this new county center, there are possibilities for grants at the federal level, particularly when it comes to transportation access. And it seems wise to be shovel ready. So what determines whether we actually do that study or not?
So we have looked at funding sources from TIFIA, the Transportation Investment Finance Act, as a possible fund source that could assist us, as you mentioned, with transit hub components of the project and other aspects of the project. So along with those federal funds come the requirement to perform NEPA as well as CEQA. And so what we thought here was best to sort of hedge our bets and prepare to do both analyses on whichever site your board selects. And Mr. Pittman, Bob Pittman may want to add additional information as well.
Through the chair, if we were to get a federal funding source that would require us to comply with NEPA, they're getting very strict about having their own documents. So it would be a separate process and a separate document. It could be done if we secure the site. In my experience with NEPA, if we end up doing an environmental impact report for the California Environmental Quality Act, NEPA is likely going to require similar. So we have most of the studies, but they have a different process we have to follow, and we can no longer do joint ones like we did for the airport.
Okay. Just seems like a good idea at this point. Just wanted to check that. on the slide that has the dollar signs on it without numbers, for the Sears site, it lists one of the additional costs as a parking garage. That is not actually a foregone conclusion yet, is it? Don't we still have other options to be looking at meeting our parking needs through existing parking downtown?
Yeah, that icon was intended to represent the fact that we would need to lease parking from existing garages from the city of Santa Rosa. I apologize, a little bit confusing because we used that icon on the county center site to indicate that we would be building a parking garage. So those are really meant to be two different things.
Okay, all garages are not equal.
They're not equal.
And I just have one question for the county administrator's office. Obviously a lot of analysis has gone into this, including financial analysis. Just wondering if you can talk about why there's no detailed financial analysis included with this presentation.
Thank you for that question, Supervisor. If you recall back to the January 5th agenda item, we did have a lot of detailed financial analysis of the different sites. And really, for the last 6 months, the work with the ad hoc has largely been focused on addressing the challenges that we saw with the downtown sites, principally parking, and also details with the city. So for the last 6 months, we've been largely focused on, resolving those issues. But in fact, we did do some financial modeling over the last several months that we did share with the ad hoc members. And the problem we had with those financial modeling exercises are the sites are very different in what you would build. For example, up here on the county campus, we're looking at building a new parking structure. Down at the Sears site, we're looking at leasing parking. And so as we tried to use modeling to compare apples to apples, it became clear that it was next to impossible to really get on apples to apples. So this agenda item focused more on some of the other policy issues and factors that should drive this decision, while recognizing that downtown is more expensive, we believe, because of the high-rise premium, as well as the delays. So I hope I addressed your question.
Yes, thank you. That's all I have.
Supervisor Rabbit?
Well, I do want to thank staff for all the time spent on this item. I know my colleagues know the amount of extraordinary analysis, sometimes paralysis by analysis or analysis by paralysis, whatever it is, with the information. So I do appreciate that very much. And we should be doing that because I think that's the most important thing going forward. And I do, when I was chair, I kept this project going, even though we were kind of keeping it on the down low when we didn't have a lot of money to invest in it. Because if you stop the process of replacing these buildings from 1954, it is so hard to pick it up and to gain the momentum. And so I am very excited about moving forward. I just want to feel comfortable that we're making that financially right decision going forward. And so that's kind of why I think some of the numbers that were added were in response to some questions that I had. And while I think, apples to apples on sites that are drastically different, especially with the parking, is difficult, it's an exercise worth pursuing, because at the end of the day, a 500,000 square building here, 500,000 square feet of building there, you do need to compare it, because you need to know that you can pay for it. And I think, what's interesting here is that we started off really with the program and the site that determined the price, as opposed to how much can we afford that would determine the program and the site. And there's two ways to do it, right? If you're a homeowner, you go get pre-approved and here's my mortgage amount. Now I'm going to go shopping. We didn't do that. And I think I know that, and I appreciate Peter's numbers here. There's a couple things I would make note. while the additional general fund gap is a 3 point whatever percent, isn't everything that's listed on this sheet really general fund dollars? And what percentage overall is that compared to the general fund itself? It's more like 17%. So I think we just need to know that, because that really means we're going to be eating top ramen for 10 or 20 years. I thought it would only be 10, but it's really going to be that first 5 adds, we're not going to reach critical mass until year 29 or whatever, 30, 31. And I just want us to know that what are those things that you're not going to be able to implement out of the general fund, because it will be substantial. And I think we should know that, and we should have that path out there delineated, because I think, to me, that's the most important thing. I think people are not going to necessarily be happy that we have invested, a fifth, a quarter of our general fund into a mortgage payment for 30 years and not into services out of the general fund for all the problems that exist and that we're trying to solve. And that's tough, because that means, so what do we do? Because at the same time, we need to provide a place that is a suitable place for our employees to work. We need to be able to move forward. And really, when I look at, and I see that scaling down the project, how do you scale down the project at the Sears site if it's beyond the tenant improvements of the tower? Do you build the tower half the size, so you're only going to move half the people? Then where do the other people go? And how are you going to work that? Is it worth to move half the people downtown and keep half here? Or is it worth to, quite frankly, this site lends itself more to a phasing approach than downtown. You can build on this site without even building the parking garage initially, have surface parking, because I think the highest and best use, there's 2 terms that come along with that. One is the urban planning use. Yes, highest and best use from the urban perspective is to build, 5-6 story buildings. They've been trying to do that downtown. They can't do that yet. They've been trying to do it in Petaluma. They can't do that yet. I'm not sure if we could just say that's the highest and best use here, and therefore next year that'll be on the site. It may not be. So we may be having to land bank to a point in time, and we could lower the overall cost that way. Because what I really do fear is that the number, the $55 million annual payment, which is really the mortgage for 30 years, is going to be a huge burden. And what can we do financially? And I would prefer that we spent a workshop on a 10 or 30 year plan to show the growth, the anticipated growth, to show what all aspects of what we are trying to achieve, so that we know that impact going forward. Because right now, I do think that it's going to be really severe in the first period of time, beyond even obviously the 5 years where it's building to a max, but beyond that. And then that will lead to the project that we can afford. Because as I sit here today, I want to believe, that this were, but I'm not. I don't think government should go forward with if money were no object, because money is always an object. And while it's a policy decision, the budget is the biggest policy document that we have. And if we're spending a fifth of our a quarter, a fifth, whatever you want to say, into a mortgage payment, does that reflect where we need to be or where we want to go as a county? So it has been a great exercise. I'm just not sure if we scaled it to the appropriate size yet to have it really be financially affordable. Not just maybe financially affordable, but palatable going forward, because we will get grief for whatever we build. I've said that before, but we will get more grief if we're letting go all of the extra things that we have been doing within the community, because I'm not sure where that money will come from. With all that said, staff has been doing a great job. We'll continue to do a great job, and we'll take the lead from the board, I'm sure, going forward. And we do need to figure out our path. But I do think that it has a lot more to do with, unfortunately, even as an architect, it has a lot more to do with the financial sheets than it does with the pretty drawings going forward at this point in time. If the financial sheet if everyone felt like this was going to be no problem, man, let's go out and draw something up and get people in there. But let's start with the financial sheet first.
Supervisor Gorin.
First of all, I want to thank the ad hoc of Supervisors Corsi and Rabbit for their work on this and the incredible staff work, especially you, Peter, for putting some numbers down to show us, oh, this may be affordable. And Supervisor Rabbit talks about a fifth of our income being used for mortgage. Oh, it's the California way to use at least half or more of the income for a mortgage, but that's an aside. We're not necessarily talking about the average residential homeowner, but most fire survivors have no idea where their funding is coming from and what the cost will be. But they're moving forward with the vision, the aspiration of rebuilding lives. And they have faith that the funding will come at some point at the end of the process, or go without. Oh, wait, may not have carpeting that you want there. But so I have a little bit more confidence that whatever direction we choose to go, we will be able to afford it. But I do have some questions regarding the assumptions, and I thank you for being here, Peter. I've asked the CAO for some of those assumptions. So I'm just going to use a hypothetical. If we choose to move to the Sears site, there will be an opportunity cost to the county and the city of some use that could be built there, whether it's an Oliver's or a series of stores. And that will generate property tax and sales tax in that location. And I assume that that will be a very low density kind of use, similar to what the Sears store is. If we stay on this site, obviously it's tax free, doesn't generate revenue. However, if we move to the Sears site, there could be some assumptions about the revenue coming to the county, both in additional property taxes, potentially sales taxes, because I see there is no reason why you can't have some mixed use development, commercial retail on the site, as well as housing. You would want to have that. If you have some kind of housing here, or even the existing services, they would want to go out to restaurants or have some place to go shopping or eat. So I guess the question, the assumption in all of that, has anyone taken a stab at, if we move down to the Sears Center, what would the property tax generation likely be? What, outside of the land cost or the land leasing revenue? And what would the sales tax be generated from this site? And then, of course, you would have to subtract any of the property tax and sales tax from uses at the Sears site to get, hopefully, net revenue increase. Has any of that been built into the financial models?
So if I may, I had talked to Eric Rozier a week or so ago, and I don't know if he was able to put any numbers together. And certainly, I don't know if he was going to net them out. Miss Judy, do you happen to know, or Peter?
So I will say that Mr. Rozier has begun putting those numbers together in terms of what taxes on the county center might look like. We don't have a full analysis at this point in terms of particularly netting out and different locations. A couple of things to keep in mind is that certainly any development on these sites that adds value will add property tax to everyone. Now, what you can generally count on is under Prop 13, 1% of the total assessed value goes to local entities as property tax. And depending on the site, you're probably talking about somewhere in the range of 30, 35% of that going to the county. So it's great, but it is saying if you add $100 million in value, that's $1 million of new tax revenue, of which about 350,000 maybe we'll say goes to the county. So it can come out maybe a little less than one might think on an initial thing, but it's an analysis we haven't really done, and so I can't give you the full figures right now. I know I saw some numbers from auditor controller just today, but again, we haven't netted everything out and digested. And the sales tax certainly brings in another component. Primarily the Bradley Burns, the share of the general sales tax actually goes to the jurisdiction. So that would primarily be Santa Rosa money in these cases, which is, certainly great. They also have need for revenues, and it's great because it's economic activity. It's not necessarily a direct to us. It would flow to all of those transaction and use taxes, for example, parks tax and, open space district, et cetera.
Thanks, Peter, and thank you to the CAO. I appreciate that Mr. Rozier is working through some of the tax assumptions, and we may at some point be searching the couch cushions for change. This is a little bit more than the change you would find in the couch cushions, but it would be helpful nevertheless. So let me ask about the money we are currently expending for Sinead out of the general fund for security and vegetation management, totaling almost $1 million a year. And so I would assume, hope springs eternal, we will sell that site. Caroline Judy's going to do her little happy dance when that actually happens. So have we thought about putting that funding not only from the sale of the site, but potentially the upkeep of the site into a lockbox or an escrow to pay for part of the new county campus?
And you are correct, Supervisor. It is almost $1 million that we're spending on security, fire watch, vegetation management, those goats that everyone loves up at Sinead, continuing our property management activities up there. And yes, those funds would be fully discretionary for your board to reallocate as you so choose.
So that's a possibility. And then another source of funding that it would be important to think about, or savings, actually. You mentioned that we're expending, or probably should be expending, $10 million a year for upkeep of our additional facilities. And have we estimated that the cost savings from the maintenance of moving and building a new county center, wherever it is, and what would those savings be? And put those in the cost projections or savings, actually. And I would hope that we would consider building a state-of-the-art building for energy savings and perhaps energy generation, talking with Sonoma Clean Power, just across the street, potentially from the Sears building, about what we could do to partner in looking for grants to help offset and generate that renewable energy. Yes, I know the building is up and it's only about this big, but wind turbines on the side, or I don't know what we could do. But there definitely would accrue some significant savings in not maintaining the existing buildings. So I don't expect you to quantify that, but just throw that into the hopper. And Peter, if you could put a couple of asterisks on the bottom of this spreadsheet, that would help me. Thank you.
And just through the chair, I do want to remind the board, and we have 2 million square feet of owned facilities. And really what we're talking about here are 470,000 square feet. So we will need to continue to maintain the existing facilities and address the deferred maintenance obligations that we have on those. The majority of the funds that we are spending currently on our existing campus really are going towards issues that we see with the main adult detention facility. Some of the expenses towards, HVAC related issues that we have in buildings such as the one that you're in. But a lot of those expenses are towards detention. Still, there will be savings and we will be able to quantify those going forward.
just one more point. There will be some savings, obviously, and I think we will look very carefully at the kind of jobs and personnel that might be moving downtown for us to build in a rather expensive high rise as we look at locations for regional service centers. And I think in a number of the spreadsheet departments that we've talked about, if they're going to move, stay here, we could probably take some of those employees in each of the departments or a number of the departments and move them to the regional service centers, much less expensive to lease or purchase and build in the outlying areas to potentially house those folks. So thank you again.
Thank you, Supervisor Gorin. Supervisor Gore?
Yeah, thank you, Chair Hopkins. Great discussion. Like the other supervisors, I want to thank Caroline and her staff and CAO Bratton. A lot of work on a lot of difficult issues. I am reminiscent of Supervisor Gorin saying it's Christmas morning all over again. So as much as we have questions for a lot of people who might be listening in, this is maybe the 5th time that we've reviewed kind of this discussion. And I want to thank the ad hoc and others and looking at this. Also the city of Santa Rosa. I know there was a lot of gut work going into the proposals for the downtown and seeing about the fit with the Sears property coming on the table late in the game. That's obviously a game changer for us to look at. And then what I want to start my question with is really to dive a little bit further, Caroline, and see if you can remind us some of the high level numbers for our deferred maintenance. You know, we're sitting here talking about using a lot of general fund going forward, but we're not using a lot of general fund right now to repair these buildings that are falling down. And we're also spending $10 million a year in leasing facilities because we're not putting them into our permit department and we're not building more buildings on our county complex. So can you talk to me from a high level perspective of somebody who's a land manager is where we're currently at with the deferred maintenance? I believe it's 265 million in aggregate costs that would need to be put into this facility that we already have, and then the complexities that exist with that already.
Yes, so you're correct, Supervisor. It's 265 million on the facilities that we're talking about on the County Government Center campus. We have 660 million total across the entire property.
There it is. There it is.
So that's the bigger number. And just to recognize, you know, that's Los Gilicos, NCDF, all our outlying properties, out Tidelands, et cetera, veterans buildings. You know, it's the entire property portfolio that we also need to continue our investment. Our annual capital investment in our facilities has been fixed for over 15 years at $3.6 or $3.8 million. In addition, there's additional funding that comes for ADA accessibility improvements. So that is the funding that we are working with to replace our existing facilities, and you have a helper there, very cute. And so, you know, when you talk about what we're working with on an ongoing basis, those are the numbers that we're dealing with.
Then I need to ask you questions.
So I want to thank you for that. I have more questions and maybe some comments, but I'm going to give it a minute to reset things in here. But I really appreciate that.
All right. Well, I want to also thank staff for all of the work that has gone into this project. A couple of questions. You know, I also just want to honor what Supervisor Rabbit said regarding concerns about the cost. And, you know, I'm curious what the extent of analysis has been as to if we were to shift to a greater remote work percentage than I believe it was 30%. Also, is there a possibility of looking at neighborhood service centers as potential offsets for the need for parking or space in a downtown complex? And some of those might potentially be, you know, more cost effective to build, or there might be new funds available because it's a new service that was not previously available in the community. So you might be eligible for USDA rural development funds or things like that to increase accessibility for a disadvantaged community. So I'm just wondering if there are ways of, potentially looking at cost cutting, or in investments in that kind of scattered site model as supplemental to potentially offset some of the cost of construction?
So yes, there are. I mean, the single biggest factor that your board can look at, and as Peter outlined, is the assumptions that we're making about the square footage per employee and the percentage remote work. Those space allocations are a very significant percentage. It's 20% of they drive 20% of the cost. The office space alone is very significant. So looking at which departments move, what space, how much allocation per workstation, and the percentage remote work, those are the big levers, if you will, that we can work with. I would make one point to your comment about the staff moving out to remote facilities. Most of the staff that we're talking about consolidating are administrative service functions. They are not necessarily providing direct services. Some are, but the majority of them are administrative. And so while we could move some out, I think that's not going to significantly reduce the numbers. But your bigger levers are square foot per person and remote work assumptions.
That would, though, also play into the parking space requirement if you were shifting services out, because I think right now it was assumption that 20% of are needed at any given day.
Yes, that's very true. So you're absolutely right. The visitor survey that we did, where we looked at all of our client departments and looked at the number of visitors that they had on a daily basis, we assumed in the analysis that 20% of those visitors at any given point in time would be looking for a parking space. If more of the direct services that are being provided in the consolidating offices are moved out, then that would help to reduce some of that visitor parking need that we were calculating.
And, I am not an expert in commercial real estate development or office, space, but I'm curious with respect to the figure that we have assigned currently per employee. How does that compare? What is sort of the industry standard or the industry range?
Yes, so the counties, we do not have a space standard currently, and our office spaces have a span a very broad range from 350 square feet per person to some of the offices in the areas where you work. And county administrators board of supervisors offices are very small, with multiple individuals sharing office space of more along the lines of less than 100 square feet. So the federal government has adopted a standard of 170 square feet per person. And some of the modeling that we brought to your board back in January, we did look at that 170 square foot per person model, which has significant potential of bringing us down in terms of our overall costs. There are open office models that other mostly private sector firms are using that where you have touchdown space and a greater percentage of employees working remotely. Those, to my knowledge, have in just a few instances have been deployed in government settings, but we could certainly look for certain applications where that may be really applicable and may work well.
Thank you very much. I'm certainly interested in exploring the federal standard option and also the open office model, because I do think that might be conducive for certain functions, but not others. And I think a couple of us used to work in newsrooms, right? I mean, you didn't have 100 square feet, and we were all lumped together around common desks in many cases. Last sort of question, I want to recognize that the Neighborhood Service Center sort of seems to be in a preliminary phase, and that the searches seem to be fairly narrowly defined. So I would just encourage us to think more broadly about that as we move forward. I know that for some reason in West County, it wound up being centered around Sebastopol. There are certainly other options if you kind of expand your criteria. And so I look forward to that work going on and to seeing if there are cost benefit analysis associated with making those investments in our scattered sites. One other, I guess, question is, when I think about mortgages, right? And like not wanting to leave future boards with just unbearable mortgage payments, right? That really inhibit their ability. And to Supervisor Rabbit's point about, I think he mentioned top ramen, right? The sort of scraping the back to, saving in college, and that was all you ate so that you could afford your meals. I think that that's a really good point. And one way, of course, of looking at that is how can we afford a larger down payment? Are there other one-time funding sources that we have not tapped, that we have not looked at? And, I do want to recognize that we have PG&E settlement funding coming in from Kincaid. And while there are, needs in the community there, we've also had conversations about how does some of that money come back to offset the cost that we experience, right, that came out of the general fund. And so I'm wondering if we have any figures for that as another potential one-time source of funds, or if there are other fund balances that we have not tapped that might be possibilities for trying to give a bigger down payment and have a lower mortgage over time.
I think that's a question for Peter.
Well, and if I may also, we did a lot of modeling in the last year about, what if we pay it down like you would with a down payment. And because of the structure of the deal, it's designed, build, finance, operate, maintain. So you have the operation and then the maintenance, so it's bundled. When you pay down some of it, it doesn't make much of a difference in your annual payment in the modeling. So certainly, if we go down to Sears and we have to buy the Sears building, we need one-time money. That's a different, discussion. But to get the annual payment down, one-time money doesn't do a lot to the modeling. What we've done is modeled one-time money to help us gradually get up to that annual payment amount. So it's more of a gradual increase or a gradual pressure on the budget rather than a one fell swoop. We need to find $13 million a year.
Thank you. Supervisor Abbott, do you have anything to add on that?
Well, I was only going to ask if does the development fee or the interest rate paid go up with a smaller project? Is there a threshold where the third party is still trying to get the same return for a smaller project? Do you know that?
I don't have the answer to that. I would need to look to our consultants to see if they could answer whether there's a sort of a threshold beyond which or below which it's not feasible when you're including the capitalization cost and the debt, private equity debt payments.
Okay, I appreciate that. And just one other note, just to your comment regarding the one-time funds, because what's true is on Peter's financing illustration, the one-time funds 25 to 26, 11.7, correct me if I'm wrong, Peter, that's annually. So you're talking 58 million to get yourself to 30-31, where you're counting on the other growth. It's a big number. So I'm not even sure, I don't know the balance of PG&E, but I'm for you. I would rather put all my money down, have my lower monthly or annual payments. But that's why I'm just so worried about the what it is that the opportunity costs we're giving up.
I appreciate that, Supervisor Abbott. Any further details or information on that, or shall I go ahead and see if Supervisor Gore? I see Peter Brulin unmuting.
So I was just going to say that Supervisor Rabbit is correct. That's an annual until 2030-31 when that fully drops off. Now that decreases over time, so it's not quite that 55 million. And I was trying to pull up if I have my spreadsheet, but I don't have it right in front of me. So it does drop off gradually over time, but there's about 9 million of that doesn't drop off till that last year. So it does remain a significant for several years.
And through the chair, if it's appropriate, I did get a text message from our consultants to address Supervisor Rabbit's question, which says all the project sizes contemplated are sufficiently large enough to attract interest without affecting equity return targets or needing higher returns. So hopefully that answers your question.
Thank you, Caroline. Supervisor Gore, do you have anything else before we shift over to public comment, and then we'll bring it back for deliberation afterwards? Okay, great. So with that, I do believe that we have some folks who would like to make public comment in the chambers today, and we will go ahead and begin with them. So give us just a moment to get our microphone turned back on and everything readied. Welcome, Mayor Rogers. Thanks so much for joining us today.
Absolutely. Good evening, Madam Chair and Supervisors. Thank you so much for having us here. Glad to see you in person. First and foremost, I just really wanted to thank staff. When we first started having this conversation back in January, there were a couple of fundamental questions that remained unanswered. First and foremost was whether or not we would allow parochialism and local jurisdictional infighting to really prevent us from doing a deep analysis to see whether or not we could do something good for our community. And I'll say Director Judy, her team, our team over at the city, they all did an incredible amount of work. And regardless of the decision that's made today by the board, I feel very confident that they did everything that they could to give real numbers and to really try to provide a path forward for the city and for the county to work together. We're very excited by the prospect of having you in our downtown with us. We have been spending a lot of time and energy and focus and money trying to refurbish our downtown, to enliven it, and to make sure that we're attracting a vibrant workforce and housing into our downtown core. Having you down there sets an example as well for our community about the benefits of our downtown, the benefits for our climate, for our economy, of having a work-life balance that will continue to pay dividends to our county for the next 50 years. We're really excited to work with you on transportation, to look at shared EOC, emergency operations centers, if that's a possibility, and to look at shared fleet management and other types of government efficiencies. And it all starts with us co-locating and continuing to work together in this path that we established with the ad hoc. We're happy to answer any questions, and I'll leave it to our staff who've done a lot of the work as well. But we're really excited, and we would encourage the county, be bold, take the big step, come downtown, and let's continue to partner, not just on that, but also on this site for housing. Let's do something good for our community, and let's continue to work well together. Thank you.
Thank you so much, Mayor Rogers. And if you wanted to hold on a moment until we hear from Councilmember Sawyer, and then if there are any questions from members of the board, just since we happen to have, two council members, including the mayor, from the jurisdictional authority into which we would be moving, I think that would be wonderful. So, Councilmember, would you like to go ahead and share your thoughts?
Thank you, Chair Hopkins and Vice Chair Corsley. And everyone here today has worked very, very hard in trying to determine whether or not this is possible. And I have to admit that this is something that I have been hoping for, I realize today. The majority of my life, I've been contemplating the idea of the county coming back downtown. And if I look at the scale of an urban scale of to determine the future of a downtown and the economics and the culture change that could happen with the county coming downtown, I have to believe that the balance of that skews to the benefit. And even though will be a very, very, very challenging and difficult and expensive and incredibly important project,
I urge the board to move in that direction. You have been very, very bold, and I have to say that I so honor Supervisor Rabbit's cautions. They are valid, and I would say that I would probably, in many ways, mirror those if faced with the same conversation. But as a politician at times, I am the consummate optimist, and I do believe that in the future, a decision in moving forward with this project is the right thing, not only for the downtown, but for the city and the county and even the region. So I urge you to move in that direction, and exercise all of the information you have to be able to make that kind of decision. And I thank you for your time.
Thank you so much. And I would just ask my colleagues if they have any questions. Supervisor Corsi?
We'll
Yeah,
get to you, Dwayne, in just a second. I just wanted to thank both of my former colleagues for having the patience to wait until we get to this point of the meeting for public comment. I look forward to the day that you can walk over instead of driving out here to make public comment, and vice versa. I think you have a council meeting tonight, so, okay. No questions, but thank you for being here.
Any other questions? Supervisor Rabbit?
Can you sweeten the parking deal? 3 years out of in perpetuity is not a lot.
I understand, Supervisor. I think that for many of us, when we look at our climate goals, we understand that parking is a necessary evil in the short run. And so in the spirit of looking at 20 years, 30 years down the road and pushing the city to make sure that we get those housing projects built so that your workforce can not just walk to public comment, but to whatever other meetings that they have in the jurisdiction, I think that it's a fair balance.
So I think I heard 20 or 30 years, not 3. So we're good.
Supervisor Gorin?
The art of the deal. I want to thank you both for coming down here. John, my former colleague, absolutely. And I think Supervisor Corsi may have tipped his hand. Anyway, thank you so much. And thank you for all of your work with the ad hoc committee, exploring different ideas. And the negotiation continues. Thank you.
Thank you, Supervisor Gore. And Supervisor Gore, I don't see you on the screen, but do you have any questions for our colleagues from the city of Santa Rosa?
I do not. Thanks for being here.
Thank you so much, Mayor and Councilmember, for attending, and really appreciate your patience and waiting. And thank you very much for your remarks today. Look forward to the conversation and deliberations. Take care. And Mr. DeWitt, thank you so much for your patience. Would invite you up to the podium. Appreciate it.
Dwayne DeWitt from Roseland. Mayor Rogers' comments about the climate goals should be borne in mind by you folks also, who have put together a climate statement and have said that you have certain aspirations, might be the term to use. So as I listened to this, I thought, this is so wrong. This is not what you should be doing. You already own this site here. And as the pandemic has shown, you've been able to function very well with numerous off-site remote workers. And I believe for you to reach your true climate goals, that you should actually increase your percentage of remote workers. You should get 4 scattered sites, north, south, east, west, and not go into downtown Santa Rosa. You should stay where you're at. This problem about deferred maintenance is because you haven't been doing the maintenance. It's basically like saying, well, we didn't take care of something, so now we want something new. And you wouldn't do that with your kids. You wouldn't say, okay, you didn't take care of that, so I'm going to get you something new. And I really believe you need to have hard-headed fiscal oversight in this situation and not go into a mortgage. Listening to Supervisor Rabbit should have been very enlightening to you because, as you know, there'll always be the change orders and the cost overruns and the unexpected contingencies, which will make this far more expensive than you've ever thought should you try to go back to downtown. These buildings are only 60 years old. I watched some of them go up. to me, it's ludicrous that you'd say, oh, we can't fix these. You can, and you can put bigger, newer, nicer buildings out here where you already own the land. Thank you kindly for your time. I'm here for public comment after the end of the meeting.
Thank you very much, Mr. DeWitt. Are there any other members of the public out there, or is that it? Looks like that's it. So Marcy, I would ask you to go ahead and lead our virtual public comment on Zoom. Thank you.
Thank you. I do see that we have a number of hands raised in Zoom. I'll ask to have the timer up. Thank you so much. And for those in Zoom, please remember to raise your hand or press *9 to raise your hand if you're a phone attendee, if you'd like to comment on this item, which is 15 on today's agenda. And our first speakers are Peter, then Steve, and then Kevin. Please unmute and state your full name.
Good afternoon. My name is Peter Rumble. I'm the Chief Executive of the Santa Rosa Metro Chamber of Commerce. I wanted to start by expressing my appreciation for how much time and effort the county is putting into this issue, the time the board has made to listen to the chamber and to the Downtown Association, the time your staff has made to do the same and to work so diligently on the various options that have come to you really over the last decade, not just before you today. And so I just really want to express my deep appreciation for all of that. You know that the Chamber and the Downtown Association has a strong position on this issue, and I know that others from the Chamber and the Downtown Association plan to provide some more detailed comments. So I'll keep my comments similar to those of Mayor Rogers and Councilmember Sawyer. Moving downtown has the potential of making such a tremendous multi-generational impact, reversing a decades-old poor land use decision, honestly. And coming downtown will unquestionably have a profound placemaking impact, a greater positive environmental impact, increase the accessibility of the county to the public, but also have a similar placemaking opportunity at the current campus with greater housing and commercial opportunities to be had. So I really encourage you, please come downtown, join us. We welcome you. I know that the Chamber and the Downtown Association are here for you as resources in helping ease that transition and supporting each and every one of your moves. So thank you so much, and look forward to your decision.
Please unmute and state your name.
Thank you. This is Steve Bertelbaugh with the Transportation and Land Use Coalition, and I too favor the move to downtown. The region has recommended that 40% of employees not drive to work. I don't know how that fits with your 30% calculation that people will work remotely, but it does indicate that the number of parking places could be considerably less than the ones that you're currently thinking about. On top of that, we've noted over the years that downtown Santa Rosa is overparked in terms of the available parking places. Many of them are vacant. And if the county were to shift, perhaps give the employees a little bit more in their salaries and ask them to pay for their parking, the parking issue will go away. That will shift a number of people into commuting to work by bus or by train or in a carpool. So those are my suggestions. I urge you to go for the Sears option. Thank you.
Please unmute and state your name.
Hi, Kevin Anderson here, youth climate mentor, downtown Santa Rosa resident, father, and advocate for future human life on our beautiful planet. And as a 9th generation Californian who has studied and witnessed the multiple iterations of our built environment, I am hoping we keep in mind the development patterns that have worked as well as the ones that haven't. What we've learned is that sprawl hasn't worked. It has gutted our traditional walkable neighborhoods, contributed to existential climate and environmental crises, created an astonishing level of unnecessary consumption, as well as the social isolation implications and inequitable effects on our BIPOC communities. About sound urban planning principles. My family lives in the West End and would welcome more density to meet our climate goals, increase affordable housing, support small businesses, and make it more exciting to be downtown. And how about connecting the built to the natural environment, including the daylighting of Santa Rosa Creek? And finally, maximizing the underutilized greenway, creating more safe and enjoyable places for everyone, especially our county's youth. And parking shortages, please. We human beings will find a way, especially as train, bus, bicycle, and pedestrian routes improve, which they will under your expert guidance. How can we expect other cities to develop sound climate and social policies if our leadership continues to push development away from downtown areas? In terms of money-related issues, this is an example of short-term costs versus long-term liabilities. If we're talking about the financial sheet, according to both common values and science, there is no bigger cost than climate change. How much longer will we kick the can down the road? The Board of Supervisors must be bold and lead by example. Please do the right thing for us in the future. Let's help build a new vision, a revitalized vision. Bring the Civic Center to the Sears site in its rightful central location. Please find a way. Thank you.
Our next commenters are Thomas, Alice, then L. Willard. Please unmute and state your name.
Hello, this is Thomas, and I'm also a member of the Transportation Land Use Coalition. And there was another site that's potentially available, as I understand, from Cornerstone. It'd be very interesting, a little bit larger site, so you wouldn't have to build as high. I think also I'm very much an advocate of going downtown just for exactly what the previous speakers have mentioned. The mayor, John Sawyer, and the most recent gentleman, in terms of the environmental costs that are not added into the calculation. That's a synergy for downtown development. One aspect, I think, is that was not included is the lost cost of the campus that you own, and then you benefit from that. In other words, the community will benefit from that increase in housing and development here. It's not perfect for the county to be there because, as Steve mentioned, really the transit is not available to you on your site, your current site. I want to point out that the bonding rate, the 30-year municipal bond rate, is 1.41% currently. So you can borrow at those rates, and there's no reason why you shouldn't borrow to do this building. I understand that doing design build makes it a little bit challenging to do that. It may be possible to have design and the RFP building. It's a little bit more expensive, but those things can be accomplished. There's still some things that are a little bit left unsaid, which is exactly how the $265 million gap of campus deferred maintenance would be overcome. So that would be something you would add. It's more than 3.5 million a year. So I'm not really clear about that. But the movement is good.
And thank you for your comment. That concludes the time. Our next commenter, please unmute and state your name.
Thank you. This is Alice Lynn. Please imagine a smart growth vision of the cities of Sonoma County as an interconnected network of transit-centered villages built up rather than sprawling outward, thereby protecting our green belts and ag lands from pressure to expand our urban growth boundaries when they each sunset. Typically, 50% of suburban land use is devoted to the parking and driving of cars, and 60% of urban land use is devoted to cars. To ensure the SMART train continues to operate long-term, to protect the investment in the SMART train and maximize train frequency to achieve a transit-centered future, we need to pack key land uses at the highest densities at each of the smart stations, with as many transit routes converging at our downtown primary hub, where goods, services, and government offices are located, to maximize ridership, which in turn makes more transit service financially feasible and politically justifiable. It doesn't make sense to invest in a train and then keep county administration in a transit hostile location, and then sink massive funds into building another parking garage, working at cross purposes to the train investment and our climate needs. Both the county and city of Santa Rosa offices should be located at, not near a train station, preferably at Railroad Square, no more than 3 blocks from the train station. Sears is the best option presented because of its proximity to SMART, but is too long of a walk from the train and will be faster to drive even for someone who lives near another SMART station.
Thank you so much for your comment. Please can our next commenter unmute and state your name?
My name is Willard Richards, and I will address only one of the many issues you must consider today. I'm endorsing the comments by Steve Bertelbaugh that the Planned Bay Area requires that no more than 40% of the workforce of large employers commute by car on an average workday. The article in Sunday's PD expresses doubts about being able to achieve that, saying that only 2% of county employees now compute by transit. That's easy to understand. The county property is only served by one bus that goes to the transit mall. Then people have to transfer or walk to the SMART station. Using transit is just not now practical. But moving to the Sears side would make it very easy and practical for the employees to commute by transit, and would open the door to the county for offering incentives for employees to do that. On the other hand, selecting the county site, building a parking structure, and allowing employees to park there for free will greatly increase the barriers to meeting the Planned Bay Area requirements. It will be expensive to reduce GHG emissions, but even more expensive if we do not. What we do in Sonoma County will have a trivial effect on global emissions, but what we do sets an example for others. They are paying attention to what we do. Let's lead. Please select the Sears side. Thank you.
And please unmute and state your name.
Hi, this is Jesus Guzman with Generation Housing. Good evening, Chair Hopkins and members of the board. First, just want to start by thanking the board and the staff for your time and work on this important initiative. We want to respectfully encourage the board to select the downtown site for the new county government center. Locating a new county government center in downtown has the potential of optimizing service delivery to constituents over the existing county campus site, given its proximity to transit, its central location, and existing county departmental offices as well. As an anchoring employer on the scale of the county of Sonoma, which would bring many jobs to downtown Santa Rosa near vital amenities, that's also in strong alignment with the county's strategic plan emphasizing climate action and resiliency. The downtown location would contribute to the revitalization of the downtown economy by infusing the city core with funds and services, along with increased foot traffic and patrons for downtown businesses, along with new housing that's currently in the pipeline. The top priority, of course, for generation housing. This move could help meaningfully transform the downtown core into a vibrant one with all of those ingredients together. So again, we respectfully encourage the board to select a downtown site for the new county government center, and want to thank you for your work and consideration.
And can our next commenter please unmute and state your name?
Good evening. This is Hugh Futrell, speaking as Vice Chair of the Downtown Action Organization. As you know, the DAO strongly supports the downtown relocation option. We're grateful very much for each of you on the board and your staff seriously considering that alternative. We have sent on to you a technical memorandum from the ad hoc committee of the DAO, and I won't go over those details except to draw your attention to a couple of particularly key points. One is, and I think this is pretty clear at this point, that the availability of the Sears site is an economic game changer. Apart from the value of the buildable site itself, the 779 structured parking spaces that come with it have a value, and I'm speaking now as a practitioner, of between $35 and $50 million, well in excess of the actual acquisition cost. It's pretty obvious that the Simon organization clearly sees a major positive impact on downtown economic activity from the transaction. Otherwise, it wouldn't have proceeded on a basis like that. The second key point is that there are good grounds to believe that to the degree there is a cost premium for going downtown, and that cost premium is a bit unclear. It's probably substantially overstated in the staff report. We've pointed out some numerous potential offsets against those costs, and they should be taken into account. The downtown option will, without question, help spur the most sustainable of all housing models, which is high density, core residential near employment services and transit. So we definitely encourage you to act on this option, and we're extremely appreciative of your focus, the work of staff, and the work of the city on this. Thank you very much.
All right, and our final commenter, can you please unmute and state your name?
I'm Jenny Doyle, and I'm calling to say that the county primary job is also to have decentralized services, and having the downtown hub doesn't do that. And it doesn't include the community groups, the fireplaces, fire and housing in the outside layers. And 35% of the county lives in the downtown area, but the rest of us are outside the area. And we need to look at how to decentralize the services and so that they're available to everybody. Doing that at the existing site, you have a smaller site and then have outreach along with Smart Train and everybody else. So I think the county serves the whole county, not just Santa Rosa. And perhaps the building downtown will be empty at night and all weekend because the employees will be gone. Thank you.
Thank you. Our next commenter, can you please unmute and state your name?
Hi, my name's Debbie. I find it extremely curious how our government has created an economic collapse, and then the businesses go under and they swoop up the land so that they can create more of their agendas to a new world order, stack and pack housing, no more driving. And it's very curious how that just all worked out. You're talking about building a wonderful new castle when your old one's not that old and you don't take care of it. Find it very curious. Reminds me of similarities to the Hunger Games. Thank you.
Hi, can our next commenter please unmute and state your name?
Good evening. I'm Tracy Cunyan. For full disclosure, I am a former county employee who no longer lives in the county as I moved to New York earlier this month. However, I did want to share my thoughts with the board and the public because during the last few years working in the Board of Supervisors office, I've heard from many constituents who wholeheartedly agree with the comments made and the reasons provided by Santa Rosa Mayor Chris Rogers, Councilmember John Sawyer, and Metro Chamber CEO Peter Rumble. In my experience, constituents for the most part want a consolidated government office that is accessible and allows them to address both county and city issues in one visit. Because what I've experienced and learned is that so many people are confused about what the county provides and the city provides, and having all those services provided in or accessible in one building, I think would solve a lot of the community's issues or meet their concerns. I so appreciate the concerns of Supervisor Rabbit. And as he has experienced in land use and design, probably more than anybody else on the board, I would hope that his concerns are addressed before moving forward. But I do believe a downtown location would meet a lot of the needs and desires of the community. Kudos to county staff for putting this all together. Thank you so much. I wish I was actually there to see this all happen. Thank you.
Thank you. And Chair Hopkins, that concludes public comment.
Thank you very much. And so I will bring it back to the board now for deliberation. And we do have a critical decision to make here. So I would look to the members of the ad hoc committee to kick off the conversation.
Last time. No, I appreciate that. And I appreciate everyone's comments and questions and from the public as well. And, you know, I don't see us having a land use decision today. I see us having a financial decision today. And I'm not sure that we have seen as much of the financial information that we need to make a decision in that regard. A developer who does a project in a downtown isn't making a land use decision per se. They're making an investment or a financial decision, and it's based upon those numbers that need to work. Right now, as we sit here, we have about 15%, to my understanding, of the amount needed to pay our mortgage. And we need to find the $47 million that remains, if it stays at $55 million a year, with ongoing funds within the next 4 years. Have we ever done such a thing in this county before? I don't think so. Last year, we struggled to get $1.5 million for ongoing fire services, and I was excited about that. I just believe that we need to sit down and show me that pathway. Beyond this sheet, show me how that works. I mean, the property tax rolls went up by over to $100 billion this year, and I think it went up, 4.33, 4.38, something like that. And it's going to add $1 million more a year. Can we count on that for the next 5 years to hold true? And how do we factor that in? I just believe that we need to sit down with the numbers and figure out what we could afford before we jump into the pool. It's not for lack of due diligence. Again, I think that we figured out the program. We figured out the sites, and I do agree that the Sears site is a nice downtown site. But it comes down to the dollars of that site versus this site and the difference therein. And that difference is really not just theoretical, it's whether you could afford it or not. We all live where we live because we live where we could afford for the most part. We make those decisions based upon all the other quality of life issues. Yeah, I could probably live in a more expensive neighborhood and cut back all the things that we do. And again, I go back to what's the opportunity loss for this county by pulling out $55 million a year in general funds to pay for a mortgage payment that is borrowing at a pretty good clip of interest, much, much higher than what was mentioned, for 30 years' time. I would feel more comfortable, quite honestly, having a workshop on that, and then deciding what to do once we all feel that we understand the ramifications of the financial decision in front of us, than just picking a site as a theoretical land use decision, because I think there is so much more in front of us than just that. So thank you.
Thank you, Supervisor Abbott. Supervisor Corsi?
Thanks. And in the interest of keeping it short, I didn't say this a little while ago, but I want to say it now, and that's just to thank staff for all your work, all your diligence, all your integrity around this. The amount of effort that's gone into this in the last 6 months has really been impressive, and I'm very grateful for it. I also want to acknowledge my colleague Supervisor Rabbitt's financial concerns here. You know, he's been consistent with the ad hoc in making sure that we are cognizant of the cost, cognizant of the architecture as well. But it's been a good experience to serve with him on this ad hoc, even though we don't agree here at the end. But you know, his concerns are real; they're legitimate. I know that all of us are thinking about those financial concerns as we make this decision today. But what we are being asked to do is to make a land use choice. Yes, this is a lot of money. I mean, even the best case scenario, this is $1 billion or more over the next 30 years. It makes me swallow hard. But we have to spend that money no matter whether we do it here or downtown. That's what the analysis shows. This is long overdue. The Board of Supervisors, when I was covering the board as a reporter in the early 1990s, was talking about building a new county administration center. We have to do it. So let's do it the right way, in a way that we can afford, in a way that also aligns with our values that go beyond just basic cost considerations. I'm talking about community values that we as the Board of Supervisors hold dear. I know this because I've heard us all say it. Things like climate action, city-centered growth, transit-oriented development, increased production of housing and affordable housing, and intergovernmental cooperation and collaboration. The Sears site downtown checks all those boxes. I know there are still questions about it. You know, you can look at the rubric and the scores are would make you think that this site at the county center is the best place to do it. But the rubric, as acknowledged, is very subjective. We could spend 3 hours or more arguing about, the scores and what they mean and what the questions mean. We don't need to do that now. We're also looking at cost difference here. And the reason that we're not seeing detail is because the answer right now is it depends. The cost depends. Depends on how much we have and are able to spend. It depends on how much space we allot for each employee, each desk, each chair. It depends on parking. I want to talk about parking for a minute because this conversation over the last 6 months has revolved around parking a lot. It's a realistic need that we have in 2021. But what will that need be in 2071 when we're still going to be using these buildings? Will we need 2,324 parking spaces 50 years from now? I hope not. We should be starting now to reduce that number. Motor vehicles produce more than 60% of the GHG emissions in this county. Reducing their use should be job one for all of us right now. We can do that downtown. Today, we have a chance to make a generational decision, a chance not just to state our values, but to lead with those values. Let's commit ourselves to our values and to a better future. And let's choose the Sears site.
Thank you, Supervisor Corsi. Supervisor Gorin?
Thank you so much. I was the supervisor about a year ago that I was talking with Cheryl and Caroline and say, what are we doing thinking about moving to the downtown site? Clearly, that is not what our employees want. Clearly, that is not where we intend to go. And yet, as the chair of Sonoma County Transportation Authority, the Regional Climate Protection Authority, now serving on the SMART board, and looking at the generational change that we have in front of us. Rarely does an elected body have the opportunity to make a decision that will change patterns of transportation, thinking, economics for generations to come. Now, guess what? I have totally shifted my thinking. Absolutely, we need to move downtown. I think I've always said the Sears site makes infinitely more sense than the White House site because of its proximity to the SMART station, because of its proximity to already existing parking, because of its proximity to the Prince Memorial Greenway, and just as importantly, an opportunity to finally reverse the planning, the planning mistake made decades ago in putting the Santa Rosa Mall in a position that would separate forever Railroad Square, downtown Santa Rosa, and leave all of us shaking our heads saying, how do we get from one side to the other? This is not city-centered growth. It's not friendly growth. It's not pedestrian growth. It is absolutely abhorrent to me that a previous council made that decision. Here's an opportunity that we can densify, we can build up on the Sears site and create the movement from one side of the downtown to the other, to the SMART station, to the transit mall. And this is absolutely the direction that we need to go. And I spent some time as mayor of Santa Rosa trying to discuss the viability with Simon on punching through the mall to create a lifestyle center. And, I'm sort of a little doing a little happy dance that, oh, I was right, you were wrong. And in fact, the Simon shopping centers that converted to lifestyle centers are doing much better economically than the former enclosed malls that they're left holding the bag. I see the potential here that is so exciting. And I've already said I will not be supervisor when we move into this site, darn, because I'm very excited about occupying the space. I've always been a person who loved urban environments. The energy that you feel walking in downtown, eating in downtown, meeting people on the road. And the only way our county employees can have that community is by walking back and forth to Pete's Coffee. A number of them do, but it's not the most energizing experience as we pass by that now storage area for big sewer pipes. So I think this is the right way to go. However, like Supervisor Rabbit, I'm very concerned about how we get there, how we pay for it, what our mortgage payment is going to be, which is why I was trying to see where the chinks in Peter Brulin's financial forecast was going to be. And he's the number wizard, I am not. And there are just a few little chinks we could add to that. I think the cost savings will come in us looking realistically at how many jobs will move down there realistically, where we keep our existing services, where we move some of our existing services on the county campus as critical mass for those services staying here, and the regional neighborhood service centers. And Health and Human Services and Caroline Judy have known that I've been pushing for this solution for probably 5 years to better connect the communities in need in the Springs area to the services offered by the county. It's what I've been working on for 8 years, and I will continue to work on that. So I would offer to my colleagues and to the community, we have an incredible opportunity in front of us, and that is the site of the Sonoma Developmental Center. We don't necessarily have a large parcel of land available for building or converting or leasing a building, except at the developmental center. It's not quite in the heart of the Springs, but we do have the opportunity to make an investment in the future transition of that site. So unambiguously, I'm a supporter of the downtown site with strong regional center, neighborhood center connections to the community. It's not going to be cheap. It's not going to be really thrifty to do that, but it is absolutely the way that we need to go. So thank you again to my colleagues. I share your concerns, Supervisor Rabbit. Let's get our scratch pads out. Let's do some mortgaging of some of our assets. Let's sell that Sinead Center, and let's really build on the county center to recognize and realize revenues to the county. So thank you so much, and full speed ahead.
Thank you, Supervisor Gore. And Supervisor Gore?
Yeah, before I get going, I do want to, Supervisor Gorin, you mentioned downtown site, but are you talking about the Sears or are you talking about the White House site?
Thank you. I thought I was specific in talking about the Sears site. That was the location that I've always been supportive of.
Okay, great. Thank you. So the sign behind me says, "Don't go back. You're not going that way." In my virtual world, I wish I was there with you all, but since I've joined this board, I want to say thank you to the colleagues and to the community, because we've been able to make investments, longstanding investments that have changed the course of this county. Roads, number one. Number two, pensions, lower than they've on the trajectory we want them to be. Labor deal and labor peace. Investments in our community and our health network. And now another one, which was put on all of our laps, this issue of deferred maintenance, this issue of this being not the future, and where is the future? I say where because basically the what is one side of the future, but the where is the other side. I've been an advocate for downtown, that stacked benefits, the investment that it'll bring to the wider community, the fact that public dollars achieving public impact is puts us in a position of a different case, not trying to overspend, but definitely that investment. So I'm going to cut to the chase and just say that I am very supportive of the Sears site. I was very supportive of co-locating with City of Santa Rosa in the downtown area beforehand. What we choose to develop, what partnership we choose to embark upon, private and public, mixed use to lower our costs, to provide other opportunities and mixed use on the site is something that I'm excited about taking on. But at the same time, our staff needs direction from us. This has been a 2-year process on trying to identify where. And so the decision today is where. And the where for me is the Sears site and sites in our districts. We already have the Petaluma site. We tried to get the Cloverdale one up. Going to continue to try to do that. The priority right now, I know, and I support this, is West County and East County and North County and all the others. So once again, I want to thank the staff for what they've done and embark us upon a process to figure out how the what supplements the where. But the where, if we weren't in the business of looking at this and looking downtown, the Sears site wouldn't have come upon us. And it's a far superior site, and I look forward to figuring out how we do dramatic redevelopment and redeployment of this site as well. So thank you.
Thank you, Supervisor Gore. I actually am reminded of some of I think one of the phrases that Supervisor Gore sometimes uses, which is own the future, right? How are we going to own our future? And then I think the equally important question, right, is how much is that going to cost? And the cost is a concern, but I also have to look at sort of what has been the cost of the past, right? And the cost of our past land use policies, right? And our sprawl and our car-driven lifestyle is completely unacceptable in the form of the catastrophic wildfires, the floods, the droughts, the skyrocketing record temperatures, the heat dome over the Pacific Northwest that apparently killed billions of mussels and intertidal creatures. I mean, what we are seeing is a new climate reality that is largely driven by horrible land use policies throughout, the world, but especially in California, which really came of age in the era of the cars. And so, I support the Sears site. I also will continue my adamance, I guess, all along, which is we do also need those neighborhood services site. And for me, when I look at choosing the Sears site, I also want to, with that, look at what kind of cost-cutting measures can we incorporate into that decision? Can we reduce sort of the footprint per person, in terms of office space? Can we look at open office models? And can we look at potentially a more virtual, remote working world than, that number that we currently have, which I believe was 30%, if I'm recalling correctly? Yes. And I would definitely be interested in considering that transition, and that sort of the trade-off would be choosing the site that we feel like economically and environmentally and socially is the right site, recognizing that we will need to be cost aware as we move forward in our design and our decision-making processes. And, I also want to acknowledge Supervisor Rabbit's request for a financial workshop, and I would wholeheartedly support that. I think that it would be great to really dive into this, to look at long-term sort of future fiscal forecasts. I mean, I know that we looked at taking 1 million a year, I believe, of the TOT growth. Well, what does TOT growth look like in 10 years? Do we have estimates for that? Do we have economists that are on contract with the county who could potentially provide us with some sketches of some of the potential funding sources? And then, are there opportunities for federal and state funding? Are there opportunities for grants that would incentivize this kind of transit-oriented development, right, and help us out with this project? So I think that we can make a decision on principle, but then we do need to deal with the fiscal reality and really dive into those details and tackle them, and not just say, hey, we're going to push that off to a future board, because that's the easy thing to do politically, right? I would like to take care of as much as we can financially now, and really leave us in a fiscally sound position that, quite frankly, we're not in right now. And some people think, oh, you can just use these buildings. And yet, I know, Caroline, can you attest to the fact that these buildings are beyond their lifespan? I mean, we have these conversations every year, and we have a, deferred maintenance list, hundreds of millions of dollars long, and we have a fraction of the amount that we need. And so these buildings are energy inefficient, right? They are not transit oriented. They don't achieve that vision that I really want to create for future generations. And I'll just end on one thought, which is we had a controversial decision at the Bay Area Air Quality Management District, which was requiring greater standards for oil refineries. And one of the things that came up actually was how children now fear for their future. And wouldn't it be great to actually give some hope, some inspiration, some next generation development to leave the next generation? And one of the things that I brought up that really just still hits home with me is that there was a survey in May of 4,500 high schoolers, I believe they're high school seniors, and they were being asked about what the greatest barriers to learning were for them. And more than 7 out of 10 high school seniors in Sonoma County listed anxiety about the future as their top deterrent for their ability to learn, which was anomalous actually in the country, right? Which I think just shows the impact of the repeat trauma and the wildfires that we have experienced in Sonoma County. But, it feels like it's about time to give the kids something other than a really hot planet. And so I look forward to this conversation going forward. Any other remarks from my colleagues on the board? Otherwise, we do have a motion to make. We do have a site selection as part of that. So I would entertain a motion if anyone.
Want me to move all these at once?
Your call.
I move on A that we select the Sears site for the new county government center. And I also move B through E.
Do we have a second for that motion?
Second.
And Marcy, I would ask for a roll call vote on that item.
Supervisor Gorin,
Aye, enthusiastically.
Supervisor Rabbit,
No.
Supervisor Corsi,
Yes.
Supervisor Gore,
Yes.
Chair Hopkins.
Yes. And so that motion does carry, and we will be moving forward then. Thank you so much to all of our staff who have worked so hard on this project. And thank you also to all the members of the public and the mayor and council member who came in to participate in the conversation. This is a really big topic and a big conversation to have. And so it's wonderful to have such thoughtful remarks from members of the public and people really engaging on this issue.
Thank you, supervisors.
All right. So with that, we will now go ahead and tackle our board member reports on aside boards, councils, commissions, or other attended meetings. And we did postpone this last week, so I feel like we need to do it this week because we're not going to meet for another couple of weeks. So does anyone have their calendar ready and is ready to go ahead and share about the meetings that they have attended? Supervisor Gore, you can jump in?
Yeah, I can jump in. Last week, met with the North Coast Resource Partnership, which is 7 counties and 34 tribes north of us. Supervisor Hawkins, you joined me on that. We moved forward with a variety of different initiatives and a great deal of excitement about state funding coming through that and potentially to Sonoma County as a part of that. Supervisor Hopkins, I just want to let you know that one thing that we did do, the exec board, we changed Chris Howard from Del Norte County with the new supervisor, Nancy Ogren from Siskiyou County. You and I had talked about getting the right folks involved in that exec committee. And so that's one thing. On the second thing, I want the Board of Supervisors to know that the second week of August, at the end of that, there's going to be a regional CSAC meeting on homelessness. And it's not going to be just a general meeting on homelessness. It's going to be specific about the trailer bill that was signed by the governor in Sebastopol that I was able to attend with Chair Hopkins. So thank you very much. That's it.
Thank you, Supervisor Gore. Supervisor Gorin?
I only have a few things to report. Last week, we had an SCTA RCPA meeting, and I'm not remembering exactly if anything was remarkable, other than we did appoint an ad hoc committee. I believe I mentioned that last week to explore funding mechanisms to implement the climate mobilization strategy. Thank you, Supervisor Hopkins, for agreeing to chair that. I really want to thank all of the folks at Transportation and Public Works for their amazing job in a 2-year project of replacing the Boys Bridge. Okay, here are the scissors I used to cut the ribbon, and a number of folks from the community came out. They were so grateful to have this bridge open again. It's a major connector in the Springs, and I think this week they're opening the bridge, so they're ecstatic about that. Let me see what else we had. And I believe, I think we have we had a SMART board meeting last week, and thank you, David Rabbit, for chairing that. And we had both a Petaluma Valley GSA meeting last week and a Sonoma Valley GSA meeting this week. So we're getting close to completing the details of the groundwater sustainability plan to be approved this year.
Thank you, Supervisor Gorin. Supervisor Rabbit, Supervisor Corsi, do you think you can go off of memory? Of course, right as we go to report out.
I just right now ran out of juice on my device, so I'm going to have to catch up with you next week.
All right,
or
fair enough.
next meeting.
Supervisor Rabbit?
I got through the 22nd. I was trying to go back. Bay Area Toll Authority meetings, MTC meetings, a whole bunch of those. Board meeting, I think twice since we've met or since we've reported out, plus a couple of other meetings. I will say that it was the consensus, at least with the North Bay commissioners, that our SB1 funds be directed towards Highway 37. in this next cycle, or cycle 3 that's coming up. The Bay Area Regional Collaborative, which meets by state law, which is really BCDC, Air District, ABAG, and MTC to try to coordinate efforts. That met. Plan Bay Area 2050, the Tribal Summit. It's the 3rd Tribal Summit that we've had for this Plan Bay Area 2050. We did notably the Grayton Rancheria folks were on the line with us, and that was a good conversation. SMART board meeting, as Director Supervisor Gorin mentioned, and Golden Gate Bridge, I think twice. One special meeting, one regular board meeting, plus all the different committee meetings. And I have held or co-hosted a couple of Marin Sonoma drought meetings with Supervisor Rodoni, kind of with all that ag piece that we kind of share out west of Sonoma, or Petaluma and West Marin, coordinating the efforts and making sure that we're staying on top of the water issues with ag folks out that way. And I'm sure there's a few other things, but I think that is really the highlights for now.
Thank you. And for my part, we did have an EMS ad hoc and a fire ad hoc meeting, as well as I attended the Bay Area Air Quality Management District meeting that I referenced earlier. And I actually also had a meeting with Supervisor Rodoni and Supervisor Williams from Mendocino regarding a potential kind of coastal cleanup trash project across the 3 counties in terms of, branding and partnerships between regional parks and state parks. So more information may be forthcoming on that at a future date. Never mind. My first 5 commission meeting was canceled, so I did not attend that one. And with that, I believe that
through the chair, if I may, just
Supervisor Abbott.
because I think this one is important. So through the MTC and the Programming and Allocations Committee, we are putting out just under $1 billion on the first tranche, which is 60% of the ARPA funds, to the 27 different transit agencies in the Bay Area. And for the North Bay, Marin County felt that they were a little short in what their allocation was, which is based upon a negotiated and pretty convoluted formula that actually ends up working somehow, some way, for the most of the time. Marin Transit added some bus service during the pandemic. The intent of ARPA was to restore service to the levels prior to the pandemic. It made no sense to cut service, so we advocated for a couple $1 million more to fix that. And then also in Sonoma County, the operators up here, including SMART, working with Brian Albee, working with Rachel Edie, right, from Santa Rosa City Bus, and then Petaluma Transit. We believe that we've got about 4.7 million coming, in addition to the, I believe, 19 that was allocated originally. So a little extra money in the North Bay to take care of those couple of one-off issues. So it was a good outcome, because I know that everyone is trying to restore their service, restore their ridership, and make sure that they can move forward in a positive way. Thank you for that.
Thank you very much, Supervisor Abbott. And now, without further ado, we will be moving on to public comment on matters not listed on the agenda, but within the subject matter jurisdiction of the board and on board member reports. And so I will look outside. It looks like we do have one member of the public who wishes to speak. So they're welcome to come in. Thank you for sticking with us to the bitter end, Mr. DeWitt.
Thank you. It's never bitter to be with you folks. My name is Dwayne DeWitt. I'm from Roseland. A number of years ago, I helped to get some grants from the United States Environmental Protection Agency for what were known as brownfields analysis along the Sebastopol Road corridor. I wanted to mention to you this because you could look at what occurred on that successful grant application to seek out funding to help with the Roseland Library Center. If it was built within the commercial corridor, which was considered a brownfields area, working with the city of Santa Rosa, they could go for what are called community-wide area planning grants for millions of dollars to help on revitalizing this disadvantaged, underserved, and overburdened community that is still overlooked. 4 years ago, annexed into the city at the time of the Tubbs fire. And essentially, Roseland became a victim of the Tubbs fire. People don't see that because they only looked at where things burned. But then there was the neglect, the area that didn't get served because all attention went to Fountain Grove and Coffee Park. Bless their hearts, they had to have redevelopment, we understand. You folks could do a real positive thing if you would have the people, the staff at Community Development Commission release the information that came from that grant. People in the community never heard what happened. It's like they just dropped us after we helped get the grant. We didn't hear back. It's years down the road, the money's all been spent. We have to convince the city to go after the next level. So please help us to do that and have a collaborative approach for redevelopment of the Sebastopol Road corridor using the Roseland Library Center, a tech center, a community center as its anchor. Thank you for your time.
Thank you very much, Mr. DeWitt, and have a great evening. So with that, we will go ahead and accept public comments via Zoom. And I apologize, I didn't mention a time beforehand, but let's, due to the lateness of the hour, stick to 60 seconds, please.
Thank you, Chair Hopkins. While we sort through the deck and pull that one up, I will ask that our members of the public please raise your hand in the Zoom app or press *9 on your phone keypad if you want to speak on this section matters not listed on today's agenda. Our first individual, can you please unmute and state your name?
My name's Debbie, and you've wasted our time talking and talking and talking. And now you're giving us 1 minute. This is unacceptable. I was there today earlier. No respect for the people's time. It's a crime and a violation of your oath of office to conduct public meetings in this way. You act like you're a royalty sitting sequestered in your big chambers. You've forgotten what your oath of office even stands for, what this United States stands for, and you're trying to remove our God-given rights. You have no authority to remove. You do not grant our rights. Your job is to uphold the contract, the Constitution, state and federal, which was written to protect our rights. Now, I'm not going to be able to say everything I want, so I'd like to tell you something and you may have forgotten. We hold these truths to be self-evident that all men, including you and I, are created equal, that we're endowed by our Creator for life, liberty, and the pursuit of happiness, that to secure these rights, governments are instituted among men, deriving their just powers from the consent of the governed. We do not consent anymore.
Thank you for your comment. Our next commenter is a phone attendee. If you can please unmute by pressing *6.
Yeah, this is Rob McGilly of the 9/11 Truth Campaign. Amen, lady. To We the People, State of California's Commission on Judicial Performance. 1. This is the second time the 9/11 Truth Campaign in Grayton, California, has asked for justice from We the People's Commission on Judicial Performance. On December 11, 2012, we mailed a 295-page missive entitled Cry for Justice that proved 9/11 was not an act of war. By the late United States Senator John McCain. He died leaving a $16 million estate from his career in government organized crime. 2. On 9/11, power-crazed and sex-starved President George W. Bush botched to sponsor desperate Enron builder Ken Lay's plan for 9/11 by leaving his wife in the White House to face certain death on 9/11, to become a bachelor again. Puppet bad boy born again Bush tried to save Enron from bankruptcy by having Bechtel in San Francisco.
And thank you so much for your comment. Our next commenter is a phone attendee. Please unmute and state your name when prompted. For this phone number, there you go. I see you've unmuted. Can you please go ahead and state your name? You're muted again, so you'll need to press *6 now. And you should be able to begin your comment. But you may have mute on your phone as well.
Can you hear me?
Yes, please go ahead.
Okay. On 9/11, this is Karina from the 9/11 Truth Campaign. On number 2, on 9/11, power-crazed sex star President George W. Bush botched his sponsored, desperate, unrun builder Ken Lay's plan for 9/11 by leaving his wife in the White House for certain death on 9/11 to become a bachelor again. Ken Lay and his puppet, Bad Boy Born Again Bush, tried to save Enron from bankruptcy by having Bechtel in San Francisco attached. Exhibit A, build a pipeline to Afghanistan to deliver Caspian Basin natural gas and oil to communist China. Exhibit B, to make more Macy's merchandise and Walmart widgets with slave labor and ship them under the Golden Gate Bridge for communist China top foreign agent Wizard Deception Willie Brown. To supply his clients in California with a sell-it racket. Number 3, the New York and New Jersey Port Authority.
Thank you for your comment.
Weeks.
Next commenter is a phone attendee.
Okay. Number 3 is Rich from 9/11 Truth Campaign. The New York and New Jersey Port Authority and 6 weeks then new 99-year-old World Trade Center lessee Larry Silverstein exploiting Ken Lay's desperation resulted in 2,800 bad boy born again Bush caused unplanned murders when he controlled demolished the planned empty Twin Towers on 9/11. FEMA lied that the Twin Towers collapsed on 9/11. Top Enron speculator seized Candyman Warren Buffett saved First Lady Laura Bush from her husband's treachery. But saving her on 9/11 caused over 2,800 New Yorkers to be demolished by preset explosives set by New York and New Jersey Port Authority that had to destroy the lethal asbestos-loaded towers. Tenants were dying from mesothelioma. Today, over 3,000 New Yorkers have died from mesothelioma since 9/11. The exact number is not public. 9/11 was government organized crime at its finest. Number 4, on May 16, 2012.
Thank you for your comment. Our next commenter again is a phone attendee.
This is Daniel from 9/11 Truth Campaign. On May 16, 2012, we got a letter from Karen Clay, your staff attorney, stating there was no support for any allegation of impropriety by the judge you named Judge Gary Nadler. Our County of Sonoma Board of Super Puppets, 11 Congresses, and top intended 9/11 benefactor Willie Brown play every trick in the book to conceal the truth about 9/11 and silence the 9/11 Truth Campaign. Number 5, it is we the People's Commission on Judicial Performance sworn duty to support and defend the Constitution for the United States and for California as overseers of our superior courts and judges. The 9/11 Truth Campaign is not getting due process or equal protection of the laws guaranteed to them by the First Amendment in the U.S. Constitution. In 2008, County of Sonoma Superior Court Judge Gary Nadler denied John Jankel
Thank you
his
so
First
much.
Amendment right.
That concludes the time. Our next commenter, please unmute and state your name.
Yes, I am continuing with this document. In 2008, County of Sonoma Superior Court Judge Gary Nadler denied John Jankel his First Amendment rights by ordering a $349,760 default court judgment in favor of Paul Hobbs Winery, LP, against John Jankel, despite him attending over 20 hearings on the matter. This $349,760 default court judgment was based on a lie to the court by Hobbs' attorneys that 8 perfectly healthy trees died in less than 2 years' time after they were inundated with well water on a 13% slope. This resulted in the county of
Thank you.
Sonoma
That concludes
seizing.
the time. Our next commenter is also a phone attendee.
Mary Morrison, this $349,760 default court judgment was based on a lie to the court that resulted in the county of Sonoma seizing 6.53 acres of John's working carriage horse farm. The sheriff public auctioned 6.53 acres of John's stolen real property for a total of $51,000 to landlocked sole bidder Paul Hobbs Winery LP. Everyone else was turned away at the door. The county and Hobbs got away with it because it was ordered without trial by jury and without any cross-examination. On January 4th, John was ordered a vexatious litigant. And by the way, I want to say we have waited all day. We've been here since before 3 o'clock, and you only give us 60 seconds. That is, it's obvious you don't want to listen to us, but please don't insult us on top of it. And we're holding 20,000 children, immigrant children, at the border for pedophiles.
Thank you so much for your comment. That concludes the time. Can our next commenter please unmute and state your name?
Hello, this is John Schenkel. I am sick of your operation there. You're giving us 1 minute when we're trying to save our democracy. We are in debt up to $28 trillion, and nobody seems to give a damn. Just the interest on that money, it takes all the money this country makes. We are doomed. We are doomed. And then on top of that, you give us only a minute to even talk to you. What the hell are you thinking about? Really? And you're going to talk about moving our county administration center, which is right down the road here for us, handy for everybody to a highway, and you're going to put it 9 red lights away from that. That's just ridiculous. It's absurd. Could you please think about this in the future and allow we the people more time to reason, to tell reason to you, to learn.
And thank you
to
for
try
your
to get-
comment. And I will remind everyone that it is just 1 comment per person per section of the agenda. So Chair Hopkins, that will conclude public comment.
Thank you very much. And with that, I believe that our meeting has come to a conclusion. And so we will go ahead and adjourn. Our next meeting is in August. We have a date. 17th. Thank you very much. August 17th. Appreciate that. Take care, everyone, and have a good night.